Good morning, everyone. Very warm welcome to all of you at our conceptual brainstorming integrated session of anatomy at this beautiful platform Cerebellum Academy. So let's start this bullet train anatomy version 2.0 conceptual brainstorming integrated anatomy at this beautiful beginning of the day. So hope my audio video everything is okay. Please comment. I can see the comment from the Tahir Pitirisis. Yes, DRSS. Yes, Spider-Man is with me. Don't worry, Spider-Man will come. Okay, but first target, we have to focus on the study. Our first target to crack the exam. Okay, this is Spider-Man, this Iron Man, this all the things they will come to you for better memory to consolidate your memory. So everyone, hope you all are ready. Okay, please comment. Please comment that everything is okay. Okay. So yes, we are going to start this session. Good morning, Arindam. Good morning, Jay Devanshis. Yes, Harindra. Good morning. Okay, so hope everything is okay. So let's start this beautiful session with the beautiful lines. Yes, before starting the class, few important instructions I want to tell you. Yes, we want to recall to our God, to our parents, to our teachers. Remember, beta, creativity is contagious. Pass it on. We are going to learn the many things which we gain from our teacher. I learned from my teacher, and now I'm passing this creativity to you. Now it is your responsibility to spread this knowledge for the welfare of the human society. Yes, we are remembering to all our social support, our parents, our family members, everyone. As well as before starting this session, I want to say you the focus and enjoy. Follow one course until success. Remember beta, आदमी या तो जीतता है या फिर सीखता है, आदमी हारता कभी नहीं है. आदमी हारता उस दिन है जिस दिन वो कोशिश करना बंद कर देता है. So what I want to tell you, what I want to request you, focus for this session and don't forget to enjoy. You will too much learn from this session, more than 100 plus topics in your current exam. So we are starting this session with the beautiful lines. मुश्किलों में भाग जाना आसान होता है, हर पहलू जिंदगी का इम्तिहान होता है, डरने वाले को मिलता नहीं कुछ जिंदगी में, लड़ने वालों के कदमों में जहान होता है. So with this beautiful lines, we are going to start the very important topic, that is our anatomy. We are starting from our basics. I want to tell you, this is the session approximately 5 hours, or maximum we can go for the 6 hours. Okay, so what I want to tell you, entire anatomy we are going to cover here. Okay, so already we had learned many things, so we are going to revise properly. So what I want to tell you, sir, we are going to look for this one, and also this file will be shared within the app as well as in the Telegram group. Okay, so only focus for the class. Okay, so we are starting from the basics. Focus. This file will be shared. So let's start this session. First of all, yes, good morning everyone. Yes, okay, so first of all, what is the anatomy? Better break the name and get the idea. Always I start the class from this point. Ana means to see. What you have to remember, sir? Ana means to see. Yes, please come at the our YouTube channel better. Just few technical issues I am getting here. File is just okay. Just wait for 1 minute better. Yes, so let's start this session. Ana means to see and Tommy means cutting. Agree everyone? What is the anatomy? We have to cut and we have to observe. Now, what we have to cut and what we have to observe? Remember, beta, we are starting from the very basics. Then we will cover entire anatomy, and not only our anatomy will be limited to the bone, muscle, nerves, and our, yes, only pure anatomy part. We will integrate this anatomy with all the our other different subjects, all the other 18 subjects, and we will cover more than 100 plus topics which are going to ask in your next exam. So in anatomy, we are cutting the human body. So we all are the students of the human anatomy. We are not the students of the plant anatomy or the animal anatomy, zoology or botany. Okay, sir. So now tell me, beta, when we will cut the body, what are the different structures? What are the different structures which you will see? Now see, learn the anatomy in your own body. Yes, I'm coming to close. I'm coming close to you. Yes, see here, beta. When you will observe the body, the outermost layer, tell me what is the outermost layer? Yes, what I'm going to tell you. In our anatomy, in our body, there are the cubital fossa, popliteal fossa, femoral triangle, triangles of the neck. Many spaces are there in orthopedics, as well as you will see in your different kind of the other subject. You have to look for the surgery. Even in the medical field, you have to look for the different layers. So entire this fossa, triangle, spaces in one line. Tell me, beta, क्या दिख रहा है? Sir, outermost layer is the skin. Just below the skin, you will get, sir, there is the layer of the fat. Fat is known as the fascia. Below this fat, you will get, there is the collagen. Collagen is nothing, that is the, yes, tough layer. So it is deeper to the upper fascia. So upper one, first one was the superficial, another one is the deep fascia. Now touch the body. What is this? Sir, soft structure, they are the muscles. And now touch the deeper part, sir, bone. 5 layers. Yes, revise with me. This session is for the previous year topic, previous year questions. We are covering the theory part also, which are important. We are going to revise quickly, as well as, yes, we are doing chanting also. So do chanting. What are the 5 layers? रटना नहीं है. Anatomy is very conceptual. बेटा एक बार में पूरी anatomy आपको याद हो जाएगी. See, what are the different layers? Sir, skin, then superficial fascia, then deep fascia, then muscle, and then bone. Everyone. So these are the different layers. Tell me. Are you getting the point? Yes. Okay, yes. So these are the different layer. When you're cutting the body, the different layers which you can observe, sir, that are the skin, then superficial fascia, and then a deep fascia, and then there are the muscles, and after the muscles, you will get the bone. Agree, everyone? What I want to tell you, within this superficial fascia, you will get the fat. Also, you will get the cutaneous nerves and vessels. So, surgery integration. Whenever you are cutting the body layers, you can cut this cutaneous nerve and vessels, and the different kind of symptoms may appear. Agree, everybody? Like inguinal hernia surgery, you may cut the ilioinguinal nerve. MCQ from the surgery. Now, deep fascia, sir, it is made by the collagen, and there are the muscles and the bones. I think there is no problem. Do chanting with me. Yes, Dr. Ninad, good morning, beta. Yes, Dr. Munir, Vinny, very good, Vinny. Yes, ऐसा comment करना है, ऐसा chant करना है. Yes, what you have to remember, बेटा, सिर्फ तुम ही तुम हो तो क्या तुम हो, सिर्फ हम ही हम हैं तो क्या हम हैं. स्टूडेंट बिना टीचर नहीं और टीचर बिना स्टूडेंट नहीं. तो मिल करके इस इंजॉय को हम इंजॉय करते हैं, लर्न करते हैं और इस तरीके से पढ़ते हैं कि एनाटॉमी दोबारा हमको रटने की जरूरत पड़ेगी नहीं. ओके, सो डू चैंटिंग विथ मी. व्हाट आई वांट टू टेल यू, व्हाट आर द डिफरेंट लेयर? Sir, skin, superficial fascia, deep fascia, muscle, and the bone. These are important to remember the different concepts of the our surgery. Then forensic medicine, dissection, orthopedics, ENT, ophthalmology, even the your medicine, surgery, obs, gynae. Yes, because you will go layer by layer. Now I am putting one example. Suppose we are cutting the body, yes, transversely. Then what will happen? What are the different layers? Then I will show you the 3-dimensional anatomy. You all know that Tony Stark, Iron Man, got death, and he transferred his all the knowledge to the our Peter Parker. So now the Peter Parker is handling our Jarvis. I will teach you all the things with the proper 3-dimensional way. I will show you each and every muscle in quick way. So this is our arm. We are going to cut this portion transversely. So tell me, beta, tell me. Yes, full integration. Shrirath, yes, here is a Shri, our, yes, Dr. Dharani, good morning, beta, good morning. So make the chat box interactive and enjoy this session. We are going to do the transfer section. Focus. When we are doing the transfer section, you will get one, yes, outermost layer. Sir, this layer is made by the skin. Agree, beta? Every time I teach this basic concept, so just keep the patience. It is very important. Just below this skin, what you will get? Tell me, beta. Sir, there will be the our superficial fascia, which is made by the fat. We are making this layer with the yellow color. Sir, this is our superficial fascia. Now tell me, after the superficial fascia, which layer? Sir, there is the deep fascia. Sir, there is the layer of the collagen. Tell me, beta. Tell me. Yes, sir. This is our deep fascia collagen. Agree, everyone? Now the deepest most structure in the our transverse section of the arm, sir, there will be the humerus. Suppose this is our humerus, triangular shaft. So you will observe, sir, muscles are attached with the bone. They are taking origin and insertion. Agree, beta? सबको समझ में आ रहा है? नहीं समझ में आएगा बिल्कुल पूछना. Okay? Yes, Aditi, you are right. Very good, Ninad. Yes, Priyanka, right, better, right, correct. So now you will see the deep fascia is sending the partition which is getting attached to the our shaft of the humerus. And stay tuned, Peter Parker, the Spider-Man will come in between the session. Okay, so get ready for that surprise. But yes, first task to focus over the our concept. Now you can see, sir, these are the our different layer. You can say, sir, this is the muscle and the final layer is the bone. Again, revise better this basic concept. No excuse for the ortho, no excuse for the surgery, medicine, obs, gynae, any subject of the medical science. Sir, skin, superficial fascia, deep fascia, then muscles, and last is the bone. Okay. Now, what I want to tell you, in FMG exam, there was the one question, neurovascular bundle. Sir, each compartment requires their nutrition and now supply. So you will observe in each compartment, there is own vein. So खुद को जिंदा रहने के लिए blood चाहिए ना? So there is the own vein in each compartment. Sir, this is the our partition. So you will say septa. It is in between the muscle. So you will say, sir, muscle. Yes, in between, that's why intermuscular septa, just like the match in between the India and Australia. Very sad, the final match. Okay, but yes, international match. Remember, नाम को तोड़ो और सोचो. Yes, शेक्सपियर ने कहा है नाम में क्या रखा है, लेकिन हम इंडियन तो मिर्जा गालिब के फैन हैं. रिमेंबर बेटा, मिर्जा गालिब कहते हैं सारे राज नाम में दफन रहते हैं. ब्रेक द नेम. इंटर in between muscular muscle septa means partition. So intermuscular septa, yes sir, it is modification of the deep fascia. It is dividing the arm into the two compartments. Suppose this is the front side, anterior compartment. Suppose this back side, posterior compartment. Look in your body, sir, this is the arm. So here is the front compartment, anterior compartment, and there will be the back side, posterior compartment. Agree everyone? Aram se beta. Every building block, every brick we have to keep patiently, then the speed will be very high with the bullet train, with the supersonic speed. Okay, so keep patience first. Okay, so what you have to remember, perfect Nimra, you are right, you are giving the answer of the our AIIMS INICT 2018-17 pattern. Very beautiful. So this is the vein, and then deeper structure artery. Artery will lie deep, and then you will see the nerve. Nerve is deepest structure. God told these are very important structures of the body, so we have to protect this all. So there is a deep fascia modification around this structure. Deep fascia modification around this structure. This is known as sheath, like carotid sheath. Yes, the deep fascia around the carotid vessels, carotid sheath. Deep fascia around the axillary vessels, axillary sheath. Deep fascia around the femoral vessels, femoral sheath. Getting the point? Yes. Deep fascia around the rectus abdominis muscle, sir, rectus sheath. Okay, so all concept I'm putting here, sir, these are our different structures. You can remember these things as the our beautiful way, sir. Vein, then artery, and then nerve. Now you all are aware vein plus artery is equal to vessel, and this is the nerve. So can you tell me vessel plus nerve is known as? Yes, very good Rakesh, very good. Now what you have to remember, nerve plus vessel is equal to nothing. This is the neurovascular bundle. So in your FMG exam, FMG 2021, yes, FMG 2021. This was the your question that, sir, neurovascular bundle of the abdomen runs in between. Yes. Till when you are not aware about the what is the neurovascular bundle, how can we solve this question? This is the importance of the basics of our anatomy. This is the question of the your anatomy integrated with the surgery. In the abdomen, neurovascular bundle, it runs in between the. Yes, this is the question for all of you. Tell me the answer. Tell me the answer, beta. Yes, Priyanka, Vinny, Dr. Yogesh. Yes, yes. I can see only one chat, beta. I can see only one chat. I want to request, please come at the YouTube, beta. I can see one chat because we have to complete the anatomy in single time. I want to request to all of you. This is my humble request to all of you. Please come at the YouTube. I am not able to look two different chat box right now because I have to focus for the content and integration. Okay. So look here, neurovascular bundle FMG 2021. I want to say sorry also for this plus, but please, if you want to interact with me, okay, then please come at the our YouTube channel because I am able to see one chat box right now. Okay, yes, thank you, Brijman. Brijman is my very favorite student, and all the our cerebellum student at the cerebellum academy, we all enjoyed a lot. Okay, so FMG student also NEET PG session we did. Okay, so very beautiful session. Yes, thank you everybody, thank you. So what I want to, yes, Ajad, good morning, good everyone. So what I want to tell you, yes sir, these all are the things. Okay, FMG 2021 answer was the internal oblique and transverse abdominis muscle. Don't forget it. INICT question, the neurovascular bundle is absent in which compartment of the leg? Remember, that is the superficial posterior compartment of the leg. I told you the two MCQs related with your, yes, clinical. Now look for the our next part. Yes, yes, when Ninad sequence, always it will be the VAN. Two exception are there. One is popliteal fossa and another is first intercostal space. These are the two more MCQs. I will tell you in the leg part, popliteal fossa, and another in our thorax part. Don't worry. Okay, sir. Now try to understand the nerve of each compartment. It will supply the, yes, muscle of that compartment. It will supply the joint, or you can say bone of that compartment. It will supply the skin of that compartment. Yes, what you have to remember, sir, this particular unit where one single nerve fiber is coming and supplying the skin. So this is the segment of the skin, sir. This is the our segment of skin. So you will say tome, like the tommy means cut part. Okay, sir, which is supplied by single spinal nerve. Yes. So this is the skin part. So you will say derma. Sir, this unit, segment of the skin, focus. What is the dermatome? One question sure from the dermatome, either the surgery or from the ortho or from the medicine or from the anatomy. Segment of skin supplied by single spinal nerve is known as dermatome. Break the name, get the idea. Derma plus tome. Agree, beta? Now see here. Each compartment is having their own nerve. So that nerve will supply all the muscles, skin overlying that muscle, and the joint over which that muscle is acting. I'm telling you one very beautiful concept. Sir, the nerve will supply the bone, the related muscle, and the related skin. This is nothing. This is the what? Tell me. Sir, this is our, yes, our Hilton law. Getting the point, everyone? Yes, Dharam. Okay. Yes, Dr. Barkat, you are my ideal, sir. Thank you for such beautiful words, beta. Thank you so much to all the our lovely students. Focus right now. Okay. Okay, sir. So what I want to tell you, sir, there is the one Hilton law. Tell me how many muscles in the body? Sir, 639 muscle. Sure, in this session, every exam, one clinical question, they will show any X-ray, fracture orthopedics, and they will ask the nerve injured. How can we remember each muscle and each nerve of the body? But yes, now I'm going to tell you one mnemonic, one trick, one beautiful concept by which you will never forget this one. That is the Hilton law. Hilton, one anatomist, one surgeon came and he told that nerve of particular compartment, it will supply all the related skin, all the related muscle, and all the related joint. Agree, everyone? So to understand this beautiful concept, I'm going to tell you one simple example. Sir, suppose this is our, yes, our beautiful India country. Okay, sir. We all are aware that Ganga river is flowing at the north side. Okay. And Krishna, Kaveri, Godavari, they are flowing at the south side. So can you tell me one simple logic? Yes. Ganga will supply Kerala, Tamil Nadu? No, never. The Ganga is flowing at the north side, so it will supply the north state. Yes, sir. Simple concept. All the 639 muscles we are going to complete. And remember, the Krishna, Kaveri, Godavari, they are on the south side, so they will supply our Tamil Nadu, Kerala. Yes. They will never supply the Delhi, Uttaranchal, Manali. Simple. What is our way to remember? Always I told to the student that lines are, remember, जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. गंगा रिवर एट द नॉर्थ साइड, so it will supply entire north area. The Krishna, Kaveri, Godavari, they are at the south side, so they will supply the south area. So apply this law. Apply this law. Yes. Apply this law in the body. When we do dissection in our body, upper limb part, so three-dimensional anatomy, the Tony Stark anatomy, you will see, sir, this is our upper limb. Jarvis, enlarge this one. So yes, there is the entry compartment and the posterior compartment. During the dissection, entry compartment, musculocutaneous nerve. Break the name, get the idea. Musculo, it will supply the muscle. Cutaneous, it will supply the skin also, nerve. So the musculocutaneous nerve is on the entry side. So it will supply all the muscles of the entry compartment. What are the different muscles of the entry compartment? Your answer is B, B, C. B for biceps, B for brachialis, C for coracobrachialis. Yes, I will show you. B for biceps. Then cut it. Yes, we are cutting this muscle. Then can you see this is our coracobrachialis, which is taking origin from the coracoid process of the scapula, three-dimensional orientation, and going to the brachium. That's a coracobrachialis. Break the name, get the idea. And can you see this is the brachialis? So what is the nerve supply? These are having the nerve, musculocutaneous nerve. So all muscles, biceps, brachialis, coracobrachialis. आंख बंद कर दो और बोल दो. These are supplied by musculocutaneous nerve. And in the similar way, what you have to remember? At the posterior side, sir, there is a radial groove. So radial nerve will supply all the muscles of the posterior compartment of the arm. Agree, everyone? If agree, yes, comment. Yes, Brijman, Abhishek. Okay. Now try to understand. Yes, full of adrenaline, full of energy, full of enthusiasm. Yes, teaching is the passion, study is the passion. Now look, forearm. On the entry compartment, sir, there is the median nerve. So all muscles are supplied by median nerve. अब जो भी आएगा सबका आंसर क्या होगा? Median nerve. Except towards the ulna, there is a ulnar nerve. So on the ulna side, whatever the muscle, it will be supplied by flexor carpi ulnaris. Okay, yes, it will be supplied by the ulnar nerve. Which muscle is here? Flexor carpi ulnaris. So all muscles on the front of the forearm supplied by median nerve, except flexor carpi ulnaris, also the medial half of the flexor digitum profundus. No need to mug up. On the back of the forearm, sir, again the radial nerve. So all muscles are supplied by radial nerve. Yes, I will teach you our lower limb part. So try to understand. Yes. Look here. Yes. To teach you, I am cutting my throat. So आप देख सकते हैं क्या? In the lower limb, sir, front compartment, sir, there is the femoral nerve. So any muscle on the front side, they will be supplied by the femoral nerve. On the medial side, yes, there is our obturator nerve. From the obturator foramen, the nerve is coming at the thigh. So that is our obturator nerve. So any muscle on the medial side, adductor longus, adductor brevis, adductor magnus, gracilis, pectineus, सबकी nerve supply क्या होगी? What you have to say? Obturator nerve. While at the back of the thigh, sir, at the back of the thigh, there is a sciatic nerve. So whatever the muscle at the back of the thigh, the hamstring muscle, semitendinosus, semimembranosus, our longer the biceps femoris, yes, एडक्टर मैग्नस ischial head, कोई भी मसला आई, व्हाट यू टू से? सर सियाटिक नर्व. सबका मालिक एक है, जो नर्व जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. आई विल टीच यू द लेग. इन द लेग, एंट्री कंपार्टमेंट, लैटरल कंपार्टमेंट, पोस्टीरियर कंपार्टमेंट. एंट्री कंपार्टमेंट, डीप पेरोनियल नर्व. एनी मसल ऑन द एंट्री साइड, यू हैव टू से द डीप पेरोनियल नर्व. एनी मसल ऑन द लैटरल साइड, you have to say superficial peroneal nerve. The nerve on the lateral side, superficial peroneal nerve. And remember, on the back of the leg, there is the deep peroneal nerve. So all the muscles of the back of the leg, they are supplied by deep peroneal nerve. Agree, everyone? Okay. Hope you all are getting the point. Entire nerve supply, important limbs nerve supply, especially we completed now. Okay. Okay. Got the point? So now we are going to move. Hope you all are enjoying this session. Don't forget this one. Yes. So this is your role. अब मैं पूछूंगा और आपको आंसर करना है. This is the Hilton law. जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है। सो व्हाट यू टू रिमेंबर, जो नर्व जहां रहती है, जहां बहती है, वहां के सारे मसल को, सारे स्किन को, सारे जॉइंट को सप्लाई करती है। ओके ओके सर। सो नाउ व्हाट आई वांट टू टेल यू, लेट्स स्टार्ट द बुलेट ट्रेन रिवीजन, previous year topics and the previous year question. Now it is your turn. Okay, can you tell me few questions from the general anatomy part? FMG 2021 frontal plane section is termed as, yes, it is termed as, tell me beta. Yes, frontal plane section which is dividing the body front and back, that is known as, tell me the answer. Yes, thank you Aman, thank you for best experience. Okay, now try to understand further. No Ashish, the entry compartment, the deep peroneal nerve, we will come there. Yes, answer is very good Ravish, very good Brijman, बहुत बढ़िया answer is the coronal. So any plane which is dividing the body into the right and left two equal halves, that is the median plane, which is parallel to the median plane, that is the, yes, sagittal plane. Okay, mid sagittal and the sagittal, and any plane which is dividing the body into the front and back, that is known as coronal plane, and any plane which is dividing the body into the upper and lower part, that is a transverse plane. Okay sir. Now can you tell me this question, identify the type of the joint marked by arrow in image. Okay, so can you see here, sir, there is the joint at the midline. Sir, this is the nothing, this is the pubic symphysis. Yes, due to the our technical editing, these options had been removed, but remember sir, it is our secondary cartilaginous joint. And can you see the December FMG 2021? Again, same question they had asked, but this was asked from the our, yes, radiology part. But again, this is the secondary cartilaginous. This is again secondary cartilaginous. Yes, pubic symphysis. Yes, but need to PYQ for that. Our differentiation bullet train anatomy 1.0 you can follow. But right now, I will only orally tell you the NEET, PG, and INICT. But I am not mentioning the MCQs here. For that, you can follow our first bullet train anatomy that was totally dedicated for the NEET PG. Okay, yes, but this session will be useful for the NEET PG, INICT, and the MBBS students also. I am telling all the important things orally. Now look here, this is the question from the June FMG 2020. Okay, which type of the joint is involved in the shown movement? Sir, this is the upward rotation of the palm, downward rotation of the palm. This is known as the supination, pronation, supination, pronation. There is a rotation, that's why pivot activity. Very good everybody, very good. Yes, now identify the type of the joint here. Can you see, sir, this is the our radius and here is the ulna. So in between the radius and ulna, three joint, sir, superior radio-ulnar joint, sir, here is the inferior radio-ulnar joint. MCQ, remember here is the rotatory activity. Rotatory activity means pivot joint. Rotatory activity means pivot joint. C1, C2 rotatory activity means pivot joint, atlantoaxial. But this is your another question from the 2020-22 middle radio-ulnar joint. Sir, there is a presence of the ligament. So this ligament is firmly attaching the two bone. So this is our desmo bone. Yes, desmo ligament. So remember, this is the syndesmosis. Yes, sir. This is our syndesmosis. MCQ. Remember, the supination and pronation occurs. Supination and pronation movement occurs at which joint? Answer is the pivot joint. Answer is a superior and inferior radio-ulnar joint. Don't forget. One more very beautiful concept from this image. Remember, one nerve is in front of this interosseous membrane. One nerve in front of that interosseous membrane. So what should be the name? Sir, this nerve is anterior interosseous nerve. This is nothing. It is the deep branch of the median nerve. MCQ. I will not repeat the things. So please focus, please concentrate. While there is one more nerve which is running on the back side of this interosseous membrane, I am showing with the dotted line. Yes, it is running posteriorly. So you will say posterior. In between the bone. That's why interosseous. Yes, it is nerve. So you will say pin. What I want to tell you, the deep branch of the median nerve is the anterior interosseous nerve, while the deep branch of the radial nerve is posterior interosseous nerve. MCQ. These are very useful for the NEET PG INICT also, for the FMG. Yes, definitely. Agree everyone? सबको समझ में आ रहा है? Okay, getting the point? Okay. So yes, in between we will make the mall also. कोई तुमसे पूछे कोई तुमसे पूछे कौन है एनाटॉमी तो कह देना कोई खास नहीं, एक दोस्त है कच्चा पक्का सा, एक झूठ है आधा सच्चा सा, कभी हंसने का कभी रोने का, बस एक बहाना अच्छा सा, राहों का ऐसा साथी है, नीट पीजी का ऐसा साथी है, एफएमजी का ऐसा साथी है, आईआईसीटी का ऐसा साथी है, जो दूर नहीं और पास नहीं। कोई तुमसे पूछे कौन है एनाटॉमी तो कह देना कोई खास नहीं, तो कह देना कोई खास नहीं। जी हाँ मेरे दोस्तों, खास नहीं होते हुए भी ये बहुत बहुत खास है, बिकॉज ऑल द सब्जेक्ट्स आर स्टार्टिंग फ्रॉम हियर। सो होप यू ऑल आर रेडी फॉर दिस अवर सेशन। Okay, yes, thank you everyone for such kind of beautiful comment. Okay, yes, so remember beta, we are just completed this our part. Can you tell me, this was our which joint? I told you sir, this was our syndesmosis. Okay, fine. Now what I want to tell you sir, there is the our one thing clear, we have to look for the joint topic. So now, yes, tell me what are the different types of the joint? Yes, I want to ask you what are the different types. Yes, thank you everybody, thank you. Jajbaat hone chahiye. Yes. So what I want to tell you, one another beautiful concept. See here, there is the one bone. Now tell me, there is the another bone. So the junction between two bone. Now we are all are clear. One question sure from the joint, one question from the general anatomy, another question from the joint sure. Two topics I told you. So remember, another important one fact from the nerve supply, radio, ortho, related with that one. Okay, so there will be the question related with this topic. So now supply, three topics I told you. So you all are observing sir, there are the muscles are taking origin from the bone and inserting at the bone. Tell me the concept, muscles are taking origin and inserting at the bone. So tell me beta, if this muscle will contract, these bones will move up or down. Definitely muscles are above, so it will contract, it will pull the bones upside. Decrease in angle means flexion. So remember, the upper muscle, they will cause up movement. But if any muscle is located at the downside, if any muscle is located at the downside, okay, so you will see it will contract. Now it will pull the bone up or down. Common sense sir, it will contract and it will pull the bones downside. Getting the point? Okay, so if muscle is above movement, muscle is below movement. Apply the logic. If muscle is on the front movement, if muscle is on the back movement. All the movement of 639 muscles. Yes, I am again putting the 639 muscles magic. Yes, if back muscle, back movement. If any muscle is on the lateral side, FMG 2022 question. So when it will contract, it will cause, yes, lateral movement. Supraspinatus has been asked. If any muscle on the medial side, it is getting insertion. So when it is contracting, it will cause where? Movement. Yes, medial movement. So you have to remember, sir, where muscle goes, there movement flows. So this is the our another mnemonic, another concept. Now we have not to mug up every muscle and every action. This is the magic of the 639. Agree everybody? Yes. What you have to remember? Where muscle goes, there movement flows. Yes, in Hindi you can say jidhar muscle udhar movement. Lateral muscle, lateral movement. Medial muscle, medial movement. Front muscle, front movement. Back muscle, back movement. Getting the point everybody? Okay, so till now one question from the general anatomy, one question from the nerve supply and the dermatome, one question from the muscle action, and one question from the joint. You cannot neglect. Maybe directly not asked, but yes, remember, without the knowledge of these things, you cannot move single step in orthopedics, surgery, medicine, even the obs gynae, even your ophthalmology movement of the eyeball. Agree everyone? So 4 topics from this area. Agree beta? Okay, yes. Now we are going to look perfect anti-crime technology. You're right. Okay, thank you Rakesh. So hope you are getting the point. So we are going to revise this joint topic. I taught you the junction between two bones known as the joint. There are the 3 types of the joint. If the 2 bones are interconnected with the fibrous connective tissue, so this is the fibrous joint. If the 2 bones, they are connected with the help of the cartilage, sir, cartilaginous joint. Yes, if the 2 bones, in between them there is the synovial fluid, sir, it is a synovial joint. दुनिया में बेटा सिर्फ 3 टाइप का जॉइंट होता है. यहां से एक क्वेश्चन जरूर आ रहा है, FCS. टेल मी, F for fibrous, C for cartilaginous, S for synovial, very important for the orthopedics. Now look for the next. Yes, Dharani is saying, yes sir, last ionicity from the joint. Definitely, but every exam. Now, fibrous joint, sir, fibrous connective tissue, no movement. Another name, synorthosis, chipak gaya. Synorthosis, syn means chipakna. Now, the cartilaginous, sir, we will see there is the slight movement because cartilage is there. That's why it is known as the MP. MP means, yes, partial movement. And then synovial joint, best joint, diorthosis, free movement. Now come to this fibrous joint. Our mnemonic is Sa Su Ji. Yes, when you will become the married, remember wife is important, but Sasu Ma is more important. So our funny trick, don't forget the Sa Su Ji. Okay, and last time when we are taking the class, Sasuma was also there and she was laughing from the one family, one student family. Okay, so my respect to all the family members also who are watching this session. I know many family members, they are also watching and enjoying this session. So always this occurs. What I want to tell you, Sasuji. S for beta, suture. S for synedesmosis, G for gomphosis. इसके अलावा कोई चौथा फाइब्रस जॉइंट नहीं होता. Okay sir, suture. They are found in the skull. They are found only at the skull. Okay, yes, thank you. Nimra is saying everyone likes your session. Thank you, beta. Thank you to all of you and your family members also. Okay, yes. Now the sutures. Do you remember? If the articulating surface they are parallel, plain suture. If articulating surface they are oblique, squamous suture. If the articulating surface they are zigzag, serrated suture. And when you will see the one bone is getting inserted into the another, tooth like dented suture. Simple. How can you remember? Come with me. Do the hand in this way. Parallel, plain suture, oblique, squamous suture. Then do this one. Yes, zigzag, serrated suture. And then what you have to remember? Dentate. Tooth like one bone is inserting into the another bone. Dentate, strongest suture of the body, MCQ. And then one bone is triangular, wedge shaped, which is getting fit into the another. That is your, yes, wedge and groove. So what I want to tell you, this is the wedge and groove suture. Getting the point? There is a triangular bone getting fit into the groove, wedge and groove, which is also known as shin dialysis. कैसे याद किया था हमने? सर शिंदे का डायलिसिस हो रहा था, कहां से कर रहे थे? नाक से कर रहे थे. We are not using the radial forearm part. Agree beta? So remember this one. I am showing in the 3D. Again, quickly. Sir, there is our, yes, plane suture. Can you see the interpalatine suture in the skull? This is the plane. Yes, intranasal suture is the plane. Now the squamous, yes, oblique. So the temporoparietal is the oblique. And then zigzag, beautiful anatomy. Yes, three-dimensional anatomy. The Iron Man is Spider-Man anatomy. Can you see? This is the serrated zigzag. The interparietal and the bragma part is the your suture. So this bragma, lambda, it is very important. Fontanelle of the skull, very important. You have to read in the pedia and the obs gynae. Yes, very important. Now, what I want to tell you, when you're looking at the back side, we are rotating the back side. So can you see, there is the physics lambda shape, lambda suture. This is the strongest suture of the body, the first fontanelle, which gets ossified. Answer is the your lambda suture, forensic medicine integration, important. Strongest suture. Now, sir, where is the wedge and groove? See here, sir, this is the nose. Can you see the antenaries? Can you see the single bone? This is the vomer. Yes, sir. Now I am telling you the backside. Focus. Yes, this is the backside. Now look, sir, this is our palatine part. Sir, here is our single bone, vomer, MCQ. Now it is situated, it is articulating with the sphenoid bone. This blue color is the sphenoid bone. Now I'm enlarging. Look at this one, beautiful anatomy. Can you see? This is the triangular bone, blue color. That is a triangular bone, wedge shaped, which is getting fit into the groove. Sir, this sphenoid bone is making the wedge while this vomer is making the groove. Vomer is having the two arm, ala of the vomer. So this is the your shin dialysis. शिंदे का डायलिसिस नाक से करना है, ऐसा हमने याद किया था. यस, शिंदे का डायलिसिस नाक से करना है, शिन डायलिसिस सुचर. एग्री बेटा? होप यू आर गेटिंग द पॉइंट. ओके. Yes, Brijban is my very favorite student and he is actively answering here. Very nice beta, very nice. Yes, Nimra is also very good answering. Abhishek, very good beta. बस ये माहौल बना के रखना है बेटा. याद रखना, सिर्फ हंगामा खड़ा करना हमारा मकसद नहीं. कोशिश है कि रिजल्ट बदलनी चाहिए. तुम्हारे सीने में नहीं तो हमारे सीने में ही सही, और हमारे सीने में नहीं तो तुम्हारे सीने में ही सही। कहीं भी हो आग, लेकिन ये आग जलनी चाहिए, ये आग जलनी चाहिए, ये आग जलनी चाहिए। तो आग जला के रखिए, अपने दिल को धधका के रखिए, हर चीज को याद करते जाइए। वी हैड रिवाइज many times this all the things. This is the quick revision session. Okay everybody? Okay, yes Dr. House, thank you. Yes Dr. Power, thank you beta. Yes, radhe radhe. So now we are going to continue this session for the next. Okay sir, this all the things. Now the syndesmosis. Sir, the two bones are articulating with together, yes, with the help of the ligament. Sir, this is the our syndesmosis, like the radius and ulna, middle radioulnar joint, yes, middle tibiofibular, as well as INICT. I am telling to the INICT and NEET PG students also. This is the INICT 2018 question. Inferior tibiofibular is which kind of the joint? Answer is the ligament joint. Answer is the syndesmosis. Okay, now come to this our gomphosis. It is very easy, no need to mug up. In the gum there is the gomphosis. So this is also known as the peg and socket joint. Okay sir, now come to the cartilaginous. This is the quick revision series. So cartilaginous, it is two types. Yes, what are the two types, sir? Primary cartilaginous and secondary cartilaginous. Look here, the primary cartilaginous, like there is the our bone, sir, there is the bone shaft, and here is the epiphysis. We know there is the our part, the growth plate of the cartilage. What happens? Later this cartilage is ossified, later this cartilage is getting ossified. If cartilage is ossified into the bone, so later there is a no movement, cartilage is replaced by the bone, it is primary cartilaginous. Because the bone is getting fused, that's what is also known as the synostosis. Focus over my word. Syn means chipakna. Bone is getting firmly other. Yes, here the cartilage is getting ossified, so the same is known as the synchondrosis. Break the name and get the idea. Yes Arpita, growth plate, very good. So this is the our synchondrosis, also known as the synostosis, also known as the primary cartilaginous. Where it is found? No excuse, between the epiphysis and the diaphysis, the growth plate for the orthopedics. And in the similar way, when the two bones are connected with the cartilage, blue color, but in between them there is a fibrous connective tissue which is not ossified by the bone, which is not replaced by the bone. Here no bone, but here is the bone ossifying. Okay, so this is the secondary. It is also known as the symphysis. Remember, all the midline zone, all the midline joint, cartilaginous joint, they are secondary. Like your mnemonic, yes, MIS, MIS. M for manubriosternal joint, MCQ. I for intervertebral disc, MCQ. S for symphysis pubis, 2020 FMG, 2020 and 2021. Yes, it was the previous questions from the NEET PG which are repeated in the your, yes, question pattern of your, you can say, sir, FMG exams. Symphysis pubis. Okay, what I want to tell you, all midline joints are your secondary, except the mandible is coming at the midline and getting fused. It is showing complete ossification. So this is not the symphysis. Yes, name is symphysis menti, in between the two half of the mandible, but actually it is not the symphysis joint, secondary cartilaginous. This is the primary cartilaginous joint. Okay, it is actually the synostosis. So this is one this is your one exception. So remember these points, focus properly. Okay, okay, but I want to request to the Zoom student, because I have to content, and remember, I'm not cutting the content. Whatever I'm teaching in the 4 day, and then rapid revision I'm teaching in 1 day, same content I'm going to teach in the 5 hours. So only one humble request to all of you, I have to concentrate over the content. So please come at one platform. Okay, if possible, please come at this one. If you want to interact with me, if you want to ask the question, please come at the YouTube channel, because I am having only one single screen for the chat. Okay, I'm not opening the two different chat. Sorry for this. Please come here. Okay, now look here. Don't worry, this page is blur, quality of the stream is good, don't worry better. Okay, yes sir. Now what I want to tell you, one question from the your bone parts. Sir, any long bone is having the epiphysis, diaphysis, in between them you can say the growth plate, and the epiphyseal end of the diaphysis is known as metaphysis. Agree, everyone? Okay, getting the point? Okay, sir. What you have to remember in orthopedics, you will see nutrient arteries coming, then it is dividing into the ascending and descending, and then it is making the hairpin band. Yes, when this hairpin band they are made, there is a decrease in the velocity. We are going to integrate the microbiology, orthopedics, and anatomy. Yes. So when the infection is coming, it is showing the decreased blood velocity. So it is getting trapped here. So most common site of the infection in the bone, answer is the metaphysis. This is your orthopedics, ortho conceptual brainstorming integration. Yes, but later what happens? As the baby is growing, it is showing the complete ossification. It is showing the complete ossification. So later bone infection is less common. This bone infection is osteomyelitis. Osteo means bone, myelo means bone marrow, itis means inflammation. What's the inflammation? Rubor, tumor, dolor, calor. This is the pathology, the terms given by the Celsus. And the fifth component was added by the father of the modern pathology, Rudolf Virchow. These all are your pathology MCQ, the patho integration. Now tell me, microbiology, which is the most common commensalism organism at the skin? Sir, answer is the Staphylococcus aureus, one of them. So the most common cause of this infection is our Staphylococcus aureus. It is going above and down, and it is getting trapped here. Okay. Now see, later as the growth occurs, it is getting fused. That's why this osteomyelitis is more common in children or adults, sir. Children are more prone than the adult. Why? Because anatomy is saying this, our growth plate is getting fused. So there is a no metaphysis, no growth plate in adult life. Agree, everyone? This is the beautiful, beautiful integration. Yes, Brijban, yes, Dharani, you all are right. Okay? Okay, sir. So now, after knowing these different parts of the bone, epiphysis, growth plate, metaphysis, diaphysis. Now you have to learn one question sure from the orthopedics in here. This mark my words, in your recent question. Again, the bone tumor is asked. Learn in the orthopedics. This is the integration. I told you till now 6-7 MCQs. Na? Ortho and not CBI integration. Mnemonic is the demo ECG. D for diaphysis. The Ewing sarcoma arises from here. Metaphysis, osteosarcoma arises from here. Epiphysis, from here the Codman tumor. Yes, C for chondrosarcoma and G for giant cell tumor. These are arising from the our yes epiphysis part. So one question sure, 7-8 question till now we have covered. Okay. Okay, sir. Now look for this our yes synovial joint, the best joint. Synovial fluid is there. So what are the different types? Remember, आज गाड़ी तेरा भाई चलाएगा सैलमॉन भोई, द मोस्ट रिस्पेक्टेबल पर्सन इन द वर्ल्ड. रिमेंबर बेटा, तारा सिंह जी ने एक बार कहा, मैं निकला हो गड्डी लेके. सैलमॉन भोई से मैं भी निकला था एक दिन गड्डी लेके. So respect to Salman Bhoi. He is the brand ambassador of our CBI anatomy. He will clear many MCQ. So one mnemonic for the types of the synovial joint. Yes, प्रियंका चोपड़ा से बहुत प्यार हुआ. सलमान भोई को अलग अलग जगह बार बार अलग अलग लोगों से प्यार मोहब्बत होते रहता है. ओके, होप यू ऑल आर गेटिंग द पॉइंट. यस 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 यस, बिल्कुल बिल्कुल, बहुत बढ़िया ब्रिजवान. वेरी नाइस आंसर फ्रॉम द ऑर्थोपेडिक्स. सलमान भोई, कीप कमेंटिंग फॉर द सलमान भोई. सो टेल मी, पी फॉर plain synovial joint, C for condylar joint, S for saddle joint, E for ellipsoid joint, B for ball and socket, P for pivot joint, H for hinge joint. So these are the points which you have to remember. So one by one, the important example. Sir, plain synovial joint, the articulating surface, they are parallel together and fluid is there. What are the different our joint? Your mnemonic is Picasso. Just one quick revision. P for patellofemoral, I for intercarpal and the intertarsal, C for, this is the your AIIMS AIIMS question. The NEET PG 2019 question. Costovertebral and costotransverse, these are your plain synovial joint. Then acromioclavicular and superior tibiofibular joint. Now condylar, your orthopedics, the most common joint which is getting arthritis, answer is the knee arthritis. Knee joint is the bicondylar synovial joint, where you will see the condyle. Also the temporomandibular joint. Now the saddle joint, one surface is convex and another is concave. One surface is concave and convex. Concavo-convex surface means saddle joint. Remember your mnemonic is PIX. P for patellofemoral. For the ENT, don't forget, this is the quick revision series, bullet train session, incudomalleolar joint, incus and malleus. There is the concavo convex joint, sir, this is the our, yes, remember, saddle joint, and this is a carpometacarpal joint as well as sternoclavicular joint. Don't forget for the ENT incudomalleolar joint. Now elliptical joint, yes, ellipsoid joint. Remember, this is your E. इस E को धक्का दे दो, it is converting to the W. So remember, D, W, W, W for wrist joint. This is also the radiocarpal joint. One question I am looking for all of you for upcoming GIT, for upcoming GT, your brand test. Yes, the radiocarpal joint is which kind of the joint? Better don't forget, sir, ellipsoid. Now push this W into the M. M for metacarpophalangeal, M for metatarsal. These all are the ellipsoid joint. Okay. Now look here, the ball and socket joint, the best joint. Your mnemonic in pharma, do you remember our respected GRG sir? Yes, one beautiful mnemonic created by him. SHIP. S for sulfonamide, H for hydralazine, I for isoniazide, and P for, tell me what is the P? Tell me what is the P? P for, yes. Just you have to replace that P. Yes, that P is procainamide. These all are the drugs which are our, yes, the drugs getting metabolism by the acetylation mechanism. Fine, but here we are doing the SHIT. S for shoulder joint is the our synovial. H for hip joint is our synovial. I for again ENT MCQ incus and stapes. There is the incudostapedial joint. This incudostapedial is again ball and socket. ENT MCQ we are covering. So till now 12 question, up to 12 question you can say now. And this is the your INICET question. Talo, calcaneo, navicular joint is the classical example of ball and socket. Okay. Getting the point? So I'm showing you with the three-dimensional anatomy, the beautiful anatomy, the smallest bone of the body. Yes, sir. Jarvis, show us the skull. Jarvis, show us the 10 millimeter oval structure, tympanic membrane. Yes, this is the tympanic membrane. Can you see the beautiful, our pearly white color structure, MCQ, ENT. Now look, there is the malleus, NEET PG question. They are showing the shape of the bone and they are asking, sir, this is the malleus with the process, with the handle. Now this malleus is articulating with the stapes. Can you see this stapes bone? Yes, in this stapes bone with the beautiful three-dimensional way, can you see there is the convex surface, concave surface? Yes, sir. Convex and concave. So because it is having the concavo convex, so that's why this is the our saddle joint. Yes, sir. Can you observe this is articulating with the our otosclerosis involved bone, that is the stapes. Yes, sir. This is our smallest bone in the body, sir. This is the stapes. So stapes and the your incus, it is showing the our ball and socket joint. Agree, everybody? Don't forget these points. What I want to tell you, yes, sir. There is a one funny mnemonic. Remember, sir, this is your NEET PG FMG question. Suppose this is the malleus. It is articulating with the, yes, incus. This incus is having the concavo convex surface. Yes, that's why it is saddle. And here it is articulating with the our, yes, stapes. Who is your friend? Remember, this incus is your friend. Front is malleus and this is stapes. Remember, in front of the incus, don't forget beta, in front of the incus, there is the saddle joint. And behind the incus, sir, there is the ball and socket. Don't forget for the ENT. What I want to tell you, this is the question pattern on the basis of the shape of the bone from the NEET PG 2021. Questions from the INICET, they are asking the NEET PG. From the NEET PG, they are asked into the your, yes, that is, sir, FMG exams. So you have to remember one funny mnemonic. I told you the concept, three-dimensional orientation. Now mnemonic, sir, SBI. Sir, SBI. Yes, State Bank of India. Better remember, the best bank of the India, State Bank of India. जब भी जाओगे लंच मिलेगा. डू यू नो, अभी एक मीम्स भी आया हुआ है, इलॉन मस्क रो रहा है कि वो एसबीआई को खरीदने के लिए गया, लेकिन एसबीआई वालों ने बोला लंच का टाइम हो गया है, बाद में आना. इलॉन मस्क की जिंदगी में पहली बार आंखों से आंसू आ गए. उसे किसी ने ऐसा नहीं कहा था, लेकिन एसबीआई बेटा, यस, एसबीआई, यू हैव टू रिमेंबर एसबीआई. एस फॉर सैडल जॉइंट इन फ्रंट ऑफ द इंकस. यस, बी फॉर बॉल एंड सॉकेट behind the incus. So which is the saddle? Sir, answer is the incudomalleolar joint. which is the ball and socket incudostapedial joint. Another SBI you have to remember, and it had been asked in your FMG exam, sir, situs inversus, sir, B for bronchiectasis, sir, I for infertility. Who will tell me what is this triad? Who will tell me what is this triad? Situs inversus plus bronchiectasis plus infertility. Another SBI. Don't forget, yes, till now 14 MCQs. 14 MCQs we had covered. यस 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 एंट्री वुड यस एसबीआई गवर्नमेंट का है, कोई खरीद नहीं सकता एक्सेप्ट अदानी भैया. सो ओपन हिमर इज सेइंग वेरी वेरी ब्यूटीफुल लाइंस. यस, इलॉन मस्क को भी भगा दिया उन्होंने. ओके, एक मीम्स आया हुआ है, उसको मैंने आपको बताया. फाइन, यस, वेरी ब्यूटीफुल. यस, निम्रा, वेरी नाइस. माय क्लैपिंग फॉर ऑल ऑफ यू. सो होप यू आर एंजॉयिंग द सेशन. माय क्लैपिंग फॉर ऑल ऑफ यू, माय थम्स अप फॉर ऑल ऑफ यू, माय हार्ट फॉर ऑल ऑफ यू, माय फ्लावर्स फॉर ऑल ऑफ यू. एंड इफ यू ऑल आर एंजॉयिंग, प्लीज कमेंट. बेटा, yes, this is the online class, and in the online class what happens, I feel that I am teaching to the camera, and you will feel you are learning from the mobile. No, there is one media, the comment, the emojis, which breaks this barrier. Okay, when these comments and this your emojis are coming, then I feel I am sitting, I am standing in front of you, and I am teaching directly to you, not the camera. And you will feel that you are learning from the direct teacher. You are not learning from your mobile screen. So thank you everyone. So we are good. Yes, thank you Brijman, thank you DRSS. Yes, thank you DRSS for your love, and thank you from my side to all of the students as well as the family member. Okay, yes 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 बेटा, हमको आग जला के रखना है, हमको एक माहौल बना के रखना है, and definitely the many questions are going to ask from this session. Okay sir, now come to this pivot joint. Whenever there is the rotation, there is the rotatory movement, pivot joint. Only 3 joint you have to remember. Atlantoaxial joint, C1, C2, that is the pivot. Yes, this is the rotatory movement. After the class, you will say, sir, give me the biryani party. I will say, no. This is the your INICT question. Yes. Okay. So what is the no movement? Rotatory movement, right and left movement. This is the no movement. Fine. And also, after that, you will say, okay, sir, okay. After the class, I will give you the biryani party. I will say, yes. So this shaking of the head, this is the yes movement. It occurs above the C1, means atlanto-occipital joint. Okay, so what I want to tell you, this is the your very important. Yes, thank you Dr. Munir, Dr. Pushpendra, Dr. Priyanka, Neil, playlist, Deepak, Paresh, Vijay, playlist, Neil, Saurabh. Yes, thank you everybody, thank you. रेडियो एक्टिव स्पाइडर सर. ओके ओके, तो एक बच्चे ने हमको रेडियो एक्टिव स्पाइडर भेज दिया है. ओके, थैंक यू बेटा, थैंक यू सो मच. तो व्हाट आई वांट टू टेल यू सर, देयर इज द आवर फर्स्ट वर्टेब्रा C1. यस, दिस C1 above, there is the yes movement, don't forget it, and below the C1 there is the no movement. Okay, so above there is our occipital bone. So this yes movement occurs at atlanto occipital joint. This is the top level MCQ. Okay, and below the C1, sir, there is the C2, means atlanto axial joint. So the no movement occurs at atlanto axial joint. MCQ, yes movement atlanto-occipital, no movement atlanto-axial. Okay, also you have to remember, sir, this atlanto-axial joint is involved medicine integration C1 C2 joint in the rheumatoid arthritis. Yes, so this is the another thing what I want to tell you. With the proper 3-dimensional orientation, again look for this our beautiful integration. Don't forget it, beta, sir. Jarvis, Iron Man, this is our skull bone. Can you see the atlas? Yes, sir. No body, no spine. So this is the first vertebra C1 atlas, image-based pattern. Yes. So this atlas is articulating above with the occipital bone. So above the atlas, yes movement. Below the atlas, sir, this is the axis. So there is the rotatory movement, no movement. Above the atlas, yes. Below the atlas, no movement. Getting the point? This is our, can you see, sir, it is elliptical in shape. It is articulating with the elliptical surface. This is the our occipital condyle, sir, it is elliptical in shape. So the yes movement occurs at ellipsoid joint. While don't forget, sir, this is our what, sir, it is our axis odontoid process. So there is the axis, odontoid process, around which atlas is rotating. Okay, so this rotatory movement means pivot joint. Agree, everyone? So what I want to tell you, another very important question, beta. Sir, another very important question. Sir, this atlanto-occipital joint is ellipsoid joint and atlanto-axial is our pivot joint. No excuse. One topic from the your joint topic. Can you see? Yes, E. Mnemonic. In the yes, there is the E. Here is the E. Okay. So don't confuse. There is a rotatory movement. That's a pivot. Okay, sir. So we had completed many things. Now look for the hinge joint. Yes. Hinge means door. You are opening the door and you are asking the guest to come inside. आइए, पधारिए. So hinge joint, uniaxial movement. IEA. I for interphalangeal joint. E for elbow joint. A for ankle joint. These are the classical hinge joint. So these all are the things. Now no need for the your basics of the orthopedics. This will be useful in the ortho surgery, different subject. Okay, so till now 14-15 question we had covered, and thank you very much to all of you for the patience for the general anatomy. Now our bullet train pure session is going to move with the supersonic speed. So upper limb session, our Spider-Man session. No one can win every battle, but no man should fall without a struggle. बेटा दुनिया में ऐसा नहीं है कि हमेशा हमको जीत हासिल हो, जीत हासिल हो, जीत हासिल हो. बेटा हार मिलती है, 10 हार मिलती है, तब एक जीत मिलती है. और याद रखना कि ये दुनिया जो है उगते सूरज को सलाम करती है. अगर आप 10 हार हारेंगे उसको लोग भूल जाते हैं. बस आपको एक सक्सेस मिलने की जरूरत है. सो रिमेंबर, मुश्किलों से भाग जाना आसान होता है, हर पहलू जिंदगी का इम्तिहान होता है. डरने वालों को मिलता नहीं कुछ जिंदगी में, लड़ने वालों के कदमों में जहान होता है. So with this beautiful lines, with the Spider-Man motivation, Spider-Man version of this bullet train anatomy, we are going to move for our upper limb session. Hope you all are enjoying the session. Okay, yes. So we are going to crack this all the things step by step. And remember, in between this session I will do the many magics also, like abracadabra, gilly gilly choo. Now yes, with this magic I'm coming with only head. Our next session will be dedicated for the invisible man, and the next session will the our Harry Potter. But this motivational session, as well as the too much many concept, yes, we are going to do with the our bullet train speed, bullet train anatomy with the Spider-Man. So now again I'm coming with entire body for all of you. So enjoy this session and focus. What I'm going to do, sir, jai kali kalkatte wali tera vachan na jaye khali. So now I'm coming with my entire body. Hope you all are enjoying the session. Okay, so if you all are enjoying the session, yes, just looking like a wow, so elegant, so beautiful, just looking like a wow. Anatomy is very beautiful subject. So let's start with this our session. yes, hope you all are enjoying the session. Okay, yes. ये सीक्रेट की बात है. इस सीक्रेट की बात को डॉक्टर ओपनहाइमर ओपन नहीं करना. Okay, this is the magic. Okay, we love anatomy just because of you. Thank you, Nimra. Thank you. Yes, this session is approximately 5 to 6 hours. Okay, yes. Please inform your all the friends. This session is going to be very useful. अभी सिर्फ जनरल anatomy हुई, असली मजा तो अब चालू होने वाला है. So let's go with this our beautiful bullet train anatomy with our Spider-Man session. Hope you all are enjoying the better. Yes, मजा आ रहा है ना? Yes, Prakash is saying मजा आ रहा है. Okay, fine. I am having only one talent, and that is connection with the student. I have to do for the student. The teaching is my passion. सिर्फ यही एक talent है बेटा, बाकी सब उसके बाद आते हैं. Okay, so this is just because of all of you. Okay, yes. ये जादूगरी का खेल है, मजा आ गया ना? चलो, thank you entry for your love. Yes, मजा नहीं रुकना चाहिए, फोकस नहीं रुकना चाहिए. So let's start the bullet train revision of the previous topic and the PYQs. What we have to focus for our upper limb. Can you see the FMG July 2023? Now focus. Deformity as shown in image, X-ray was observed. Which nerve? I told you nerve is important. Can you tell me what is this? Sir, this is our, yes, wrist drop. Comment. Yes, sir, this is the wrist drop. Thank you, Brijman. Thank you. Okay. Yes, Barkat. Our South Indian heroes will also come at the screen. Don't worry. Just wait and call your all the friends for this session. Yes. Can you see? the fracture will be asked. Sir, there is the fracture of the shaft. Which part, beta? Upper part. So this is nothing. This is your which nerve? Very good, Arpita, Abhishek, Roshan, Nimra. Very good. Answer is the radial nerve. One question sure from ortho, your radio and anatomy. Integration. Can you see the next question? A person came to the OPD with history of the fall on the outstretched hand, got injured. I'm just telling you the PYQs, na? Description theory after this, na? Anatomical snub box. What I want to tell you, anatomical snub box. This question earlier had been asked in INICT, then NEET PG, and now FMG exams continuously 3 times. So in the anatomical snub box, yes, extend the thumb, extend the thumb. I'm coming close to you. Yes. What I want to tell you, extend the thumb. At the base of the thumb, there is a one depression. Just like the Gabbar Singh, you know, Gabbar Singh was using the canny and this way, and then yes, in the similar way, there is a drug abusing mechanism. Put the drug abusing substance at this base of the thumb, rub it, and then maja aa gaya. What you have to remember, sir, it is in the anatomy. That's anatomical. It is used for the snuffing. That's a snuff. It is box-like structure. That's a box. Short, because 5 clinical are related here. That's why. Okay, sir. So at this base, there is the scaphoid bone. Answer will be the scaphoid bone. Okay. Yes. Very good, Bridgeman. Share the knowledge, everyone. Very good, Bridgeman. Whatever you are knowing, share together. नालंदा विश्वविद्यालय हमारे भारत देश का बहुत बड़ा विश्वविद्यालय था, लेकिन बेटा नॉलेज जब तक आप शेयर नहीं करोगे तबाह हो जाओगे. ये मत सोचो कि नॉलेज शेयर करूंगा तो सामने वाला ज्यादा जान जाएगा. नो, if you will share the knowledge, the most benefit, the maximum benefit to you subconsciously. Okay, so very good, Brijman. Share the knowledge, everyone. Sir, scaphoid. Very good. D. Querentino Sanvat is very good. Ashwarya. Most common dislocation, lunate. Very nice. Priyanka is giving the very nice answer. So chat box is full of the FMG, NEET PG, INICT, PYQs, important topics. Look at the chat box, beta. Very nice, Ajay. Yes, thank you, Brijman. Now, can you see the FMG July 2023? This question came from your NEET PG exam. Can you see? There's a bulge on our front of the forearm. You know, the Popeye the Sailor Man. Yes, he was having the bulge after eating the spinach in America to motivate the children to eat the spinach. Okay, they introduced one character, Popeye. एक बहुत ही फेमस कार्टून कैरेक्टर था जो कि पालक की भाजी खाता था और उसके पास बॉडी आ जाती थी. So just like appearance. So whenever there is the rupture of the biceps, in that situation, sir, there is our bulging. This is nothing, sir. This is our Popeye sign, biceps rupture. Very beautiful. Yes, Praneet, Dharam, Praneet, March is so full of the chat box. Chat box on the fire. बहुत बढ़िया बेटा, बहुत बढ़िया. Yes, Nihal, Aman, बहुत बढ़िया. Yes, now come to this next. This is the another question. There was the image. This is the orthopedics. You all know the carrying angle, but when the hand is getting deviated outer side, so this is the cubitus valgus. Answer is the ulnar nerve damage. But remember, I will teach you the median nerve damage, supracondylar fracture, which will result in the cubitus varus. Okay, sir. So we have to learn this cubitus varus valgus. Now, what we have to study? FMG January 2023. Again, they are asking the nerve. Means upper limb. You have to study the learn. So this is the medial epicondyle. Just behind the medial epicondyle, which nerve? Sir, ulnar nerve is the answer. Yes, there is a funny sensation behind the medial epicondyle. That's why humerus is known as the funny bone. Why? Just due to this, our ulnar nerve. Agree, beta? Getting the point? Okay, sir. Now look for this, our next session. Yes, anatomical snub box. I will teach you. Entire 10 minutes we will discuss about the anatomical snub box. So in the anatomical snub box, there is the anterior boundary and the posterior boundary. I taught you during the regular class. Anterior longus, posterior longus, between is brevis. Yes, anteriorly, when this muscle will contract, it will cause abduction of the thumb. So that is our abductor pollicis longus. Yes, when this posterior arrow part will contract, it will cause extension of the thumb. So this is your extensor pollicis longus, and between is brevis. I will tell you later, but it is clear, sir. It is our extensor pollicis longus. Means one question short from the anatomical snub box or its clinical point. I will teach you the 5 clinical here. Okay. Now look for the action. No need to mug up. I told you the concept. You given the 1 hour for the general basic concept. Can you see? Without identifying this activity muscle, sir, this muscle is coming from the above. It is crossing from the above and then lateral. Jidhar muscle, udhar movement. This muscle is above, this muscle is laterally. So when this muscle will contract, it will cause above and lateral movement. Sir, this is the abduction. Yes, away from the midline abduction towards the midline adduction. So this is causing the abduction at the shoulder. Okay, yes, definitely, Dr. Barkat, you will get the PDF at the Cerebellum Academy app as well as Cerebellum Academy, our Telegram channel. Okay, so don't worry, just focus. Don't worry, just focus here. Okay, now look here. There is the one controversial question. June FMG 2020-22. A patient comes to the OPD with chief complaint of the pain and swelling in the shoulder. A fracture of the clavicle is suspected, which is the most common site of the fracture. So there is a Drishyam movie. What happens? We are aware from our orthopedics. We are aware from the orthopedics that there is the clavicle Alman classification. Sir, there is the medial 1/3, lateral 1/3. Sir, the middle 1/3, 80%. Sir, lateral 1/3, 15%. And sir, medial 1/3, yes, 5%. Remember, beta, the drawback of the PYQs. PYQs, they are must. लेकिन बेटा उसका घाटा भी होता है. When we are doing the PYQs, there is a Drishyam movie. What is the Drishyam movie? Yes, 2 जून को पणजी गए थे, सत्संग में पाव भाजी खाए थे और वहां से हम वापस आ गए थे. यस, विजय और उसकी फैमिली इतनी बार इन चीजों को कहती है कि सब लोग ये मान लेते हैं, लेकिन एक्चुअली ऐसा नहीं हुआ था. When we are doing the PYQ again and again, at that time in exam, yes, when this question will be asked, it happened in the June FMG 2020-22, and all students mark this answer, medial 1/3. No, the medial 1/3, sir, medial 1/3 is 5%. But due to the Drishyam, due to the rapid, again and again, looking for your PYQs, you will see that medial 1/3 as the middle 1/3. Okay, so read every line, every point, every comma carefully. You all know the famous dialogue from our GRG, sir. Okay, so focus for that. It is not the middle 1/3 given in the option, it is the medial 1/3. Okay, so if it is not given, in that situation you have to opt the junction of the medial 2/3 and lateral 1/3, because this junction, it is lying near the middle 1/3 part. Agree, beta? Okay, yes, very good, Aditi. The update is there. There is a medial 3/5 and lateral 2/5. Now that is update, beta. Okay, Aditi. Yes, Prakash, you are right. That same example. Yes, Oppenheimer is very, very good student. Yes, he is giving the perfect update from the Gray's Anatomy 42nd edition. We will discuss. Now, remember, this is the very easy question. No excuse. Can you tell me what is the situation? Elevation. This is, sir, our winging of what? Sir, scapula. Sir, this is our winging of scapula. Got the point? Okay, so this is done due to paralysis of the which muscle? Answer is the serratus anterior. So I will teach you the muscle and their nerve supply and clinical. Yes, very good, Prakash, very good. Now can you see again FMG 2020, shaft of the humerus was noted, and there is the line, inability to extend his wrist. Inability to extend the wrist means this condition. This is the wrist drop. FMG 2020. They're asking the same question. This is our bullet train discussion and analysis. They are asking the same question, wrist drop and the shaft fracture, in little different twisting way with the orthopedics and the radiology. Yes, answer was the radial nerve. 2023, beautiful analysis. Yes, sir. This is your FMG 2020. Same question, little different way. Answer is again radial nerve. Agree, everyone? Same things are asked in your INICT NEET PG with little more twisting, na? Okay, sir. So can you observe again? They are asking leprosy treatment. This is your community medicine PSM, conceptual brainstorming integration. Yes, in case of the leprosy, Mycobacterium leprae, it is involving the skin depigmentation, sweat gland damage, yes, hair follicle loss, and then they are penetrating deeper side and they are involving the nerve. Which nerve? Most common nerve, ulnar nerve, and ulnar nerve will cause the ulnar claw hand. I will teach you. Getting the point? Also, it can involve common peroneal nerve in the leg. Another very important MCQ from the NEET PG 2019. Sir, great auricular nerve. Crinos. What I want to tell you, sir, ulnar nerve, sir, common peroneal nerve, and sir, great auricular nerve. Don't forget this great auricular nerve. It is related with the shaving area, angle of the mandible, It is related with the Fraze syndrome, auriculotemporal nerve syndrome, root value C2, C3, 5 MCQs. Yes, till now we had covered 23 MCQs, approximately 23, 24. Many important lines I told you, na? Agree, sir. Now come to the our point. Okay, sir. Now we are starting the theory part. What I want to tell you, bullet train revision, previous year topics and the previous year question. Previous year question, can you see topic? What is this? Sir, nerve. Sir, anatomical snub box. Sir, clinical of the muscles. Sir, our fracture, cubitus varus valgus. Sir, again nerve. Sir, here is again nerve. Sir, again nerve. Okay. Yes, clinical of the muscle. Fracture. Yes, movement. Anatomical snub box. Means in this your FMG exam. Sure. One question from the nerve. One question from the anatomical snub box. One question from the muscle. In your NEET PG INICT, more focus on the neuroanatomy and the head and neck face part. But in FMG exams, the upper limb, lower limb, last FMG exam, 4 questions from the upper limb directly. Okay, so according to it, but when you will see bullet train anatomy 1.0 session, which crossed more than 2.5 million views, that is NEET PG session. So NEET PG student 7.5 hours. क्या माहौल बना था? Okay, please go for that session. This is also very useful. This is the latest session for the FMG as well as NEET PG. Okay, but P by Q you can cover from there. Okay, so now it is clear the nerve part is coming. Okay, yes, very good, Aditi. Yes, yes, beta, yes, KP. We are integrating that all the things. बहुत बढ़िया, very good open humor. Pectoris major Poland syndrome, very nice. Okay. Yes, yes, Nimra, you are right, बेटा नीट सेशन जो था वो रात को 1:30 बजे 2 बजे तक चली थी, माहौल था. ओके, गेम चेंजिंग था वो. सो नाउ फर्स्ट अपर लिंग, द डिफरेंट बोन्स. सो आई विल शेयर दिस ऑल द थिंग्स आई एम शोइंग इन द 3D and then we will talk about our muscles. Look here, beta, the bone part. Yes, focus. Sir, upper limb, this is the beauty bone, clavicle, the medial 2/3, lateral 1/3. This is the beauty bone, MCQ. This is the collarbone, MCQ. Remember one update from the Grey's Anatomy 42nd edition? They are saying medial 3/5 and lateral 2/5. Now this is the scapula. Yes, scapula, the coracoid process, MCQ. It is palpated in the our deltopectoral groove. Next, superior angle of the scapula, T2 spine. Inferior angle, T7 spine. Variations are possible. So few books are mentioning T3 and T8, but T2 and T7 most important. Another MCQ, spine of scapula, T3 level. Yes. Now look here. These all are the MCQs now. Sir, our funny bone, humerus. There is our medial epicondyle. Behind the medial epicondyle, there is the ulnar nerve. The different nerve I will show you later. Now for your pedia and the clinical, sir, forearm, radius and ulna. MCQ. The radius is preaxial bone, the bone towards the thumb, known as preaxial, the bone towards the little finger, known as postaxial. And these are the your carpal bone. Beautiful anatomy. So anatomy, this anatomy is very, very beautiful. So can you see, can you do imagination? Sir, the lateral side and medial side, she looks too pretty. Try to catch her. Sir, scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate, and then metacarpal, and then phalanges. So these are our quick session. Yes, yes, yes. So Dr. Molly is saying wonderful session. Thank you, beta. Thank you, thank you. Thank you, Dr. KP Chaudhary, for saying best teacher in India in anatomy. But I want to say again, in first bullet anatomy, I told again, I'm telling you, better remember, all students are best, all teachers are best, all institute are best. But only we have to see where our tuning is matching. You are liking my teaching way, you are liking my language, and I became best for you. In the similar way, there is a way any other teacher and any other student, they are doing resonance. There is tuning there. There is a proper tuning in between them. So that anatomy teacher or any subject teacher, he is best, she is best, and that students are best for that teacher. So you are best for me and I am best for you. Every teacher is best, every student is best, and yes, we all are just spreading the knowledge and we are making this world for beautiful to live together. Okay, चलिए मिल करके बहुत ही खूबसूरत सी सोसाइटी बनाते हैं जहां रहने में हमको मजा आए. Yes, we are spreading the knowledge. Okay, so thank you everyone for saying the lovely words. Okay, thank you, Priyanka, thank you, beta. So what I want to tell you further. Okay, sir. So these are the our different osteology part. Now I'm going to tell you the muscle part. Entire list is here. Yes, how to study the our anatomy. These all are the upper limb muscle. See here, osteology part I told you in the quick revision session. Now the myology muscle, pectoral region. Then we will learn back region. Then we will learn the shoulder region. We will see the axilla and the brachial plexus. And then arm, forearm, hand. Agree everybody? How we have to study? Sir, pectoral region. Revise with me. Chanting, chanting, chanting. Do chanting with me. Pectoral region, back region, shoulder region, axilla region, arm, forearm, and then hand. Agree everyone? So now we are moving for the next. Yes, thank you everyone. Thank you, thank you. Now try to understand further. Okay, sir. One by one. Pectoral region. What you have to do? Break the name and get the idea. At the pectoral region, there is one muscle. Pectoral region, that's why pectoralis, it is big muscle, that's why major. Another muscle, break the name and get the idea. मिर्जा गालिब कहते हैं सारे राज नाम में दफन रहते हैं. Sir, pectoral region but small, that's why pectoralis minor. Sub means below the clavicle, that's why you will say subclavius. Zigzag appearance and it is migrating to the front, anterior. So now I'm showing you with the 3-dimensional anatomy. Now you have to give the answer, na? Okay, sir. Jarvis, enlarge it. Yes, chest, pectoral region. This is the platysma we are removing. Can you see this muscle? Pectoral region, big muscle. Pectoralis major. MCQ. When this muscle will contract, yes, jidhar muscle, udhar movement. This muscle is on the front of the shoulder joint. This muscle is on the front of the shoulder joint. So try to understand. Suppose I have to climb up. So when I will climb up, I have to do this movement. What is this? Sir, this is the extension. Pectoralis major is coming from the front. So when it will contract, it will cause flexion. But if my arm is flexed, so when this muscle will contract, it will cause extension. And extension is helpful. I have to climb up. So extension is used during the climbing activity. Which is the extensor? Sir, pectoralis major. Remember, it is flexor in extended arm and it is extensor in the flexed arm. So it is the climber muscle, MCQ. The most common congenitally absent muscle in the body, pectoralis major. This congenital absence of the pectoralis major is known as Poland syndrome. MCQ. It is supplied by the two nerves, medial pectoral nerve, lateral pectoral nerve. So any muscle which is having the two nerve supply known as hybrid muscle. इससे बाहर का कुछ नहीं आएगा. इतने फैक्ट आपको याद रखने हैं. What you have to remember, directly, indirectly, they will twist the manner, but this fact will be asked. Agree, beta? Fine. Now, further, we are going to discuss. Yes, thank you everyone, thank you. Now we are cutting this muscle and looking for this muscle. Sir, at the pectoral region, a small muscle. So pectoralis minor. It is taking origin from the 3rd, 4th, and 5th rib, and it is getting insertion into the coracoid process. Okay, sir. This is known as key muscle of the pectoral region. 1 MCQ. When this muscle will contract, there is the forward movement of the scapula. Forward movement of the scapula, protraction, MCQ. It is the protractor of the scapula. Now supply. Again, double now supply. Same. Lateral pectoral nerve, medial pectoral nerve, hybrid muscle. Complete, beta. Now, come to the next. Can you see this one? Sir, this is a zigzag muscle, serrated appearance. Serratus. It is migrating on the front side. Anterior. सारी चीजें नाम में छुपी रही हैं. Just break the name and get the idea. Sir, this is the serratus anterior. Can you see? It is taking origin from the upper 8 ribs and it is taking insertion into the scapula, costal surface, along the medial border. Yes, sir. Now, I told you the origin and insertion. Action. When this muscle will contract, jidhar muscle, udhar movement. Where muscle goes, there movement flows. Yes. When it will contract, scapula will go forward or backward. Sir, when this muscle will contract, it will pull the scapula forward. When the scapula is coming forward, see my shoulder. When the scapula is coming forward, it is helping in forward movement of the humerus. So this is the pushing and punching action. Don't forget, yes, it is the protractor of the scapula. It is pushing and punching activity muscle. This is done by the boxers. That's why which muscle is known as boxer's muscle? Don't forget, sir. Answer is the serratus anterior. Agree, everyone? Yes. Now remember, now supply one nerve in the thorax with the long course, long thoracic nerve. It was studied by the Bells. That's a Bell's nerve. B for bell, B for boxer, B for bell, B for boxer. Don't forget. Agree? Okay, sir. Now look for the our muscles at the back side. Can you see? Sir, this is the our triangular muscle, trapezius. Now cut this trapezius, and can you see this is the very wide muscle on the back side, dorsal side. So this is a latissimus dorsi. 3D orientation. Now cut this muscle. I will show you the cadaveric image also, but focus. Can you see this muscle? Sir, it is inserting at the upper angle of the scapula. So when this muscle will contract, yes, sir, where muscle goes, there movement flows. This muscle is going upside. Jidhar muscle, udhar movement. So it will elevate the scapula. What should be the name? Levator scapulae. Agree? Now try to understand further this one. Yes, this is the rhomboid shape muscle, but it is small. Can you see? There is the rhomboid shape muscle, but it is big. So rhomboid major and rhomboid minor. The INICT question, the muscles, these levator scapulae, rhomboid minor, rhomboid major, these are supplied by which nerve? Your answer is the dorsal, because it is on the back side. Scapular region, that's why scapular nerve. Dorsal scapular nerve is your answer. Getting the point? Okay, fine. Yes. Don't worry. Wait for the Spider-Man. Spider-Man entry will be there. Okay, don't worry. Right now the Peter Parker version is here. Okay, and then Spider-Man will also come. But yes, you have to keep the attention. And in between the each slide, yes, Spider-Man is coming with the our very great thoughts as well as the sharies. Don't worry. सब्र का फल मीठा होता है. स्पाइडरमैन जरूर आएगा, सांसें थाम के रखिए. लेकिन वो सेशन के बीच में या आखिरी में कभी भी आ सकता है. डोंट लीव दिस सेशन. ओके, सो व्हाट आई वांट टू टेल यू. ओके सर, these are the muscles of the back. Now this is the our scapular region. Can you see delta shape muscle, deltoid? Now cut this delta shape muscle. There is one muscle which is above the spine of scapula. What should be the name? Supra spinatus. Supra means ऊपर, स्पाइन के ऊपर है, दैट्स अ सुप्रास्पाइनेटस. कैन यू सी दिस इज बिलो द स्पाइन ऑफ स्कैपुला. क्या नाम होगा? इंफ्रा स्पाइनेटस. सर इंफ्रा स्पाइनेटस, नो नीड टू ब्रेक द नेम. सर दिस इज द राउंडेड इन अपीयरेंस, छोटा है, टीरिस माइनर. कैन यू सी दिस मसल? सर ये कंपैरेटिवली बड़ा है. सर टीरिस मेजर, दिस टीरिस मेजर इज नॉट रीचिंग टू द शोल्डर जॉइंट. सी हियर, यहां पर शोल्डर जॉइंट है, दिस द शोल्डर जॉइंट, but the teres major is not reaching to the shoulder joint. So remember, which is not the component of the shoulder joint? Rotator cuff, musculotendinous cuff. Answer is the teres major. Very hit question. Now look for this muscle, beta. Sir, this muscle is in the subscapular fossa. Subscapularis. Agree everybody? Fine. Okay. यस. हल्क वाला वर्जन तो हम अब भी ऐसे ही ला सकते हैं. सो फॉर ऑल ऑफ यू, यस, जस्ट सी द हल्क वर्जन. ओके, सो आई एम ब्रिंगिंग द वन अनदर मैजिक. आई टोल्ड यू द इनविजिबल मैन, हैरी पॉटर, अदृश्य चोगा. And now I am going to launch the Hulk version as well as Ant-Man version. So just see here, abracadabra, gili gili choo. So this is the Hulk version. Okay, now I am going to show you the Ant-Man version. Abracadabra, gili gili choo. Okay. Yes, this is the Ant-Man version. I can become the more small for all of you. Yes. Ant-Man version, invisible. And now I am becoming the Hulk version. Yes, so this is the magic of the anatomy. So again, now come at the proper size. Now again, after this enjoyment, yes, come to the our anatomy. Hope you all are liking this session. Okay, so we are moving this all the things. Yes. अरे भाई ब्रिजभान का ही तो माहौल है. ओके. यस, ओपनहाइमर को पता चल गया कि जादू कैसे हुआ है. ओके, थोड़ा कैजुअल है सर. बिल्कुल सही. ओके, चलो तो आगे बढ़ते हैं इसी मजे के साथ. सर, दिस ऑल आर द थिंग्स व्हिच आई हैड लिस्टेड हियर, बट नाउ इट इज योर टर्न. नाउ बिकम केयरफुल. लुक हियर. लेट्स स्टार्ट द cadaveric images. Whenever the cadaveric images are asked, yes, ताड़ फील. ओके, ताड़ जैसा लंबा सिस्टम, ये है एनाटॉमी का, वर्मा जी का सिस्टम. यस, सो नाउ केयरफुल. डू रिमेंबर earlier I told you, whenever the cadaveric images are asked, they will show any clinical case, they will ask any clinical case, any clinical version, 4 option. When you will see the image, you will get confusion. At that time, what you have to do? Give proper 20 to 30 seconds to the image and remember that great lines from the राहत इंदौरी साहब. राहत इंदौरी साहब कहते हैं, वो बुलाती है मगर जाने का नहीं. Yes, you all know. वो बुलाती है मगर जाने का नहीं. ये दुनिया है, इधर आने का नहीं. मेरे बेटे तू इश्क कर, मेरे बेटे तू इश्क कर, लेकिन हद से गुजर जाने का नहीं. So with this line, apply that lines at this part. Yes, वो दिखाता है मगर देखने का नहीं. First look at the option, give direction to your thoughts, then look above, down, medial, lateral. Agree? Fine. Now think about it. In exam, the image, the question, it will not come what you studied. Better, this is the pariksha. पर इच्छा, ये दूसरे की इच्छा है. पर इच्छा, आपकी इच्छा नहीं है. So make this mentality exam technique for all of you. Exam में बेटा पहले ऐसी mentality बना के रखो. The different kind of the other questions will be asked. So you have not to get sympathetic stimulation. Be cool, calm, relax. Look at the option. Give direction to your thoughts. Exam techniques I'm telling you. And after that all, yes, you have to focus the part which you studied. आपने कम पढ़ा है, but yes, 4 options are there. You can remove the 2 options. 2 options are remaining there. Whatever the best option you are feeling, whatever you studied, go for that. Yes, remember, you have to focus properly. Definitely you will get the best answer. You are warrior. आपको अधिकार ही नहीं है कि आप इस युद्ध में जीतोगे कि हारोगे, ये सोचने का. ओके, व्हाट यू हैव टू रिमेंबर बेटा, यू आर वॉरियर, यू आर सॉल्विंग द एमसीक्यू, यू हैव टू गिव योर बेस्ट. आपको ये सोचना ही नहीं है कि आपने एमसीक्यू सही किया है या गलत. यस, आपको अपना बेस्ट देना है. यू हैव टू फोकस फॉर द योर बेस्ट. फोकस, कंसंट्रेशन. फाइन. You are getting the water for drinking, you are getting the proper AC. Don't think about it. You have to adapt by giving the test this all the situation. Give the test in such kind of the manner, so seriously, so that when you are going for the exam, just you have to feel, यार एक छोटा सा टेस्ट ही तो है. It is just one little test. So seriously you have to give the test just like the exam, so that exam will appear just like a test. Getting the point, everyone? Okay. So now we have to look for this all the things. Tell me. With the option you can get, sir, it is the pectoral region. So can you observe, sir, this is our beauty bone. Tell me beta, clavicle. Agree beta? Okay. Yes. Now this is the midline part. Yes, Nimra, you are right. इंसान या तो जीतता है या फिर सीखता है, आदमी हारता कभी नहीं है. Sir, this midline part is our sternum. So can you see there is a one muscle fibers are going towards the humerus. It is at the pectoral region and it is big. So look at the option. Definitely the pectoralis major will click in your brain. Okay, sir. Can you see this is your bone? What bone beta? Humerus. Getting the point? Okay. Yes. Yes. Thank you, Rajeshwar. Thank you. This is very useful for the FMG, NEET, PG, INSET all. Okay, sir. Now, can you see there is the one muscle, triangular muscle on the shoulder side. Tell me what is the name of this muscle? This is the delta shape. So you will say deltoid. Agree, beta? Can you see there is the one space between the deltoid and the pectoralis major? Tell me what should be the name? Sir, it is in between deltoid and pectoralis major. That's why it is delto. Break the name. Pectoral. Yes, sir. Groove. Sir, it is just below the lateral 1/3 of the clavicle. That's why it is also known as infraclavicular fossa. Your question had been asked, in this your infraclavicular fossa, which bony part is felt? Can you see one rounded bone, one rounded bone? Sir, this rounded bone is nothing. This is the coracoid process, which is the classical example. Many questions till now we had covered. Yes, it is classical example of atavistic epiphysis. Nowadays the questions are not asked from the epiphysis, types of the epiphysis, but just one point, atavistic. It is ending with the C. Yes, it is the word C, coracoid process. This is the mnemonic. One another MCQ, sir, here is the one fat collection. Sir, it is in between the clavicle and the pectoral muscle, pectoralis minor muscle inside. So this fascia is tail, it is known as, sir, it is known as clavipectoral fascia. Break the name and get the idea, beta. It is in between clavicle and pectoralis muscle. That's why it is clavipectoral fascia. Another very important question, sir, it is pierced by four structure. You can remember the TALC. Many MCQs, na, 5-6 MCQs from the same slide. TALC, sir, TA, thoracoacromion artery. There are the 2L, lateral pectoral nerve and the lymphatic, and there is a very, very important structure, cephalic vein. No excuse. MCQ, MCQ, MCQ. Yes, the piercing four structures to the clavipectoral fascia. MCQ. Agree everybody? Yes, palpable bone from the front. So yes, just below the clavicle, you can feel anatomy in your own body. Feel the rounded contour of the shoulder. Sir, this is the deltoid. And feel the pectoris major. Okay, sir. So in between them, there is the one depression, that is the infraclavicular groove. Getting the point? Yes. Here one bony part is felt, that is the coracoid process. INI-CT as well as NEET PG question. Coracoid process is palpable in deltopectoral groove. You can see this one, that bony part. Agree, beta? What you have to remember, sir, anatomy you can study, you can understand in your own body. In exam, only one subject you are carrying as the cheating material within the exam hall. That is the anatomy, that is your own body. You can feel the structures in your own body and you can give the answer. कभी ऐसा होता है क्या कि बॉडी तो बाहर रुक और आत्मा तो एग्जाम दे के आ? नो, your body and soul both will go inside the classroom, inside the exam hall, and your body is the anatomy. Okay, so this is your question. Now look for the muscle. Sir, there is a one zigzag muscle. Sir, there is a one zigzag muscle. Definitely this is serratus anterior. Now we are looking the other muscle. Cut the structure and then look inside. Again, वो दिखाता है मगर देखने का नहीं. Yes, you have to observe the option, give direction to your thoughts, cadaveric image, and then look above, down, medial, lateral. Okay, sir. Can you see this structure which is horizontally located? Sir, this is your clavicle, beauty bone. So can you tell me beta, beautiful answer. This small muscle just below the clavicle, sir, it will be sub. Below, that's what sub. Clavius. Sub means niche. Can you see? There is the one muscle which is going towards our coracoid process. Tell me, beta. Beautiful imagination. So beautiful, so elegant, just looking like a wow. Sir, it is at the pectoral region, pectoralis, and it is a small muscle, that's why minor. Simple. Okay. Yes. Now in exam, same image will not be asked. Okay. But be cool, calm, relax, focus, give 10 second, 20 second properly. 4 options, remove the 2. 2 will get confusion together. Yes, think from the inside. You have not studied too much, but okay, fine. Less studied, but revision more. Whatever the best answer, mark that and move for the next option. और बेटा जब नेक्स्ट क्वेश्चन को सॉल्व करोगे तो ये नहीं सोचना कि पिछला क्वेश्चन सही किया है कि गलत. This is the exam technique which I am telling you. Okay, what you have to remember, beta, there are the students who are studying too much, but they are not getting the selection. Why? Because of the overthinking, because of the sympathetic stimulation. They are marking the question and they are thinking, यार मेरा सिलेक्शन होगा कि नहीं होगा, अगर सिलेक्शन नहीं हुआ तो मम्मी पापा क्या कहेंगे, मेरी शादी होगी कि नहीं होगी, मुझको छोड़ के चली जाएगी. Yes, you are thinking in such kind of the way. Yes, too much study but not getting selection. But one student is there, too much health problem, too much family problem, friends problem, anything, studied only for the 2 months but focused properly. Now in exam hall, he is only thinking about the solving the question, studied less but not thinking here and there, not thinking about the family, health problems. Okay, not thinking about the girlfriend, boyfriend, फालतू चीजें सोचनी नहीं है. Not thinking about the water, not thinking about the AC, but focusing every question. Yes, removing the 2 option and in between the 2 option, the best option marking and then moving for the next question and not thinking previous question he did right or wrong. बेटा आप एक योद्धा हो, याद रखना, योद्धा का काम होता लड़ना. ये बिल्कुल नहीं सोचना कि इस युद्ध में तुम्हारी जीत होगी कि हार होगी. तुम्हारा हक ही नहीं है ये सोचना कि तुम्हारी जीत होगी कि हार होगी। आपका काम है एमसीक्यू सॉल्व करना। यू हैव टू गिव योर बेस्ट, डोंट थिंक दिस इज राइट और रॉन्ग, गिव योर बेस्ट, फोकस। एग्री एवरीबॉडी? ओके, yes, Dr. Tentative, Spider-Man will come, but keep focus for the study in between or at the end, the Spider-Man will come. Okay, so yes. Now try to understand further. Come to the next. Look here, any clue point, look at the option. Sir, ear is there, means it is front or back? Sir, it is the back side. So if it is back side, can you observe one muscle is coming from the above, lateral? Yes, upper fiber, middle fiber, and lower fiber. Sir, this muscle is trapezoid in shape. When you will meet the two halves together, then it is trapezoid. INICT question, when you are looking one side, then it is your triangular. But when you will see that both sides, when you will see the both side, it will appear just like the diamond or rhomboid shape, just like the Superman S shape. Yes, INICT question, when you are looking the one side, then it is appearing like the triangle. This is the diamond shape, rhomboid shape, trapezoid shape. One half, that is a trapezius. Okay, one half triangular. Now can you see the upper fiber will contract and it will cause elevation. That is the shrugging of the shoulder. Remember, here is the one nerve. Which nerve? 11th cranial nerve. So whenever there is a damage to the 11th cranial nerve, the trapezius is getting paralyzed. So the shoulder cannot be elevated. Shoulder will get down. Do you remember the Allu Arjun? Pushpa, झुकेगा नहीं साला, तेरी झलक शर्फी, श्रीवल्ली नैना मदक बर्फी. Do you remember? Yes, Allu Arjun, Pushpa movie, he got injury to the 11th cranial nerve. Upper fiber paralyzed, so there is the no proper position, there is a drop of the shoulder. Remember, this was the question from the FMGE 2023 January session, I think July session. There was the injury at the neck and 11th nerve paralyzed. This one is the question. Yes, it is causing the shrugging of the shoulder. Now can you see when this muscle will contract, it will cause retraction, backward movement of the scapula. MCQ. And when this is contracting, the middle fiber and the lower fiber contracting, the scapula will move upside. That is the overhead abduction along with the our serratus anterior. So one update for all of you: abduction, Gray's Anatomy, 42nd edition. Yes, very good, everybody. Yes, thank you, Dr. DRSS. Okay, what I want to tell you, sir, abduction 0 to 15 degree, 15 to 90 degree, and 90 to 180 degree. 0 to 15 degree, sir, that is done by the supraspinatus. This is done by the deltoid, and 90 to 180, it is done by the serratus anterior and the trapezius. But this is wrong. Gray's Anatomy 42nd edition. Sir, this Gray's Anatomy 42nd edition is saying, sir, this Gray's Anatomy 42nd edition is saying the update. Also the BD Chaurasia, sir. Also the our Vishram Singh, sir, they are saying 0 to 90 degree, sir, 0 to 90 degree. It is done by supraspinatus as well as deltoid, and then 90 to 180 degree. This is done by same. So remember, this is the one update. अब easy हो गया है. 0 to 90 degree done by the supraspinatus, 0 to 90 degree done by the deltoid, while the 90 to 180 degree, this is done by trapezius as well as serratus anterior. So this is the update for all of you. Okay, yes. थैंक यू एवरीवन, थैंक यू बेटा. लेकिन यस, हम सभी का कोई फैन नहीं है बेटा, हम सभी बस एक दोस्त हैं, है ना? ठीक है, तो दोस्ती में नो सॉरी, नो थैंक यू, बस मजे लो, बढ़िया से पढ़ते चलो. ओके, सो नाउ ट्राई टू अंडरस्टैंड. यस, परफेक्ट डॉक्टर ऐश्वर्या. ओके सर, नाउ कैन यू सी, सर, देयर इज द वन मोर पोर्शन यू कैन ऑब्जर्व. सर, दिस very wide muscle at the back, this is definitely latissimus dorsi, and you can observe this is your medial border of the scapula. So you can see this triangle, sir, this is triangle of auscultation. Orally I am telling you the boundary of the triangle of the auscultation, where you put the stethoscope and you hear the rhonchi crepitus of the abnormal lung sound. Sir, medial boundary is formed by the trapezius. Sir, lateral boundary is formed by the scapula, and the base is formed by the latissimus dorsi. Yes, Here no thick bulky bone or muscle is located. The floor is formed by the yes, you can remember the sixth rib, seventh rib. So you will say there is the our sixth intercostal space, seventh intercostal space. Yes, you have to remember seventh rib, above the seventh rib, sixth intercostal space, and the seventh intercostal space. What you have to remember? Seventh rib, sixth intercostal space, seventh intercostal space. Also the rhomboid muscles are there. So these are making the floor. Okay, sir. Now cut this structure. When you are observing, look at the option. Can you see, sir? This is the scapula-medial border. Okay, sir. So you can observe one muscle at the up. When it will contract, it will elevate the scapula. Sir, it is a levator scapulae. Can you see this big muscle? Sir, it is rhomboid in shape. It is big. That's why it is rhomboid major. Agree, beta? Very simple, no? Focus. And here you can observe one another muscle which is small. Sir, it is our rhomboid minor. Agree? Okay. Now look here. There is the one nerve जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. So one nerve is located here, which is on the dorsum part of the scapula. So it is known as dorsal scapular nerve. Root value C5. Every point which I am telling, everything is MCQ. It is supplying the levator scapulae, rhomboid minor, and the rhomboid major. Very important. Now, when this muscle will contract, they will bring the scapula backside. That is the retraction. Forward movement, protraction. Backward movement, retraction. So another MCQ from the AIIMS, AIIMS, then NEET PG. And now these are asked in your FMGE exam. Sir, scapula, special movement, forward movement, protraction, MCQ, backward movement, retraction, MCQ. Remember, protraction is done by serratus anterior and pectoralis minor, while the retraction is done by, yes, trapezius. Another answer is rhomboid minor and one more rhomboid major. बेटा यहीं से क्वेश्चन आएगा, बार बार पढ़ना है, सोते जागते उठते बैठते खाते पीते, भूलना ही नहीं है, यहीं से क्वेश्चन आएगा. They will twist the pattern, but the basic things will be the same. What I want to tell you, yes, with this concept, one more update: winging of scapula. Sir, the winging of scapula, best answer is serratus anterior. But if it is not given, then you can see, sir, this rhomboid muscles as well as trapezius muscle, these are supporting the medial border of the scapula. So if serratus anterior is not given, then you can mark the trapezius also. Remember, the second best answer, sir, the second best answer is our trapezius. Yes, sir. The second best answer is our trapezius, and last answer is rhomboid major and minor. Remember, always the controversial questions are asked. Okay, perfect, perfect, very good. Rosanna, KP, Chaudhary, Dr. Ashwarya, Nimra, you all are perfect, beta. What I want to tell you, the controversial question, they will ask, who is wife of Salmon Bhoi? Okay, this is the controversial question, and such kind of the questions are asked in FMG, NEET, PG, INICT. Option will be there: Ashwarya Rai, Katrina Kaif, Lulia, Jacqueline Fernandez. All will not be given. None is also not given. You all know the answer. None. लेकिन बेटा वो नहीं दिया रहेगा. But yes, you have to opt the single best answer. Now use the update. If you will mark the Aishwarya Rai, Bachchan family will not leave you. Don't mark the Aishwarya Rai. If you will mark the Katrina Kaif, remember, house the Josh will get down. And yes, remember, चांद तारे वो बाद में तोड़ लाएगा, पहले तुम्हारा सिर फोड़ लाएगा. So don't mark the Katrina Kaif. Okay, Lulia, yes, previously it was in update. I was taking the class at the Delhi. At the backside, one student, he shouted, farmhouse. Yes, such kind of the update you have to know. If none is the answer, but latest update is saying the event about the Jacqueline Fernandez, so you have to mark that one. Okay, if otherwise all is given, you can mark the all. Such kind of controversial question will be asked. Taj Mahal is situated, but Agra will not be given. Then you can mark the Delhi. If Delhi is not given, then you can mark the India. India is not given, then you can mark the Asia. Asia is not given, you can mark the Earth. Yes. So such kind of controversial question, whatever the nearmost answer, according to the update, you have to go. So this is the another exam technique which I told you. Okay. Yes, you have to know the update. Fine. Okay. Hope you all are enjoying the session. Sure, beta. Serratus anterior. ये आ रहा है. Don't worry. Now look for this muscle. Sir, this is the our back side part. Can you see this rounded curvature? Sir, this is the iliac crest. One muscle from the iliac crest. Then can you see this is the vertebral spine? Yes, sir. And it is going towards our humerus. So big muscle. So definitely it is our lata muscle. Lata means wide. At the dorsum, that's what dorsi. Remember, this is the very wide muscle at the backside, latissimus dorsi. This is the best muscle for the muscular graft. You will roll this muscle from the backside and you will put on the front and you will do the cosmetic surgery for the mastectomy operation. Yes, because it is the best muscle for the muscular graft. So remember, this muscle is having the nerve supply with the best number. And what is the best number? 786. Bismillah, अल्लाह के नाम से शुरू करता हूं. 786. This is the MCQ. You can say C6, C7 and C8. This is the answer. And this name, the name of this nerve is, it is in the thorax on the dorsal part. So you will say, sir, it is the our thoraco dorsal nerve. It is a nerve supply. So remember, latissimus dorsi, best muscle for the muscular graft. Thoracodorsal nerve supply, root value 786, C6, C7, C8 at time of exam, 786, best number you have to give. Okay. Now look, the latissimus dorsi, sir, it is also known as the climber's muscle. Why? Look here, sir, this muscle is coming from the back. Sir, this muscle is coming from the back side. Yes, Aditi, अरे वाह, thank you. मजा आ रहा है ना? याद करते चलो बेटा, यहीं से क्वेश्चन आएगा, सारी चीजें यहीं से क्रैक होगी. Can you see this latissimus dorsi? Sir, it is the very wide muscle. It is coming from the iliac crest, our spine part, sacrum, and these fibers are going towards the lady between two major. Yes, it is coming at the floor of the intertubercular sulcus. Lateral lip major, pectoris major, medial lip major, that is our teres major. So at the floor, which muscle? Remember, that is a latissimus dorsi. Can you see, sir, the upper fibers? Yes. I'm going to show you with the one demo. एक रुमाल से मैं आपको डेमो दिखाता हूं. See here, the upper fibers are going down, but the down fibers, they are going upside. Getting the point? So these kind of the fibers are known as your, remember, the twisting fiber, spiral fiber. MCQ, NEET PG 2018. Can you see one demo? Sir, upper fiber, can you see upper border? Can you see the lower border? Demo. So during the insertion, the upper fibers are going down and down fibers are going up. So this is your spiral or twisted muscle fiber. Don't forget, it is very important question. What you have to remember, sir? Yes. This is session very useful for the first MBBS students also. Yes, because every basic is coming from the first MBBS. So you can inform to the first MBBS students also the question: twisted or spiral muscle. Don't forget latissimus dorsi. It is the answer, as well as pectoralis major. And same muscles are causing extension. That's why you will say these are our, yes, climber's muscle. MCQ. Yes, because this latissimus dorsi is very bulky. Yes, when this muscle will contract, they will cause extension. That's why they are helping in the climbing, because it is more bulky than pectoris major. So that's why it is the best climber muscle. Best answer. Now look for the next. We are looking for the our rotator cuff muscle. You all are aware, SITS, supraspinatus, infraspinatus, teres minor, and here is a subscapularis. Can you see the cadaveric image 3D? I told you, sir, there is our spine of scapula. So the muscle above the spine, supraspinatus. Below the spine, this big muscle is infraspinatus. Can you observe this particular muscle going towards our shoulder joint? Sir, this is our, yes, teres minor. Can you observe this another big muscle? Sir, it is our teres major. Yes, sir, it is our teres major. Got the point? Okay. Now, earlier there was the question: upper quadrangular space, upper triangular space, lower triangular space. But nowadays they are not asked. That's why I'm not discussing in this bullet train revision. You can remember with this fingers also. Okay, sir. So these all muscles are going towards the our, yes, shoulder joint. On the front side, you can see the subscapularis. Remember, this subscapularis muscle is multi-pennate MCQ, as well as it is classical example of hybrid muscle MCQ. Agree, beta? These all are first muscle. Then here you can see the tendon-like structure. That's what tendon. And here all are fusing. Can you see? Supraspinatus, subscapularis, every muscle, they are getting fused. So this is cuff. These structures are known as musculotendinous cuff because they help to rotate the head of the humerus. That's why the same structures are known as rotator cuff. Remember, the teres major was here. Yes, sir, teres major is getting attached here. So it is not the component of the rotator cuff. The same structures, the SITS, this is the teres minor, not the major. These are also known as dynamic stabilizer of what? Of the shoulder joint. MCQ. Yes, fine. So these are the different points. Now look here. The small pouch of the synovial fluid, sir, it is getting separated from the main cavity. This is known as the bursa. So there is the one bursa just below the our acromion process, sir. It is our acromion process. So this is our what, sir? This is the sub acromion bursa. And whenever there is a bursa, you have to remember, sir, bursitis. Itis means inflammation. So I'm showing you the one question from the bursa nowadays. Yes, housemaid knee had been asked in recent exam. Sir, in the upper limb, can you see the second largest bursa of the body? The first largest bursa is the iliopsoas. So this is the head of the humerus, scapula. Here is the acromion process. Just below the acromion process, one synovial pouch is separated. Sir, this is the bursa. Inflammation of the bursa is known as the bursitis. So there will be the pain and swelling. Remember, Hollywood, Bollywood, Tollywood, they all are coming from the our, yes, anatomy. Yes, 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 मजा आ रहा है ना? ये मजा आ रहा है ना? Yes, ये वाला सही था ना? So what you have to remember, sir, this is the your bursa. Fine. So if there is the inflammation, yes, in that song, what is happening? The heroine is saying, tip tip bursa pani. From the synovial bursa, there is a leakage of the synovial fluid. तो पानी में आग लगा दो. अबे गधी, अगर बरसा से साइनोवियल लीकेज हो रहा है तो ऑर्थोपेडिशियन के पास जाओ. ओके, पानी में आग लगाने की कोई जरूरत नहीं है. सो जस्ट फनी थिंग यू हैव टू रिमेंबर अबाउट दिस ऑल. व्हाट यू हैव टू रिमेंबर, यस, दिस इज द बरसा. So whenever there is the inflammation, it is getting compressed below the acromion process. So now the patient is going to the orthopedician. When there is the adduction, then there is the pain. Getting the point? But when the patient is doing abduction, yes, 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 abduction, then pain absent. This is known as Doburn sign. Remember, sir, it is a Doburn sign. Remember, it is found positive in case of the sub acromion bursitis. MCQ. Getting the point? Okay, yes, yes, yes. होप यू ऑल आर एंजॉयिंग. तो केपी चौधरी एंजॉय कर रहे हैं, लवली एमएस एंजॉय कर रहे हैं, बिजबान एंजॉय कर रहे हैं. रिमेंबर दिस वन. ओके, यस, प्रकाश को भी मजा आ रहा है. ओके, पेट्रोल थोड़ी है जो आग लगा दी जाएगी. यस रोडी, यू आर राइट. ओके, सो व्हाट, डोंट वरी सुप्रीता, वी हैड कवर्ड दिस ऑल द थिंग्स प्रीवियसली आल्सो. तो बेटा ये तो कई बार हो चुका है ना. ये हो सकता है आपके लिए पहली बार हो, लेकिन हमने तो इसको कई बार किया है. ओके, सो व्हाट यू हैव टू रिमेंबर, यस सर, दिस ऑल द थिंग्स यू हैव टू रिमेंबर. सो जस्ट कॉन्सेप्ट सी, if there is the inflammation, sir, it is getting compressed, it is getting compressed below the acromion process. Okay, sir. But when the patient is doing abduction, this bursa, it will get slip inside. The pressure is relieved, so no pain. What you have to remember, when there is the abduction, this bursa is going inside, pressure is relieved. So at time of abduction, pain disappear. But when there is a adduction, pain appear. That is a Doburn sign positive. Agree everybody? मजा आ रहा है? Okay, sir. Now try to catch this point. Arm. Sir, anteriorly there is the BBC and posteriorly there is the triceps. So can you tell me, beta? Yes, sir. This is one muscle which is having the short head. It is having one muscle which is having the long head. So this is which muscle? Sir, biceps. Agree? Okay sir. Sir, this is the biceps. Can you see there is our beauty bone clavicle? Can you observe beta? Yes, this is our one muscle getting insertion into the, tell me, this bony process. Sir, coracoid process. And you can observe this muscle for coming from the coracoid process and inserting into the brachium. This is the coracobrachialis. So tell me, this is pectoralis minor. Sir, this is coracoid process to the brachium, coracobrachialis. Here is our, yes, you can observe the long head and you can observe the short head. Yes, so this is nothing, the two head means it is our biceps. Yes, Priyanka is saying maja aa raha hai, bahut maja aa raha hai. Thank you everybody. Now try to understand further. Okay sir, can you observe one muscle which is having the zigzag? Focus, focus, focus. पढ़ाई के टाइम में पढ़ाई, मस्ती के टाइम में मस्ती. So can you see this is the zigzag muscle? Sir, it is serratus anterior. Who will tell me? Tell me one nerve which is running over the serratus anterior. Yes sir. जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. So this is the nerve to serratus anterior. This is the our long thoracic nerve. This is our, yes, Bell's nerve supplying to the boxer muscle. This is our boxer's muscle. Now can you observe there is a one muscle at the back side, one very big muscle which is coming towards the humerus. Tell me beta, what should be the name of this muscle? Yes, focus, focus. Very good Nimra, very good. Sir, this is at the thorax. So this is our thorax part, dorsal side, very wide muscle. Sir, this is our, yes, latissimus dorsi. So what should be the name of this nerve which is running towards the latissimus dorsi? Again, जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. कौन सी नदी आ रही है latissimus dorsi में? सर, डेफिनेटली दिस इज द nerve of latissimus dorsi, that is the thoracodorsal nerve. MCQ, cadaveric images. Hope you all are agree. Now turn the arm. So when after dissecting this one, we are coming to the back side. Only one muscle, that is the triceps. When we are going to the gym, we are doing this activity for the triceps making. Okay, so you can observe, sir, there is our long head. Yes sir, there is our long head coming from our scapula, infragnular tubercle, and there is our lateral head. This all are fusing and making the triceps. Medial head is below to it. Okay, and these all are getting insertion towards the ulna olecranon process. Why I'm telling you? Yes. Why I'm telling you? Because there are the many questions from this area. Yes. Please focus for it, beta. What I want to tell you, sir, again there is the bursa. MCQ. Bursa se beta ek question aayega. Look here, sir. This is our radius. Here is the ulna. So when you will observe at the back side, so there is one small sinual pouch just above the olecranon process. Sir, this is the olecranon bursa. Again, the song dedicated for this olecranon process. जब भी मैं लड़की देखूं मेरा दिल दीवाना बोले, ओले 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 ओले. Remember why I'm singing this song? Better remember, because the bursa is important. So I'm consolidating this all the memory for your exam. At time of exam, these songs, these shairis will come in the mind. Remember, this is the olecranon bursa. This is getting repeated injury. Students are doing this support. So repeated injury of this olecranon bursa. Yes, sir. This is the olecranon bursitis. What you have to remember this MCQ, sir? There is the olecranon bursitis. You can observe this olecranon bursa, sir. It is humerus. This is the radius. Here is the ulna. This is the our olecranon bursa. So it is getting inflamed in the student. That's why it is also known as, beta, tell me, revise. Students, elbow. Yes, it is getting inflamed in the coal mine markers. That's why you will say, sir, it is our, yes, miner's elbow. MCQ. Agree everybody? Okay, fine. So these are the points which you have to remember. Fine. Now look here, we are coming for our forearm part. So at that forearm part, I taught you, do you remember? At the forearm part, sir, forearm divided into the anterior compartment, posterior compartment. Now each compartment divided into the superficial group, deep group, superficial group, deep group. The nerve of the our anterior compartment, sir, median nerve, anterior interosseous nerve. Okay, sir. While the back side, the radial nerve, post introsseous nerve. Okay, sir. So during the regular class, sir, during the regular class, I taught you how to remember this one. Yes, sir. The 5 muscle, you can remember the 1, 2, 3, 4, 5. Okay. And I had drawn, yes, remember कबीर सिंह की मूवी बेटा बाद में आई थी, हम 2018 के टाइम से 2016 के टाइम से ये ड्रॉ करके अपने यूट्यूब चैनल पे पढ़ा रहे हैं, डॉक्टर श्रीकांत वर्मा क्लासेस. डोंट फॉरगेट टू फॉलो मी एट द इंस्टा एंड द यूट्यूब चैनल डॉक्टर श्रीकांत वर्मा क्लासेस, वहां पर ये वीडियोस आप देख सकते हैं. सो दिस इज द मीडियल एपिकॉन्डाइल. All the muscles of the front, they are coming from the medial epicondyle, they are moving on the front. So when they will contact, they will pull in this way, in this way, in this way. Decrease in the angle, decrease in angle is known as the flexion. That's why this medial epicondyle is known as common flexor origin. And these muscles are known as the flexor muscles. Yes, median nerve is supplying, and this flexion is done by the labor worker. They are digging, they are elevating the heavy weight. So during this all the activity, there is a flexor muscles are acting. Getting the point? So that's why the median nerve is known as laborer nerve. MCQ. So this muscle, first muscle is taking origin from the medial epicondyle, and it is going towards the your ulna. Yes, it is going towards the radius, this black line. So when this muscle will contact, jidhar muscle udhar movement, when this muscle will contact, it will pull in that way. Yes, it is contracting, it is causing this one. This is the pronation. So this is the pronator. It is rounded, that's what teres. Next muscle coming from the flexor point, and it is going towards the radius. So flexor, it is going towards the carpal bone, carpi, radius, that's why radialis. Sir, this is the our flexor carpi radialis. Getting the point? Now see, the next muscle is taking origin from the same point, and it is going to the our palm, very long course. Yes, it is making the flat tendon. So this is the palm. Palmar is long muscle, longest. This flat tendon, chapta tendon को हम बोलते हैं aponeurosis. So this flat tendon is the our palmar aponeurosis. MCQ clinical. The fibrosis of this palmar aponeurosis is known as the dupuytren's contracture. Next, this muscle is coming, and it is dividing into the 1, 2, 3, 4 slips. So this is the flexor point, flexor. It is going to the digit, digitorum. It is above. That's a superficialis. Break the name and get the idea. So simple. Now the next muscle is coming from the same point, and it is going to the carpal bone on the ulna side. Yes. So this is the flexor. Carpal bone, that's a carpi. Ulna side, that's why ulnaris. So this is the way how you have to remember each muscle. But नाम में छुपा रहेगा, रटना नहीं है. Anatomy is not the subject to mug up. And you can easily remember the nerve supply. Which nerve is flowing here? Sir, answer is the our median nerve. All muscles are supplied by the median nerve, except because here is the ulnar nerve. Which muscle is here? Flexor carpi ulnaris. So this flexor carpi ulnaris is supplied by ulnar nerve. जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. Hope you all are getting the point. Okay, fine. Okay, sir. Yes. Crystal clear. Thank you. And the students who are joining for the second time, third time, hope you all are getting the very proper revision. Okay, fun. Very nice. Now try to understand further, sir. When any person is doing excessive forceful flexion, golfer, they are doing forceful flexion. So there is our flexor point is getting irritated. So that is causing the medial epicondylitis, because flexor tendon, they are arising from the medial epicondyle. This is commonly seen in the golfer. That's why remember the medial epicondylitis is known as the golfer's elbow. Your mnemonic is MG, Mahatma Gandhi. The medial epicondylitis, golfer's elbow. And in the similar way, the extensor muscle, they will take origin from the extensor point, and they will go on the back of the forearm. So when this muscle will contract, they will cause extension. So lateral epicondyle is known as common extensor origin. It is used by the tennis worker. Yes, tennis player, they are doing the backhand, forehand. So tennis person, they are getting inflammation of the lateral epicondyle. So remember, the lateral epicondylitis is tennis elbow. What you have to remember? LT, Mahatma Gandhi in lecture theater. Don't forget this orthopedics integration, the CBI. Yes, sir. The CBI orthopedics, very useful. Okay. M for medial epicondyle, G for golfer's elbow, L for lateral epicondyle, T for tennis elbow. Agree, beta? Okay. Getting the point? Yes, thank you everyone. Thank you, thank you. Thank you, Neil beta. Okay, now look here further. Sir, there is the another orthopedics question. Yes, in family, what is happening? Goal, goal, rani, itta, itta, pani. We are playing with the children, and at that time, yes, due to the excessive pull, due to the excessive pull, can you see, sir? Humerus, radius, ulna. Can you see the annular ligament? So the head of the radius, it is pulled from the annular ligament. Yes, sir. This is the pulled elbow. It is commonly seen with the nursemaid. घर में जो आया आती है, बच्चों को देख रही है, वो खेल रही है. So the head of the radius is coming out from this annular ligament. This is pulled elbow. Yes, 3-point relationship will not be changed. Okay. Yes, 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 yes. So these are the different things which you have to remember. Now look, the cubital fossa. Sir, in front of the elbow, there is a triangular muscular depression. Can you see? Yes, yes. Focus, beta. Focus, focus. Can you see this triangular muscular depression? This triangular muscular depression is known as cubital fossa. Can you observe? Sir, lateral boundaries formed by which muscle? Sir, brachium to the radius muscle, brachioradialis. Sir, medial boundaries formed by which muscle? Sir, pronator teres. Again mentioning the brachioradialis, the pronator teres. Sir, the base is formed by the imaginary line which is passing through the our both condyle. Okay, sir. Roof is formed by, I told you, skin, superficial fascia, deep fascia, cephalic vein, basilic vein, antecubital veins are there. But can you observe? Yes, here is the our median nerve content. Then brachial artery. Then tendon of the biceps, and here is our radial nerve. So MBBR is your mnemonic. MBBR. Don't forget, INICT question, FMG question, always the questions are asked. B for biceps tendon. B for, yes, remember the, yes, this is the brachial artery. And then you can say biceps tendon and radial nerve. Now the clinical. When the supracondylar fracture, median nerve is damaged, and there is the gun stalk deformity. When the brachial artery is involved, then ischemia occurs, Volkmann ischemia, and there is the 5P, pain, pallor, paresthesia, you will see there. Okay, for the surgery and ortho. When the biceps tendon is involved, in that situation, the biceps jerk is affected. That's why it is important medicine. And when the radial nerve is damaged, then definitely the wrist drop. Don't forget it. Agree, beta? Fine. So this is important. Now, when you're cutting, you're removing this all. Then can you observe here the tendon? Sir, this is our muscle, brachialis. And when you will see deeper side, can you see, sir, this is the one muscle winding over the radius. It is nothing. At the floor, you can see supinator. Who will tell me what are the muscles making the floor of the cubital fossa? Yes, these are making the floor. Tell me better. Yes, yes, yes. The floor is formed by, sir, the floor is formed by our muscles BSF. Yes, sir. BSF. This is the mnemonic. B for brachialis, S for supinator, F for floor. These are making the floor of the cubital fossa. Remember the border security force, the border movie. संदेशे आते हैं हमें तड़पाते हैं कि चिट्ठी आती है ये पूछे जाती है कि घर कब आओगे लिखो कब आओगे कि तुम बिन ये घर सूना सूना है. Great salute to all our army, our border security force. Don't forget this cubital fossa. One question directly or indirectly from here. One another beautiful integration. Can you see the nerve? It is dividing into the superficial branch, and one another is the deep branch. So remember, this nerve is nothing. It is our radial nerve, which is coming in between the brachialis and the our brachioradialis. This is the another MCQ. Yes, this is the our deep branch, and this deep branch is piercing the supinator muscle, MCQ. And this deep branch is piercing the supinator muscle, and this is going behind the intraosseous membrane, that is the posterior intraosseous nerve. Okay, getting the point? Okay, sir. What I want to tell you, sir, this is our, yes, intraosseous membrane. Here is the radius, sir. Here is the ulna. So this is the intraosseous membrane. One nerve which is running in front of the intraosseous membrane, anterior intraosseous nerve. MCQ, it is the deep branch of the median nerve. Focus, focus, focus. MCQ, the deep branch of the median nerve is known as the anterior intraosseous nerve, while one another nerve is running on the back side of the intraosseous membrane. This is the deep branch of the radial nerve. The deep branch of the radial nerve behind the intraosseous membrane, known as posterior intraosseous nerve. Okay, so these are the points which you have to remember. Okay, now try to understand further. Yes, 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 yes. Okay, Neil, thank you for your such kind of beautiful words, beta. Yes, everything will be गुड. आपको बस लाइफ में याद रखना है, हंसते रहना, मुस्कुराते रहना है, एंजॉय करना है. ओके, एवरीथिंग विल बी गुड. नाउ सी द क्वेश्चन पैटर्न, दैट इज द क्यूबाइटस वेरस. This is the normal cubitus valgus. Sir, this is another clinical point related with the cubital fossa. This is the gun stalk deformity. Sir, this is the cubitus varus related with the median nerve supracondylar fracture. MCQ. Sir, this is the normal position, but when the hand is going outside deviated, this is the cubitus valgus. It is involved in the ulnar nerve. Getting the point, beta? Okay. Yes, beta. देखो, जब भी आप पढ़ रहे हो ना, तो मजे के साथ पढ़ो. आप सभी लोग इतने प्यारे प्यारे कमेंट आ रहे हैं, इतने अच्छी अच्छी चीजें आ रही हैं. बेटा, always, always, always. Yes, everything will be good in the life. Remember. Okay. क्यों डरे जिंदगी से? क्यों डरे जिंदगी से कि क्या होगा? अरे कुछ नहीं होगा तो तजुर्बा होगा. रिमेंबर, आदमी या तो जीतता है या फिर सीखता है. आदमी हारता कभी नहीं है. आदमी हारता उसी दिन है जिस दिन वो कोशिश करने छोड़ देता है. पागलों की तरह पढ़ो, जोश के साथ पढ़ो, जुनून के साथ पढ़ो. यस, एक जिद के साथ पढ़ो. व्हाई आई एम टेलिंग यू बेटा, व्हेन यू आर स्टडीइंग सच काइंड ऑफ थिंग्स, यू आर फॉलोइंग एनी पाथ, द पीपल, द वर्ल्ड विल लव यू. एट दैट टाइम यू हैव टू रिमेंबर, जिसको जो कहना है कहने दो, अपना क्या जाता है. जिसको जो कहना है कहने दो, अपना क्या जाता है. ये वक्त वक्त की बात है, और वक्त सभी का आता है. आपका भी वक्त आएगा बेटा, बस उसके लिए आपको पेशेंस के साथ तैयारी करनी है. एंड वन मोर थिंग आई वांट टू टेल यू, कुछ देर की खामोशी है, फिर शोर आएगा. नीट पीजी एग्जाम पोस्टपोन हो गया है, लेकिन बेटा रुकना नहीं है, थमना नहीं है. ये एक बहुत बड़ी अपॉर्चुनिटी है. कुछ देर की खामोशी है, फिर शोर आएगा. औरों का तो वक्त आया है, हमारा दौर आएगा. With this all the positive lines, never 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 stop, never 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 quit. And this is your gun stock deformity, median nerve injury, cubitus varus. Don't forget this one. Okay, yes beta, yes, yes, yes. Hope you all are enjoying the session. Okay, yes. So what I want to tell you further, look here, this is the way how you can remember the forearm muscle. And now how we will identify the muscles. So look at the option. Can you see the hand? Sir, thumb you have to first identify. Sir, that is the thumb, bulgy part, and this is the less bulgy part. So here you can see the thenar muscle. So the muscle which is making the lateral boundary of the cubital fossa, sir, this is the brachioradialis. And can you see this muscle which is making the medial boundary of the our cubital fossa, sir, pronator teres. Can you follow another muscle which is coming from the flexor point? Focus, beta, focus, focus, focus. It is going towards the carpal bone, towards the radial side. So this is the flexor carpi radialis. Can you observe one artery is there, one artery is there over the styloid process between the brachioradialis and the flexor carpi radialis? Sir, definitely this is our radial side artery, radial artery. Agree, beta? Okay. Now look here, this muscle is coming and it is dividing into the different slips. So this is the flexor. It is going to the digit and it is above. That's why you will say superficial. And can you see the last muscle? Aram se, yes, it is towards the ulna side. It is going towards the little finger. So it is flexor compartment. That's a flexor. Carpal bone, carpi, ulna side, ulnaris. Okay. For the quick revision, this is sufficient. Now look here, beta. Yes. This cadaveric image. Look at the option. We don't know. But can you focus? Can you observe? Anatomy means cut and observe. Observation is the anatomy. This muscle is quadrangular in shape. Yes. So this is the quadratus muscle. This muscle is taking origin from the ulna, inserting into the radius. So when it will contract, it will pull the forearm downside. This is the pronation. So this is the pronator quadratus. Very nice, Nimra. What I want to tell you, sir, there is the one muscle, brachioradialis. Can you see the pronator teres? Okay, sir. Can you observe this muscle? Sir, this is taking three-dimensional origin. Yes, medial epicondyle, going towards the carpal bone, towards the radius. So what is the name? Flexor carpi, radial side, radialis. Now cut this muscle. Can you see this muscle? Sir, it is going to the palm, very long, palmaris longus. Cut this muscle. Look at this muscle. Sir, flexor point, it is going to the digit, digitorum, it is above, superficialis. Now cut this muscle. Look here. Sir, it is taking origin from the flexor point, going towards the carpal bone. Yes, it is related with the ulna. So what should be the name? Flexor carpi ulnaris. Yes. Can you observe one another MCQ? It is getting ossified into the seed-like bone, sesamoid bone, the pisiform bone, the last bone which get ossified. Remember, this is the last carpal bone which is getting ossified among the carpal bone. MCQs. So this is the seed-like bone. No Haversian canal, no medullary cavity, no periosteum. Seed-like bone which ossifies after the birth. Largest seed-like bone, patella. Another one MCQ. Agree, beta? Now, what I want to tell you, yes, very nice, Nimra. Pisiform patella fabula. Fabula is ossified on the lateral side. Remember, here you can observe one nerve. Sir, this is the radius, this is the ulna. Sir, I was saying the other muscles also. Can you see? Sir, this is the flexor carpi ulnaris. Can you observe? This muscle is coming from the flexor point. Yes, flexor compound. It is reaching to the digit, but terminal fingers, especially for the NEET PG students, it is reaching to the distal part. It is a deep part. So this is the flexor digitorum. Superficialis? No. It is a deeper muscle. So you will say profundus. Now look here further. When you will cut this muscle, can you see this muscle? Sir, it is the flexor compartment. It is going to the thumb. Thumb means pollicis. So this is the flexor pollicis. Long muscle. That's why longus. Beautiful imagination. In our 4 days class, we read this all the things in detail, but this is the quick revision series. Can you see this muscle? It is exactly quadrangular. This muscle is taking origin from the ulna, getting insertion into the radius. So when it will contract, where muscle goes, their movement flows. So when this muscle will contract, it will do this downward rotation of the palm. Yes, sir. That is supination, and here is the pronation. It is causing the pronation. That's why it is the pronator teres muscle. Beautiful, beautiful integration. Anatomy is just looking like a wow. Just looking like a wow. So elegant, so beautiful. Just looking like a wow. Can you see, sir? One nerve is coming. One nerve is coming in between radius and ulna. Sir, there is an interosseous membrane. So one nerve is running in front of the interosseous membrane. It is ending into the pronator quadratus. Tell me, beta, what should be the name? Sir, this is the anterior interosseous nerve and vessels. Remember, it will supply the deep muscles. Agree, beta? Okay, fine. In Cerebellum Academy part, beta, in Cerebellum Academy, otherwise at the Hyderabad, we are going to launch our all the complete 4 days class. So there you can meet. Otherwise, right now, ORR 1 day full day class we done. Hai na? Okay. So just wait because schedule has been changed. Hope we will come to your city also. Okay. Now look this muscle, deep muscles. Yes. Can you focus? This particular muscle is coming and going to the thumb. Yes, it is the flexor compartment. It is going to the thumb pollicis. Yes, it is very long, longus, flexor pollicis longus. Can you see this particular muscle which is coming? Yes, and it is dividing into the 4 slips. So this is definitely flexor digitorum superficialis. Okay. If you will observe, this is cut, and at the deep, one another muscle is seen. So this is a flexor digitorum profundus. Profunda, जब भी बेटा profunda आया means deep. Profunda femoris artery means deep artery. Okay, in a better way. Can you see this one? Sir, there is our one flat tendon is seen. So this is the our palmar aponeurosis. Yes, towards the thumb, these are thenar muscle, and here is our hypothenar muscle. Thenar muscle you can remember with the mnemonic AFO, AFO. Hypothenar muscle you can remember with the mnemonic AFO, AFO. Yes, the muscle which is causing the abduction, that is the abductor of the thumb, that's a pollicis. A small muscle, that's a brevis. Yes, the muscle which is causing the flexion of the thumb, that is a flexor. Thumb, that's a pollicis. A small muscle, that's a brevis. One muscle is causing the counting of the finger, so opponents, pollicis. There is the one fourth muscle which is known as graveyard of ulnar nerve. Sir, this is our adductor pollicis. Yes sir, it is our which muscle? It is adductor pollicis, the most important muscle of the our hand, adductor pollicis. अल्नर नर्व की नदी आती है और एडक्टर पॉलिसिस में खत्म हो जाती है. सो रिमेंबर विच इज द ग्रेवयार्ड ऑफ द अल्नर नर्व? आंसर इज द आवर यस एडक्टर पॉलिसिस मसल. ओके, नाउ हाइपोथिनर सेम, but what you have to remember? Little finger. Very good answer, Adnan. Adductor pollicis, Froment sign, very nice. Nimra, what you have to remember beta? Sir, same for the little finger, it is causing the abduction of the finger, abductor, little finger, that's what digiti minimi, then causing flexion of the little finger, so flexor digiti minimi. Then one more muscle which is causing the counting activity, so opponents digiti minimi. One last muscle is there, that is the our yes palmaris brevis. So for hypothenar muscle, remember beta, from the lateral side, from the midline side, the median nerve is coming, so all the thenar muscles are supplied by median nerve. From the hypothenar part, which nerve is coming? Sir, ulnar nerve. So all the hypothenar muscles, they are supplied by ulnar nerve except adductor pollicis. Very important question. Adductor pollicis is the exception. It is the thenar muscle but not supplied by the median nerve, it is supplied by the ulnar nerve. Agree everyone? Very important question. Now see, the maximum muscle of the hand, they are supplied by the ulnar nerve, so ulnar nerve is helping in the fine movement. That's why one very important question, ulnar nerve is musician nerve, median nerve is yes laborer nerve. Also remember, median nerve is also known as peripheral eye, also you can say, better to say, eye of the hand. These all are your previous year topics, previous year question. No excuse beta, no excuse, no excuse, no excuse. Agree? Very nice. Nimra, pregnant nerve, the three nerves which are pregnant in the body, I will teach you in the lower limb part. Yes, very good. Pregnant nerve, the three nerves are pregnant, the sciatic nerve, the optic nerve, you can say the second cranial nerve, and the median nerve. Only the three nerves are pregnant. What is a pregnant nerve? बहुत बढ़िया. Earlier we had discussed this all the things. इसलिए बेटा मैं कहता हूं, बेटा अगर इंडिया में हो, मेडिकल में हो, और अगर मान लो आपने यस सीबीआई एनाटॉमी नहीं पढ़ा, तो क्या एनाटॉमी पढ़ा? The beautiful concept of the pregnant nerve. Remember the nerve which are very thick, very beautiful concept. So they are not only supplied by the nervi vasorum, but they require the artery which is running within the nerve. Yes, जैसे मम्मी होती है, मम्मी के अंदर बेबी होता है, baby is getting nourishment by the mother. In the similar way, these nerves are mother, and within the mother the baby is running. Such kind of the nerves are known as the pregnant nerve. Yes, Nimra, you are our old student and you recall the very good concept. So sharing the knowledge with all of you, and the credit goes to the Nimra. Thank you beta, thank you. Okay, so remember the three nerves are pregnant. The thick nerve, thickest nerve of the body, sciatic nerve, the another thick nerve, optic nerve, and another thick nerve in the our forearm, the median nerve. Three nerves are pregnant in nature. Now what you can see, yes, very important concept. If I am asking this muscle, look here beta, this muscle is coming, ऊपर देखो, नीचे देखो, दाएं देखो, बाएं देखो, it is going to the thumb. So this is flexor. Okay sir, it is thumb, that's a pollicis. It is long muscle, that's a longus. Can you see, this muscle is coming and it is going to the digit. So this is the flexor digitorum superficialis. These are the tendon of the flexor digitorum superficialis. Sir, flexor digitorum superficialis. But just below to it, can you see the one another tendon? Sir, this tendon is at the deep. So flexor digitorum profundus. And very important fact, can you observe here the thin ascaris lumbricoid, parasitology, thin ascaris lumbricoid like muscles. Yes, because these are ascaris lumbricoid like, that's why These are known as lumbrical. First lumbrical, second lumbrical, third lumbrical, fourth lumbrical. Remember beta, on the lateral side there is the river of the median nerve. So median nerve is supplying the L1, L2, first and second lumbrical, but on the ulnar side there is the ulnar nerve. So this ulnar nerve will supply the L3 and L4. Very, very important. Very important fact, sir. Median nerve and ulnar nerve. Median nerve is supplying the first and second lumbrical. Ulnar nerve is supplying the third and fourth lumbrical. These lumbricals are responsible for the, yes, Babaji ka chullu position. Also, you can remember the pain holding position. So when there is a damage to the median nerve and ulnar nerve, so do opposite of this. Yes, at side of flexion, do extension. At side of the extension, do flexion. So this is complete claw hand. Again, focus. There is the median nerve, thenar eminence. There is the ulnar nerve, hypothenar eminence. Four lumbrical, first and second lumbrical, median nerve, NEET PG, NICT, FMGE question. Unipinnate muscles. Third and fourth lumbrical, bipinnate muscle, ulnar nerve. So if median and ulnar nerve are damaged, their action are lost. What is the action? Pain holding position, Babaji ka chullu position. Flexion at the metacarpophalangeal joint, extension at interphalangeal joint. So if it is damaged, then at side of flexion, extension, at side of extension, flexion. This is your complete claw hand. Getting the point? Yes, sir. It is our complete claw hand. Agree, beta? But ulnar nerve injury is more common. So only the third and fourth lumbricals are involved. So only the ulnar claw hand occurs. The median claw hand is less common. So this is the ulnar claw hand. Sometimes median nerve is involved. In that situation, the median claw hand is also possible. Three types of the claw hand: complete claw hand, ulnar claw hand, and median claw hand. Agree? Okay. Yes. So these are the points. Now, can you observe this one? These are our metacarpal bones. Sir, here are the muscles. Jidhar muscle, udhar movement. When this muscle will contract, it will pull the finger towards the midline. When this muscle will contract, it will pull the midline movement. When it is contract, it is causing midline movement. So these all are causing the midline movement. Midline movement means it is our adduction. Tell me better. Yes, it is causing the adduction. It is causing the adduction. So this is our palmar introshi which are causing the adduction. MCQ. So if you are fitting the, yes, your card in between. अगर बेटा आपने यहाँ पर कार्ड रख दिया and you are asking the patient to hold the card in between, so this is your what, sir? It is the card test. All palmar introshi are supplied by ulnar nerve, so card test is done for the our ulnar nerve. Agree beta? Fine. So these are the points which you have to remember. Now can you see, this is the back side of the hand. You can see the bipinnate muscle. Now look, when this muscle will contract, the finger will go away from the midline. When this muscle is contract, it is causing away from the midline. When this muscle is contract, it is causing away from the midline. When it is contract, it is causing the away from the midline. Away from the midline, that is the abduction. So this abduction is done by the dorsal interossei, your mnemonic DAB. Yes, sir. DAB. And for this spreading of the finger is done. That spreading of the finger is nothing. That is the our Igawa's test. Agree, beta? Yes. Your question: which finger is having the two dorsal interossei? Can you see this middle finger is having the 1 and 2 dorsal interossei? Another MCQ: which finger is having the no palmar interossei? Again, answer is the middle finger. Means if in exam the question is asked which finger is not having the palmar interossei, you have to say this answer. This is the your mnemonic. Okay, in funny way you can remember. And if examiner is asking which finger is having the two dorsal interossei, your answer is again middle finger. You have to show the middle finger to the examiner. So this is the your mnemonic also. I told you the concept. Now what you have to remember better? Yes, we had completed all the muscle. Just few knowledge about the arterial supply. Sir, we all are aware about the arch of aorta, from where the BSC, brachiocephalic, subclavian and common carotid arteries are coming. Remember, the brachiocephalic artery, it is dividing into the common carotid artery and the subclavian artery. This subclavian artery is running as the axillary artery. Then it is running as the brachial artery. Now this brachial artery is dividing into the radial and ulnar artery. Now it is making the superficial and deep palmar arch. Simple. So what is your mnemonic beta? Subclavian artery. It is continuing as the axillary artery. Then it is making the brachial artery. Then it is dividing into the radial, ulnar and superficial and deep palmar arch. Why I'm telling you? Yes, try to understand. This is your very, very important clinical AIIMS test. Getting the point? Yes. Okay. So remember this AIIMS test. Sir, do here artery supply, subclavian artery, axillary artery, yes, brachial artery. Now radial and ulnar. Radial artery is dividing into two, superficial, deep. Ulnar artery is dividing into two, superficial and deep. Superficial branches are meeting, deep branches are meeting in the palm. So superficial palmar arches, deep palmar arches. Try to understand the Allen test, clinical. Yes, do with me. Make the tight fist. Make the tight fist with me. Okay, make the tight fist. Okay, sir. So blood is getting empty. Now compress the radial artery, compress the ulnar artery, and open. It is appearing pale. Now open the रेडियल आर्टरी. ये देखो बेटा, रेडियल आर्टरी को ओपन करो, हाथ लाल हो गया. मींस योर रेडियल आर्टरी इज नॉट ब्लॉक्ड, योर deep palmar arch is not blocked. Means you are not chronic smoker, you are not the patient of the Berger disease. Yes, you are not the chronic smoker. Yes, you are a smoker. तुम स्मोकर हो लेकिन क्रोनिक नहीं हो. Thromboangiitis obliterans the peripheral vascular disease. Now reverse Allen test. Yes, again make a fist, compress the radial artery, compress the ulnar artery, open. Can you see the pale? Now open the ulnar artery. You will feel the rush of the blood. Means your ulnar artery is okay. Means superficial palmar arch is okay. Means yes, you are not chronic smoker हो. हाँ मुझे पता है कि तुम स्मोकर हो, तुम हो लेकिन क्रोनिक नहीं हो. Yes, for the Berger disease, for the peripheral vascular angiitis, for the your channel arterial channel, you can remember Allen and reverse Allen test. Okay. Fine. Hope you are getting the interesting. Okay. Yes. Yes. Thank you, everyone. So now look for this our different more things, sir. The branches of the subclavian artery. Remember, beta mnemonic VITCD. Sir, V for vertebral artery, I for internal mammillary artery, T for thyrocervical trunk, C for costocervical trunk, quick revision, and D for yes, dorsal scapular artery. Why I'm telling you better? MCQ, the vertebral artery, if it is blocked, then pica is blocked. And if the pica is blocked, then there is the Wallenberg syndrome. MCQ. Yes. Another MCQ, this internal mammillary artery is the artery for the coronary artery bypass grafting. Another MCQ for your surgery and ENT, this thyrocervical trunk, it gives the branches SIT. Agree, beta? What you have to remember, sir, this S is our suprascapular artery, this I is our inferior thyroid artery, this T is transverse cervical artery. So this is the mnemonic SIT. What you have to focus, sir, inferior thyroid artery. It is the arterial supply of which gland? Sir, thyroid gland. Remember, always I say to the student, tongue, thyroid, tonsil. And for the NEET PG, one more T, temporomandibular joint. These are important. 4 T are important. For the FMG, 3 T. Yes, tongue is very important topic. Can I sing the song? Again, Hollywood, Bollywood, Tollywood, they all are coming from the anatomy. The song dedicated for the tongue, because tongue, one question sure. Yes, the song is तूने मारी एंट्रियां तो दिल में बजी घंटियां रे. Tongue, 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 tongue. Remember, tongue is very important. Okay, one question from the tongue, one question from the thyroid, one question from the tonsil. Remember, thyroid blood supply, inferior thyroid artery, it is coming from the your thyrocervical trunk, which is coming from the your subclavian artery. No excuse. Agree, everybody? Okay. Yes. Now, what you have to remember? But a parathyroid artery, again, superior and inferior thyroid artery. But inferior thyroid artery is the main artery which is supplying the superior and inferior also. Superior thyroid artery is partially supplying. Main artery is the inferior thyroid artery, which is asked. Okay. So this is about the parathyroid artery supply. Okay, sir. So these are the points which you have to remember. Now look, sir, there is our axillary artery. I am not going to tell the detail, but this point you have to remember. Axillary artery, the pectoralis minor is dividing. That's why it is the key muscle. Do you remember? The pectoralis minor, it divides the axillary artery into the first part, second part, and your, sir, third part. Got the point? Okay. Now, first part, it gives one branch. Second part, it gives the two branches. Third part, it gives the three branches. Okay. Yes. The first part, it is giving the branch from the superior side of the thorax. So it is known as superior thoracic artery. Yes. The second part, which is behind the pectoris minor, it is giving the branch near the acromion process, acromiothoracic artery, and giving the branch on the lateral side of the thorax. That's why lateral thoracic artery. Now the three branches, yes, third part is giving the three branch, one branch from the anterior side of the humerus. So you will say anterior circumflex humeral artery. Another is going from the back side of the humerus. So that is the your posterior circumflex, yes, humeral artery. And last is your subscapular artery. So easy. Okay. So first part is giving the first one branch, second part is giving the two branches, and third part is giving the three branches. Yes, Pushpendra, Prakash, tentative, you all are perfect. Our beautiful mnemonic was, yes, STA Sata, ATA Ata, LTA Lata, then Acha Pacha Sasa. So in 5 seconds you can remember the branch of the axillary artery. So this is the dancing movement. Do you remember? Sata Ata Lata, Acha Pacha Sasa. How we remembered during our regular class? Sir, Sata Ata Lata, Acha Pacha Sasa. Sata Ata Lata, Acha Pacha Sasa. So with this dancing movement, yes, Sata, superior thoracic artery from the superior side. Ata, yes, from the acromion process, acromiothoracic artery. Lata, Lata, tumhe kuch nahi pata. The famous dialogue from the China Gate movie. You can remember Lata. Yes, then Acha, Pacha, and Sasa. Shashi, Shashi Tharoor, मोहब्बत करता है जरूर, तो शशि का भाई कौन? शशा. You can remember, yes, our way, Sata, Ata, Lata, Acha, Pacha, Sasa. So these are the branches. Yes, subclavian artery, you have to remember, sir, the VITCD, the our axillary artery, you have to remember the Sata, Ata, Lata, Acha, Pacha, Sasa. Why? The clinical integration, yes, 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 you have to remember, beta, this Sata, Ata, Lata, SAL, along with the internal mammillary artery, yes, Sata, Ata, Lata, and internal mammillary artery. These are the main artery of the breast. So your mnemonic, the breast blood supply, surgery integration, one question sure from the breast topic, either the pathology or the surgery. Yes, you will read there. SALI, SALI is your mnemonic. Yes, Sata, Ata, Lata, and internal mammillary artery. These are the main artery of the breast. So during the mastectomy operation, you have to ligate these arteries. Okay. Hope you are getting the point. Yes, yes, you are right. You are right, Pushpendra. Very nice, better. Okay. Yes, Brijwan, you're right. Sali is your mnemonic. Now, we are coming from our brachial plexus. What is the brachial? Brachial means arm, plexus means bunch of the nerve. Bunch of the nerve which is supplying the arm. That is a brachial plexus. You can see this is formed by the C5, C6, C7, C8, T1. C5, C6, they are making the upper trunk. C8, T1, they are making the lower trunk. And this is the C7, which is making the middle trunk. And then they are dividing into the division and then making the branches. Okay, sir. The concept of the brachial plexus is coming from the tree. Just like the tree, as the tree is having the root, then trunk, then division, and then cords, and then branches. So you can remember the root, trunk, division, cords, and branches. FMGE exam, important question, 2019. Remember the different parts of the brachial plexus. You can remember the mnemonic. Ramu Taylor drink cold beer. Root, trunk, division, cord, and the branches. Okay, sir. Now look here. This diagrammatic presentation. First MCQ, the root value C5 to T1. Sometimes there is a contribution from the C4. Second MCQ, prefix brachial plexus. Sometimes contribution from the T2, known as the postfix brachial plexus. But abhi tak, yes, we had covered the our approximately 30-35 MCQs. We are adding more things. Okay, so these are the prefix and postfix. One integration with the surgery. This is the same spinal root value with the thyroid gland. So remember the thyroid gland vertebral level is also C5 to T1. One more MCQ. Okay, now the upper and yes, C5 and C6, they are meeting together and making the superior trunk, while the C8 and T1, they are making the inferior trunk. Lekin ye C7, yes, it is alone, it is making the middle trunk. Okay, sir. Now it will divide into the division. Yes, every trunk is dividing into the anterior division, posterior division, anterior division, posterior division, anterior division, posterior division. Red color is anterior, blue color is the posterior. Now, who is your friend? Remember, beta, all the posterior division, they are uniting and making the posterior cord. Okay. Yes, yes, yes. Thank you, Paras Bhai. Thank you. So Paras Bhai is here. My very too much love and blessings to the Paras Bhai. He's so talented, so talented. But जब talent की जब distribution हो रहा था ना, तो पारस भाई उस line में सबसे आगे थे. I love you, Paras Bhai. Yes, he's so jam person. Yes. Thank you, bhai. Thank you. So what I want to tell you, sir, try to understand. Here is your what? All the posterior cords, they are uniting and they are making the posterior portion. Sir, this is the posterior cord. Remember the thickest cord. Sir, the thickest cord is the posterior cord. And then the entry division, they are uniting making the lateral cord, and this is alone. ये बेचारा अकेला है. अकेले अकेले कहाँ जा रहे हो. So remember which is the thinnest cord? Medial cord. Thickness, posterior cord is thickest, and then lateral cord. And who is thinnest? Remember the medial cord. Medial cord is thinnest. Getting the point, beta? Okay. Yes. Thank you Paras bhai. Thank you. Okay, now look for the further, beta. Yes, see here. Now these are making the your, yes, branches. Fine. So we are going to see the main continuation of the lateral cord, musculocutaneous nerve. Can you see the main continuation of the posterior cord? Sir, radial nerve. And main continuation of the medial cord, sir, ulnar nerve. And you can see the median nerve. Sir, the median nerve is formed by the lateral side root and medial side root, means median nerve is having the two root. Okay, so these are the points at least which you have to remember. You can go for the detailed classes where I taught the brachial plexus in the 1 hour, but this is the bullet train anatomy, so important points all only I am going to discuss. So branches from the root. Yes, MCQ, dorsal scapular nerve, root value C5. I told you the levator scapulae, rhomboid major, rhomboid minor, no excuse, C5. This is the NEET PG question. Then long thoracic nerve, nerve of Bell, yes, Boxer's muscle. Then little part of the brachial plexus, it is contributing to the phrenic nerve. What is the root value of the phrenic nerve? Remember, 3, 4, 5 keeps diaphragm alive. Yes, no phrenic nerve, no life. So this is very important. One question from the phrenic nerve, sure, in your surgery, one question had been asked. Okay, so these are the parts from the root. Now, can you see the trunk? Only the upper trunk is giving the branches. 2S you can remember. S for suprascapular nerve. Very good, Adi. Very beautiful answer, beta. Okay. Now, yes, Modi ji, lunch break, any kind of break you can take. You can continue with eating, but the session will continue. Okay, beta. नो ब्रेक फ्रॉम माई साइड. लेकिन अगर आपको पानी पीना या कुछ खाना है, एनीथिंग यू कैन डू. ओके, लेकिन बेटा बुलेट ट्रेन है, ये रुकेगी नहीं. ओके, सो गो वॉट एवर यू वॉन्ट टू डू विथ द screen on your front of eye. So S for suprascapular nerve, S for subclavius nerve. Remember, this is the MCQ. Division gives never any branch. Cords, sir, lateral cord, posterior cord, medial cord. Lateral cord, your mnemonic is LML. L for lateral pectoral nerve, M for musculocutaneous nerve, L for lateral root of the median nerve. All are coming from the lateral cord, and the root value is the C5, C6, C7. Agree, beta? Okay, yes. Thank you Prakash for the your सपोर्ट. थैंक यू एवरीबॉडी. थैंक यू. ओके, यस. स्पाइडरमैन का आएगा बेटा, वो कभी भी अचानक आ सकता है. डोंट मिस दैट पार्ट. स्पाइडरमैन कभी भी आ सकता है. डोंट मिस दैट पार्ट. ओके, नाउ द पोस्टीरियर कॉर्ड. सर, द निमोनिक इज अल्ट्रा. यू फॉर अपर सब स्कैपुलर, L for lower subscapular, T for thoracodorsal nerve, R for radial nerve, and A for axillary nerve. Remember, this all are coming from the your which portion? Yes, posterior cord. Main contribution from the ab tak 56, C5, C6, C7, except radial nerve. So radial nerve is the thickest nerve. So the all root values. And thoracodorsal, I told you 786, best number for the best muscle, best nerve. And last bit of medial cord, 4M and 1U. Medial pectoral nerve, medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, and medial root of the forearm. Okay, so medial pectoral nerve, medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, and then medial root of the median nerve. And what is the U? Sir, U is ulnar nerve. Agree, beta? Okay, so these are the our things. Beta, tentative class up to the 3:30 or maximum 4. Okay, Dr. Tentative. Okay, because medial cord, sir, medial cord, you can trace here. हमने draw किया था बेटा, C8T1. They are uniting here for the medial cord. So all the branches from the medial cord, sir, C8T1. But Gray's Anatomy, one update, better remember that 42nd edition of the Gray's Anatomy, little contribution from the C7. Okay, so these are the points for the our question. Now see, clinical. We are coming for the clinical part. there is the injury in between the head and shoulder. So the C5, C6 is getting damaged. Upper trunk is getting damaged, that is os paralysis. But C81, they are making the lower trunk. Here is the damage, then lower trunk C8 damage, Klumpke's paralysis. It occurs due to the injury between head and shoulder, os gynae integration, shoulder dystocia. So get ready for this shoulder dystocia, cleidotomy operation, os gynae integration. Now look here, sir, this is the os point, MCQ, clinical. Sir, 1, 2, C5, C6, supraescapular nerve, nerve to subclavius, 4 nerve, and then anterior division, 5, and then posterior division, 6 nerve. 6 nerves meeting point is known as os point. Getting the point, everybody? This is the os point. So if there is a damage, then there is a os paralysis. I'm telling you, try to understand. Listen carefully. Focus, focus, focus. C5, C6 damage, musculoskeletal nerve damage, no flexion, so extension. Can you see? Extended elbow first. C5, C6 damage, axillary nerve damage, deltoid paralysis. So deltoid is helping in abduction. No abduction means adducted hand. Can you see adducted hand? Yes. Axial nerve is supplying the teres minor. Teres minor is paralyzed. Teres minor is coming from the back. It is causing the back rotation, lateral rotation. So damage to this muscle, it will cause medial rotation. So that's why there is a medially rotated arm. Last, radial nerve is damaged. So supinator paralysis. Also the biceps is the powerful supinator. So no supination. Can you see pronated hand? This is the position during the our tip activity. आप हेलमेट नहीं पहने हो, पुलिस वाला बोल रहा है चलो 10,000 निकालो, आप क्या बोलोगे? अरे कहाँ 10,000 लगा रखे हो भैया, ये लो ये 500 रुपए. तो पुलिस वाला क्या करता है? एडक्शन, एक्सटेंशन, मीडियल रोटेशन एंड हैंड पोजीशन इज दिस वन. ऐसा पकड़ा और सीधे पॉकेट में डाल दिया. रिमेंबर बेटा, रिमेंबर रिमेंबर रिमेंबर. यस, घूस लेने वाले हाथ. व्हाट आई वांट टू टेल यू, यस, ये पैसे को पकड़े और ये पकड़ करके ये जेब में डाल दिए. ये है घूस लेने का तरीका. दैट इज द योर, यस, policeman tip hand. Can you see here? Yes, 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 this is the policeman tip hand. Okay, in the similar way, waiter tip hand. आप Valentine Day में गए हो, you are demanding for the corner seat, he is saying no, it is reserved. When you're putting the 50 rupees, he is saying yes, it is reserved for you. So this is the policeman tip hand or waiter tip hand deformity. Okay, so these are the points. Now see Klumpke's paralysis. Whenever there is a damage to the axilla part, in that situation, sir, there is the damage to the ulnar nerve. And when there is the ulnar nerve damage, there is the, yes, what is happening? Ulnar claw hand, as well as there is the ptosis, meiosis, anhydrosis, and ophthalmosis due to the damage of the T1. Ophthalmology integration, this T1 is supplying the superior tarsal, dilator pupillae, the sweat gland, as well as it is supplying the orbitalis. So if Horner syndrome is there, T1 damage, superior tarsal means Muller's muscle paralysis, dilator pupillae is paralyzed, sweat gland is damaged, and orbitalis is damaged. That's why there is our what? This is the beautiful ophthalmology integration. Ptosis, dilator pupillae, no dilatation. So there is a constriction of pupil, meiosis, sweat gland is lost. That's why remember there is the anhydrosis, and orbitalis is supporting the eyeball from the back side. It is paralyzed. So remember there is the our, yes, anophthalmosis. According to the Kansaki book, this is our apparent anophthalmosis. So it is actually not the content of the our, yes, Horner syndrome latest update. Okay, so now try to understand one question. Sure, very good Pushpendra beta. Pan-Cos tumor, it is there. Okay, very nice, beautiful. Now see one question sure shot from here. Axillary nerve is located at the surgical neck of the humerus. So in case of the surgical neck fracture, axillary nerve is damaged. The radial nerve is related to the radial groove. बेटा यहाँ से क्वेश्चन श्योर लिख के ले लो, mark my word. So if there is a fracture of this area, radial nerve is damaged. Can you see the ulnar nerve is related behind the medial epicondyle. So if it is getting fracture, there is the our paralysis of the ulnar nerve. And also remember, sir, there is the median nerve. Sir, here is the our median nerve. Sir, this is our what? Median nerve. Sir, this is the our median nerve. Okay, and you all are aware there is a brachial artery, radial artery, ulnar artery, and you all are aware, sir, there is our biceps tendon. So M, B, B, and R. Getting the point? MBBR is the relation. So if there is supracondylar fracture, the median nerve and the brachial artery is affected. So this is the another question. There is a supracondylar fracture and Volkmann ischemia. Yes, sir, there is a supracondylar fracture, gun stop deformity and brachial arteries involved. That's why Volkmann ischemia, ischemic contracture of your surgery and the orthopedics. Very important topic. Agree everybody? Okay. So now the question pattern. They will put the radiology image. They will give the medicine symptom. They will show the ortho fracture and they will ask anatomy. 4 subject. So this is the our surgical neck. So axillary nerve damage, deltoid paralysis. Yes, rounded contour is lost. MCQ. Can you see? There is a fracture of the shaft, radial nerve is damaged. So this is your what? Wrist drop. MCQ. Can you see, sir? There is the fracture of the medial epicondyle. So ulnar nerve is getting damaged. So ulnar claw hand. Can you see? There is the our supracondylar fracture, sir. It is the supracondylar fracture. Yes. Can you observe supracondylar fracture? Fine. This is our elbow joint part. Above it, there is a fracture. So what is happening? From here, the brachial artery is dividing into the radial and ulnar artery. It is involved, as well as the median nerve is involved. So median nerve is affected and brachial artery is affected. That's why the gun stop deformity. I taught you the cubitus virus. Sure, beta. Sure. One question sure from this topic. Yes, clinical part which will be solved on the platform the anatomy. Mark करके लिख लो बिल्कुल. अगर ये क्वेश्चन पैटर्न नहीं आया डायरेक्टली और इनडायरेक्टली तो मेरा नाम बदल करके स्पाइडरमैन रख देना. ओके, यस, it is very important. Now we are going to enter for the our nerve part. Remember beta, see here, there are the our upper limb nerve, median nerve, but this is the old pattern. Nowadays they are asking the question about the clinical. So you can remember the median nerve, your rule is cap BPT, mnemonic. If median nerve is damaged, then carpal tunnel syndrome, app thumb deformity, pointing index, which is also known as the Osner test, then Benedict hand, also as the Pope hand deformity, Phalen's test, also you can say the P for pain test, and T for Tinel sign. Cap BPT, Captain America was bachelor in physiotherapy. Okay, so look here, the carpal tunnel syndrome, the compression of the median nerve behind the flexor reticula. So you will give the painkiller steroid, but not treated. Then you will cut this flexor reticula and you will relieve the pressure. So this is the surgery indication. Okay. Now look, the Tinel sign and the Phelan test. Sir, this median nerve is supplying the lateral 3.5. Yes, sir. It is supplying the lateral 3.5 of the palmar side as well as the lateral 3.5 of the our nail beds. Very important. Getting the point? Okay, sir. So these are supplied by the median nerve. So there is a loss of sensation. So suppose carpal tunnel syndrome is coming. You are tapping over the flexor reticula. There is the pain. What you have to remember? Tapping, tapping, tapping. Tinel, tinel, tinel. There is an increased pain along the lateral 3.5 tinel sign. What is the Phelan test? Again, median nerve. If you are doing excessive flexion, fall, 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 Phelan, Phelan, Phelan. The pain is increased along the lateral 3.5. This is the Phelan test. Both are for the your yes carpal tunnel syndrome median nerve. Okay, sir. Now look, this is your what, sir? This is the app thumb deformity, atrophy of the thenar eminence. And can you see there is the our normal flexion from this 2 finger, but this is abnormally. So this is the position just like the our Pope Benedict Christian. They are blessing in this way. So this is the Pope hand deformity or our, yes, you can say the Benedict hand deformity or Pope hand deformity, median nerve injury. Can you see if median nerve is damaged, then patient cannot do abduction. So this is the pain test. This is done by the abductor pollicis brevis, which is supplied by the median nerve. So this is the median nerve test. Best test is the Durkin test, in which you will compress the flexor reticula. You are right. You are right, Dr. Dharani. Okay, sir. Now can you see this is the pointing index? Yes, sir. If there is a median nerve damage, okay, then the flexor muscles are not properly working. But this medial half is supplied by the ulnar nerve, so it is flex. Entry interosseous nerve is damaged, so you can flex this finger also. So it will point towards the doctor. Pointing index, and this is the same pointing index with making the fist. So this is the pointing index. So I told you the Phelan test, Tillen test, and this is the best test for the median nerve, compression of the median nerve behind the flexor reticula, Durkin test. Agree everybody? Okay. So now can you see the forensic integration? There is our flexor reticula. Above it, 5 structures are passing. What are the 5 structures? Sir, the palmaris longus. Sir, there is the ulnar nerve, ulnar artery. There is the palmar cutaneous branch of the median nerve and ulnar nerve. 5 structures. So when Aishwarya Rai auntie is cutting the wrist, which structures will get cut? The structures which are above the flexor reticula, but deep to it. Median nerve is there, carpal nerve is there, so it will not get damaged. So remember Salmon Bhoi. Yes, our forensic integration. तड़प तड़प के इस दिल से आह निकलती रही, हमको सजा दी प्यार की, ऐसा क्या गुनाह किया तो लुट गए, हाँ लुट गए, तो लुट गए हम तेरी मोहब्बत में. Remember Salmon Bhoi. So whenever there is a wrist cut injury, you will get tentative marks, hesitation mark. Yes, superficial structure will get cut, but median nerve is deep, it will not get cut. Getting the point, everybody? Okay. So you can see the flat tendon, palmaris longus tendon, palmar epiponosis. Yes, if there is a fibrosis of the palmar epiponosis, it is causing the Dupuytren contracture. MCQ. Which part of the hand is involved? Medial half, the most common finger, ring finger. MCQ. Now, this is our ulnar nerve. This is the old question pattern, but according to the new, they are asking the test. So ulnar nerve, you can remember the A, B, C, D, E, F. Also, you can do the G and H. Remember, A for ulnar nerve, just for pronunciation. B for book test. C for card test. D for ductor pulses test. You can say adductor pulses test. E for Igawa test. F for Froment sign. G for Guyon's tunnel test, which is also known as handlebar palsy. These are the things which you have to remember. Can you see? The first and second lumbrical unipinnate, third and fourth lumbrical bipinnate. Very, very important. Sir, this L1 and L2 supplied by the median nerve, MCQ, while the L3 and L4, these are supplied by the ulnar nerve, MCQ. These are helping in the pain holding position or Babaji ko Thullu position. If they are getting damage, then complete claw hand. Ulnar nerve damage, then ulnar claw hand. And if there is a damage to the median nerve, median claw hand. I told you. Okay. Yes, perfect, Nimra. You are right. Can you see? This is the bicycle handle. Ulnar nerve is running from here. So if there is a compression of this ulnar nerve against the handlebar, this is known as handlebar palsy. This is known as our, yes, ulnar nerve compression. This is the Guyon's tunnel syndrome. Can you see this image? Yes, look at this part. Sir, this is our thenar muscle. Here is hypothenar. So the median nerve is below the our what? Flexor reticula. Yes, sir, this is the flexor reticula. Agree, beta? Now above this flexor reticula, there is one more canal, sir. This is the one more tunnel through which ulnar nerve and ulnar artery is passing. Compression of this ulnar nerve and ulnar artery, especially the ulnar nerve, opposite to the handlebar. This is the handlebar palsy or Guyon's tunnel syndrome. Agree? Now again, sir, there are the palmar introiti which are causing the adduction. So these are contracting and causing the midline. Yes, these are unipinnate muscle. All are supplied by ulnar nerve. If you are putting the card in between, that is your what? Card test. Sure, the question will be asked from this zone. Okay. So yes, this is your card test. Getting the point? I will teach you this Froment sign later. But can you observe this one? Sir, when this is contracted, it is causing abduction, it is causing abduction, it is causing abduction, it is causing abduction. Yes, sir. These are bipinnate muscle in between the finger, dorsal introiti. Sir, these are our dorsal introiti which are causing the abduction. Yes. Fine. These all are supplied by ulnar nerve. So this spreading of the finger, sir, it is known as Igawa test. So Igawa test is done for your dorsal introiti. Now see, I told you the ulnar nerve, it supplies the adductor pollicis. So this adductor pollicis, sir, this adductor pollicis is responsible for the book test. How? Try to understand. You are asking the patient to hold the book. Patient will hold in this way. This is your adduction. Okay. But if ulnar nerve is damaged, adductor pollicis is paralyzed, in that situation, patient cannot hold the book in this way. He will hold the book in that way. There's a decrease in angle, means this is the flexion of the thumb. This is the flexor pollicis brevis, which is supplied by the median nerve. So he is not using the ulnar nerve because ulnar nerve is damaged. He is using the median nerve. So this is the Froment sign. The same is known as the book test. Agree, beta? Okay, sir. Now last, radial nerve. The maximum questions from your FMG exams, they are coming from the limb portion. Yes, we had completed the general basic concept, then general anatomy and the upper limb portion. The maximum portion are coming from your last FMG exam. 4 questions from the upper limb part. Yes, see here our radial nerve. Radial nerve is supplying the back of the arm, back of the forearm. So when it is getting damaged, the extension is lost, extension is lost, extension is lost, extension is lost. Getting the point? Extension of the elbow lost, extension of the wrist loss, that is the wrist drop, and finger extension lost, that is the finger drop. So this is compression of the radial nerve due to the crutch. So it is known as, sir, crutch palsy, radial nerve damage. And you all are aware about the Saturday night palsy. And this is our, yes, classical phenomena thing, wrist drop. Agree, beta? Loss of extension. Now look for this. So wrist is normal, but finger is going down. So this is our finger drop. And this is our new situation, new question, honeymoon palsy. At time of honeymoon, nibbi is sleeping over the hand of the nibba. Okay, so radial nerve is compressed. This is the just simple neuropraxia, but I am going to tell you the permanent treatment of it. Okay, इसका medical treatment मैं नहीं बताऊंगा, मैं सीधा permanent treatment बताऊंगा. Remember बेटा, शादी के पहले तेरे बिना मैं नहीं, मेरे बिना तू नहीं, but after the marriage या तो तू नहीं या मैं नहीं. What you have to do? Either you can cut the hand or you can cut the throat. फैसला आपका. Okay, so this is the permanent treatment. I am just joking. सही में नहीं करना है. Okay, so this is the honeymoon palsy, compression of the radial nerve. Agree, beta? Okay, fine. Okay, sir. Now, yes, cock-up splint also you will see there. Now, last topic of the upper limb. One question sure, beta, from this anatomical sub box. So when you are extending the thumb, at that time there is the our, yes, box-like structure. Can you see this tendon? Here is one diagrammatic presentation. When you will observe at the hand, you will see, yes, आगे longus, abductor pollicis longus, पीछे longus, extensor pollicis longus, बीच में brevis, that is the extensor pollicis brevis. So entry boundary in anatomical position, that is laterally also. So anterolateral boundary is formed by the abductor pollicis longus and extensor pollicis brevis, and the posterior boundary is formed by the extensor pollicis longus. Agree, sir? Fine. Now the roof, no need to mug up. I told you skin, superficial fascia, deep fascia. But in the superficial fascia, radial nerve is there and cephalic vein is there. Clinical. If radial nerve is compressed due to the tight wristwatch neuropathy, and cephalic vein is used for the intravenous injection, 2 MCQs. That's why anatomical sub box is important. Salmon boy, आज गाड़ी तेरा भाई चलाएगा. He is wearing the loose bracelet. Why? Because he knows when there is a compression of the radial nerve due to the tight wristwatch, tight wristband, there is the chiralgia paresthesia. MCQ. This is the Waltenberg syndrome, chiralgia paresthesia. Also, there is a meralgia paresthesia. Remember, chair लेके गई जिया, चेयर ले जिया. एंड इन द लोअर लिम्ब, मेरा ले जिया, जिया आई और मेरा जिया लेके चली गई. मेरा ले जिया, chair ले जिया. Remember, meralgia paresthesia due to the compression of the lateral cutaneous nerve of the thigh. MCQ which had been asked in Obs Gynae integrated question, July 2023 FMG exam. Okay, now look here. Further flow. If you will touch, sir, what are the different structures which you can feel here? Sir, here is the our touch at the lateral side, styloid process. Then she looks too pretty. So scaphoid bone. Yes, scaphoid is the most common bone which is getting fracture. Second most common bone which is getting avascular necrosis. That's why this scaphoid will be asked. Then try to catch her. So trapezium is there and base of the first metacarpal is here. So these are the structures which are making the floor. No need to mug up. Just you can feel them. Agree, beta? Okay. Yes, yes, yes. Now, one more clinical. If there is an inflammation of the anatomical snub box structure, then there is the, remember, this situation is the tenosynovitis, which was studied by the Finkelstein. So this is the Finkelstein, yes, which was studied by the De Quervain. So this is the De Quervain tenosynovitis. You can do this test, Finkel test and Eckhoff test also. You will see what you have to do. You have to just flex the thumb, hold the thumb, and ulnar deviation. Do this one. When you are doing, you are feeling the pain. ऐसा करो, ऐसा करो, और फिर अल्ना की तरफ खींचो, so there is a pain. So if there is the inflammation, here will be the severe pain. Sir, this is your Finkelstein or Eichhoff test. You will see in the your orthopedics. So these are the all the things, but इससे बाहर की कोई चीज नहीं आएगी. So now we are moving for the same thing. Yes, lower limb. So Spider-Man, he's saying, this is my gift, my curse. Who am I? I am a Spider-Man. Okay, so you are also the Spider-Man, but remember, you are going to take the one great worship, that is the doctor profession, and it is, yes, worship as well as curse also. So remember, काम करो ऐसा कि पहचान बन जाए, चलो तो ऐसे कि निशान बन जाए. अरे जिंदगी तो हर कोई काट लेते हैं, अगर दम है तो जियो ऐसे कि मिसाल बन जाए. चलो एक मिसाल बनाते हैं. आफ्टर द कंप्लीशन ऑफ द अपर लिम्ब पार्ट, नाउ द लोअर लिम्ब विल बी वेरी इजी. I told you the bursa. Can you solve this question? With complaint of the pain and swelling at the knee, which bursa is involved in this condition? There was the housemaid knee. Okay, so the bursa in front of the our patella, pre-patellar bursitis, which is also known as housemaid knee. I told you this is our what, sir? It is our pre-patellar bursitis. Your mnemonic is HP. Agree, beta? Now also remember the clergyman knee. This is our infrapatellar bursitis. Your mnemonic is C and I. So this is the one MCQ. HPCI. Agree? Housemaid knee, pre-patellar bursitis, clergyman knee, infrapatellar bursitis. Now can you see there is a question? A female presented with the complaint of the pain anterolateral aspect of the thigh, but anterolateral aspect, close your eye and say the our meralgia paresthesia lateral femoral cutaneous nerve. Can you see the next FMG July 2023 talus ossified? Better remember, few books are saying 7 months, but Gray's Anatomy is saying the 6 months. So this is the best answer. FMG July 2023, one question from the foot bone. Can you see there is a one question from the gluteal region? Yes, difficulty in standing up from the sitting position and scissoring gait. But a scissoring gait means there is the involvement of the medial side, spasm of the medial side of the foot. So medial side of the thigh, it is supplied by which nerve? Answer is the obturator nerve. Okay, so gait we have to study from the orthopedics integration. Now next question, a patient was asked to stand on his left leg and his right hip falls down. So patient is standing on the left leg and right side is normally getting elevated, it is getting down. Means remember, in your tendon sign there is the drop of opposite D. Yes, remember there is the our drop of opposite. So remember OP is your mnemonic. Okay, so because the patient is standing on the left leg, right side is getting, so the same side of the leg, same side of the muscles are involved. So your answer is the left gluteus medius and minimus. Answer is B. Very good Brijman, very good Praneet, Adnan, Praneet, very nice everybody. बहुत बढ़िया Prakash. Okay, now what are the other question? This question for trick continuous 4 times now. Okay, middle meningeal artery and the artery just behind the medial malleolus. Answer is the posterior tibial artery. Okay, so these are the two very frequently asked question. Now the same question, the posterior tibial artery is palpated where? Remember, it is palpated behind the medial malleus and the medial border of the tendocalcaneus. Okay, in inversion. So we are going to see this all the theory. Identify the foot bone. So there was the arrow over the your navicular bone, boat shaped bone. So this is your which bone? Navicular bone. So these are the question. So we had covered the PYQs. Very good Nimra, Priyanka, Urja. Okay, yes, you will get the this PDF at the our Cerebellum app as well as Cerebellum Telegram group. Okay, so stay tuned better, don't worry for this PDF. So just one view for the arterial supply. Sir, there is our abdominal aorta, which is dividing into the common iliac artery, which is dividing into the internal and external iliac artery. Now from the mid-inguinal point, it is continuing as the femoral artery. Then same artery is running as the popliteal artery. Now the popliteal artery is dividing into the anterior tibial and very important artery, posterior tibial artery. The anterior tibial artery is running as the dorsal pedis artery, and the posterior tibial will divide into the medial plantar and lateral plantar. Means arterial supply, femoral artery, yes, popliteal artery, anterior tibial, posterior tibial, dorsal pedis, medial plantar, lateral plantar. Okay, got the point, beta? In the similar way, there are the veins, same like the artery, but there are the our superficial veins also. Sir, there are the superficial vein, deep vein, and one vein which is connecting them together, that is a perforator, which you will study in the surgery. Superficial vein, great saphenous vein. Yes, sir. There is the our great saphenous vein, as well as there is the short saphenous vein. Yes, sir. Great saphenous vein and short saphenous vein. One MCQ I will go to tell you, great saphenous vein is related with the longest cutaneous nerve of the body, saphenous nerve, and the short saphenous vein is related with the sural nerve. Okay, so whenever you will do the phlebotomy, these vein along with the nerves, they are getting damaged. I will teach you. Okay, so these are the points which you have to remember. Okay. Okay, sir. So first we are going to see this our osteology part, one quick view with the three-dimensional orientation. Then I will come for the muscular part. Okay, sir. So look for this one. Yes, yes. Technical team will provide you the link for the Telegram group beta. Okay, don't worry for that. So can you see the bones, sir? Hip bone. Yes, there is the our ilium, ischium, pubis. Here is the acetabular cavity. This is the our obturator foramen. Can you observe the longest and the strongest bone of the body? Femur. Then can you see the seed-like bone, sesamoid bone, patella, sky fracture. Yes, skyline view, patellar fracture, K-wire fixation had been asked. Can you see the preaxial bone, patella, postaxial bone? This is the fibula. And you can observe the foot bone. Foot bone, one question. Can you see? Tension band wiring, very good, Nimra. Can you see the largest foot bone? Calcaneum. And this is the your talus. Yes, in front of the talus, can you see navicular bone, which is articulating with the medial, intermediate, and lateral cuneiform. And laterally, there is a cube-shaped bone, cuboid. Can you see the first, second, third metatarsal? And here is the fourth and fifth metatarsal. And then you can see the phalanges. Okay, sir. Now we are going to look for the our muscles. Yes, how we have to study? Thigh, then leg, thigh, leg, foot. Thigh. Again, you will divide into the anterior compartment, medial compartment, and the posterior compartment. Now see, anterior compartment. Longest muscle of the body, everything is written in that flow chart now. Sartorius. The Taylor's muscle, honeymoon muscle. Then this is our rectus femoris. Cut this one. Sartorius we are cutting. This is vastus medialis, medial side. This is vastus lateralis. Vaccination is done. And here you can see our vastus intermedius. Yes, these all muscles are uniting. These all muscles are uniting and making the our one common tendon. This is the ligamentum patelli, where the patella is getting ossified. The largest seed-like bone, sesamoid bone. Every word is MCQ. Okay, sir. This muscle is on the front. So when it will contract, it will cause extension. It will cause extension. Okay. So this is extensor muscle. It is helping. It is helping in the, yes, you can remember, sir, it is causing the extension, and extension is done. Extension is done by the footballers. So this is known as the footballer's muscle. It is on the front side. Yes, it is also known as locking muscle. MCQ, quadriceps femoris is the locking muscle. Now look further. Sir, medial side. On the medial side, you will see when this muscle will contract, they will cause midline movement adduction. So this is the adductor longus. Cut it. A small muscle, adduction causing, but it is small. Adductor brevis. Cut it. Can you see this is the very big muscle? Adductor magnus. So adductor longus, adductor brevis, adductor magnus. LBM is your mnemonic. LBW just like that. Now cut it. Can you see this muscle? Sir, this is the very, very beautiful muscle. Anti-rape muscle. Remember, sir, this is our gracilis. And when you're cutting, a small part of the adductor magnus is also there. Okay. Yes. Can you see? There is our pectineus. These all muscles are on the front of the thigh. Okay. Yes. Medial side of the thigh. Which nerve is on the medial side? From the obturator foramen. Obturator nerve. अगेन जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. सो दिस ऑल मसल्स आर सप्लाइड बाय विच नर्व? ऑब्चुरेटर नर्व. All the muscles are entry compartment, they are having which nerve? Sir, femoral nerve. So all the entry compartment muscles are supplied by femoral nerve. All medial compartment muscles are supplied by the obturator nerve. Got the point? Yes, custodian of virginity. Yes, Ajad, you are right. And now the back side. So here is the back side muscle, big muscle. Gluteal region, big muscle, gluteus maximus. Gluteal region, little small muscle, gluteus medius. Now cut this one, gluteus minimus. There is one muscle which is attached to the deep fascia. When this muscle will contract, it will tense the deep fascia, fascia lata. So this muscle is known as tensor fascia lata. The modification of the fascia lata on the anterolateral side, just like the thick tract, this is known as the our yes iliotibial tract. Okay, sir. Now we are cutting these structures, and at the back side, one pear-shaped muscle, piriformis. Now just below to it, you can see one muscle is coming from the obturator internus. Yes, obturator foramen inside. So obturator internus with the, yes, remember there is superior gemelli and inferior gemelli, and this is the your NEET PG question. Quadrangular muscle attached to the femur, quadratus femoris. Agree, beta? Yes, yes, very good, Nimra. Overstretched, you will see this all the things. Now the back of our thigh. Can you see this muscle? It is half muscle, half membrane, half tendon. So semi-tendinosus. When you will cut this one, can you see another muscle which is membrane-like, semi-membranosus? Can you see this another muscle? Sir, it is having the two head. One is having the long head, another is having the short head. So this is the biceps, but at the femur. So don't say biceps brachii. It is the biceps femoris. So these are the different structures. Sir, at the gluteal region, gluteal nerve, but at the back of the thigh, sciatic nerve. So all the hamstring muscles will get innervation by the sciatic nerve. जितना भी अभी हमने muscle पढ़ा, back of the thigh में all are supplied with sciatic nerve. At the basic concept part, I told you. Okay. Very good, Nimra. बहुत बढ़िया बेटा, बहुत बढ़िया. You are answering very, very nice. Your preparation is in a very, very good way. Okay. Now we are going to look for the our cadaveric image. So look here. वो दिखाता है मगर देखने का नहीं. Look at the option. Give direction to your thoughts. Then look above, down, medial, lateral. Can you see the longest muscle of the body? Yes, sir. This is our sartorius. Now, can you see on the medial side, there is a one muscle. Sir, this is the A. Then you can observe one more muscle. This is the P. A small cord-like structure is there. This is the P. And towards the iliac bone, you can observe the ilium bone, iliacus. So I want to tell you the A, then P, and this is the I. Yes, sir. These are the our adductor longus. P for, you can remember, the pectineus. P for psoas major, tendon, and this is the iliacus. Okay. Can you see that is the lower part of the abdomen? So this is external oblique flat tendon. That's why aponeurosis. Remember, the lower free margin of the external oblique aponeurosis is nothing. It is our inguinal ligament. Very important for the surgery. Inguinal ligament. Okay. Now look here, sir. There is the one muscular depression in front of the thigh. The medial border is formed by medial border of the adductor longus. The lateral boundary is formed by the medial border of the sartorius, and the base is formed by the inguinal ligament. Sir, it is nothing. This is our, yes, you can say the triangular muscular depression, femoral triangle. So we had seen the lateral border, we had seen the medial border, and this APPI, they are making the floor, femoral triangle, and this inguinal ligament is making the base, and definitely meeting point is our apex. So femoral triangle we had covered here with the cadaveric image. Now what are the content? Can you observe here? Sir, this is again our sartorius, Here is again our pectineus. And you can observe the inguinal ligament, femoral triangle. So you can see, sir, there is the structures, slightly cyanosed color, vein, and then artery, and then nerve. I told you, yes, femoral vein, femoral artery, and the femoral nerve. These are very important structures. So these are covered with the modification of the deep fascia. Yes, this modification is known as what? Sir, it is known as the femoral sheath. Sir, it is our femoral sheath. Okay. Now, can you see which is not the content of the femoral sheath? Sir, femoral nerve is not the content of the femoral sheath. It is the content of the femoral triangle, but it is not the content of the femoral sheath. Now, look, the medial most compartment of the femoral sheath. Sir, this is known as femoral canal. MCQ. It is the medial most compartment. Remember, it is the medial most compartment. The upper free margin of the our femoral canal. Sir, this is known as femoral ring. And what is the content of the femoral canal? Remember, anyone, if you want to say, tell me what is the answer. Here you will see the lymph node. Yes, sir, there is the group of the lymph node. This was studied by the, yes, please. It was studied by the Rosenmuller and Cloquet. So these are the lymph node of the Rosenmuller or Cloquet. These are located at the inguinal region deeply. So deep inguinal lymph node, you can say bill. Yes, bill is located here. Remember, very important question, because the femoral hernia downward, then forward, and then upward. This is the direction of the hernia. So hernia treatment, you will push just opposite. You will give the incision skin, superficial fascia, deep fascia, and then downward, backward, and through this femoral canal upward, you will push the intestine. Surgery integration, no excuse. Agree, beta? Very important. Okay. So these are the points for the your femoral triangle. Now read the femoral hernia surgery from the surgery portion. Now look, sir, backside. There is a one big muscle. This is your gluteus maximus. Remember, this gluteus maximus is supplied by our, yes, inferior gluteal nerve. It is at the backside. It is at the backside. What I want to tell you, it is backside. So when it will contract, it will cause back movement. So this is the extension. Remember, it is the chief extensor. And I'm showing you one demo. Suppose I'm sitting. Suppose I'm sitting at the chair. Okay. So there is a gluteus muscle at the my backside. When this muscle will contract, it will cause this movement, standing. Yes. Backside. Jidhar muscle, udhar movement. When this muscle is contracting, then it is causing this movement. So there is the increased angle. Yes, this is the 90 degree. Now this is the 180 degree. Getting the point? So it is responsible for the increase in angle. Increase in angle means you can say the extension. And it is helping from sitting to standing position. So remember, this is helpful for the standing position. Very important. Integration with the our pedia. We are going to do. Yes, very beautiful answer, Prakash Arindam. Very beautiful, better. That's why this is the your gluteus maximus. I told you the origin insertion, which are not important, but action is important. Help in standing from sitting position. Inferior gluteal nerve is supplied. Yes, it is involved in the Duchenne muscular dystrophy. There is a Gower sign, pedia in the medicine integration. Remember, the gluteus maximus is helping in standing position. It is involved. That's why Gower sign is positive. Yes, so beautiful, so elegant, just looking like a wow. Anatomy is very beautiful subject, beta. Remember, lal fool, neela fool, anatomy beautiful. Yes, this is the beautiful concept. Also in that way, can you see another cadaveric image? Yes. एक question बेटा जरूर आएगा. Hope you all are liking. Yes, thank you Nimra. Thank you everybody. Now see cadaveric image. Sir, there is the one muscle, pear-shaped muscle. Yes, this is our piriformis. This is the key muscle of the gluteal region. Sir, it is the key muscle. Above this key muscle, whatever the nerve and vessels are there, sir, these are our superior gluteal nerve and vessels. It is supplying the gluteus medius. Inside it, gluteus minimus. MCQ and MCQ. Okay. Yes. Thank you, Dr. Jitu. Thank you, but thank you for such beautiful lines. Okay, now look here, sir. Just below to it, one thickest nerve of the body, the sciatic nerve, sir. Sciatic nerve just below the piriformis. Thickest nerve of the body. Remember, the 2 centimeters is the thickness. And below to it, whatever the nerve is coming, sir, that is our inferior gluteal nerve, and it is supplying the gluteus maximus. It is the cut portion. You are cutting and exposing everything. Okay, sir. Fine. So in this way, you have to remember. Okay. Yes. Yes. Thank you. Thank you. Thank you, Prakash. एक ही दिल है, कितने बार जीतोगे, जितने बार तुम जीतोगे उतने बार हम दिल हारेंगे। ओके बेटा, तो भिड़े रहो, लगे रहो बेटा। एनाटॉमी को लेकर के हमको अपना नजरिया बदलना है। एनाटॉमी इज वेरी वेरी ब्यूटीफुल सब्जेक्ट। यस, इफ योर एनाटॉमी विल बी स्ट्रांग, एवरी अदर सब्जेक्ट विल बी स्ट्रांग। नाउ व्हाट आई वांट टू टेल यू, यस यस यस, try to understand. Yes, entry wound, you are right beta. Don't do, just chill. मिलेगा, सब चीज मिलेगा, but first thing you have to focus, focus, focus. You are right, you are right. Entry wound beta, you will get all the things. Okay, yes yes yes, okay. तो बेटा ढोंडू को जरूर याद रखना। वेन एवर यू आर गेटिंग द सिंपैथेटिक स्टिमुलेशन इन एग्जाम हॉल, रिमेंबर डोंट डू, जस्ट चिल। ओके, सो नाउ आई एम showing you the gluteus medius minimus. Yes yes yes, beautiful beautiful integration. Can you see, this is the gluteus medius, sir. It is crossing laterally to the joint. जिधर मसल उधर movement, where muscle goes there movement flows. So when this muscle will contract, the femur will move laterally. Lateral movement of the femur, that is the your abduction. Remember, it is the proper abductor mechanism. Very very important question of the ortho. The gluteus medius, yes, as well as gluteus minimus, it is also laterally, it is also abductor, as well as tensor fascial lata. These all are laterally. So lateral movement, lateral away from the midline means these are abductor. So remember better, remember, these all are causing the abduction. Gluteus muscle, abductor of the hip, superior gluteal nerve. So if they are getting damaged, so there is the abnormal walk. Why? Because whenever we are walking, try to understand, sir, whenever we are standing at one limb, see here, the gluteus muscles are located here. Carefully, sure question. These are the gluteus medius minimus. So when you are standing at one limb, the gluteus medius minimus, they are contracting, they are pulling the sacrum, they are pulling the opposite hip. So the opposite ASIS, it is getting up, it is normal. But if it is paralyzed, so there is the no pulling, so no pulling, so it is getting down. So remember, drop of opposite pelvis, OP. Drop of opposite pelvis is the Trendelenburg sign. And remember, you are standing in which limb? That same side, ipsilateral muscle is paralyzed, then opposite pelvis is getting. This is the Trendelenburg. Now remember, when we are walking at that time, try to understand, when we are walking at that time, for the few seconds, we are just doing this abduction. Sorry, I'm not able to go more height, but yes, you can do. Yes, so there is a little abduction. So when I'm standing at this part, opposite hip is getting up, but if it is damaged, then it is getting down. So when the person will walk, he will walk in that way. Yes, you all know this famous gate by the Shakuni Mama. You know Shakuni Mama. Yes. Look at the screen. When the Shakuni Mama is walking, so there is the paralysis. You will see the damage of the gluteus medius and minimus, tensor fascial lata. Superior gluteal nerve is damaged. So there is the tilting of the pelvis at one side. This is what? This is the Shakuni Mama gate. You can say the lurching gate. Remember, he told, मेरे बच्चों, मैंने कहा था ना, रणभूमि में खेलने से पहले मनोभूमि में खेला जाता है. Yes, you all are going to give the exam. Before the exam, before the रणभूमि, you have to play in the brain. आपको बेटा अपना माइंड वैसा रेडी करना है, आपको मनोभूमि में खेलना है. In the similar way, मेरे बच्चे, मैंने कहा था ना, 18 सब्जेक्ट पढ़ने से पहले एनाटॉमी पढ़ा जाता है. If your anatomy will be strong, you will be able to understand all the concept of the medicine, surgery, orthopedics. Yes, everything will be easy. Okay, and remember, if you are in the medical profession, medical life, and you are not studying the CBI anatomy, अरे CBI anatomy नहीं पढ़ा जिंदगी में, तो फिर क्या anatomy पढ़ा? So pass this word, pass this line to your juniors, so that our all the medical fraternity can get strong anatomy, and all the other medical subjects stronger, so that we can solve our all the society in a better way. We have to make the world for better to live. Okay, beta? Getting the point? Okay. Okay. Hope you all are enjoying this session. Thank you, everybody. अरे गिर जाएंगे, मर जाएंगे, मिट जाएंगे, तुमको पढ़ाने के लिए कुछ भी कर जाएंगे. ओके फाइन. ओके ओके ओके. थैंक यू एवरीबॉडी. थैंक यू फॉर सच केयर. ओके ओके ओके. थैंक यू एवरीवन. चलो अगला. बट इन द सिमिलर वे, if the both side are paralyzed, in that situation, right left both tilting, Donald Duck gate, yes, that is the your waddling gate. Okay sir. So after this all, now come to the our more muscles back of the thigh. Sir, this is our narrow muscle, sir, piriformis, and this is the thickest muscle, sciatic nerve. Can you observe there are the our muscle set? Yes, obturator internus, superior gemelli, inferior gemelli. You have to focus one quadrangular muscle just below to it. Sir, it is a quadrangle, that's a quadratus femoris. In 3D anatomy, I had shown you. Now look, sir, there is the one muscle. This is the ischial tuberosity. One muscle. See carefully, I will not repeat now. Sir, this muscle is coming from the ischial tuberosity and it is a small tendon like, yes, long tendon. So semitendinosus. Yes, taking origin from the ischial tuberosity and it is becoming tendon like semitendinosus. So below to it, semimembranosus. Can you focus this muscle? Yes sir, that muscle. So this is the long head, here is a short head. So this particular part is having the two head. So this is the biceps femoris. And here you can see the gastrocnemius muscle, lateral head and medial head of the gastrocnemius. So you can observe there is our, yes, rhomboid shaped fossa, the popliteal fossa. And within this popliteal fossa, if you concentrate, you will get the sciatic nerve is coming, dividing into the tibial nerve. Lateral running nerve is the common peroneal nerve. So this is the tibial nerve, this is the common peroneal nerve. And also you can see, sir, there is the artery at the deep, and then vein, and then nerve. Yes, this popliteal fossa is the part where artery is the deep and sequence is the AVN. Remember, exception. And where there is an exception, question may be asked. Sciatic nerve is coming and it is dividing into the two different nerves. Agree? One point which you have to remember, sir, these are the hamstring muscles, semitendinosus, semimembranosus, the biceps long head, and the adductor magnus. These are the backside. When they contract, they help. When these muscles are contracting, can you see? These are the muscles. When they are contracting, they are causing the extension at the hip and flexion at the knee. Jidhar muscle, udhar movement. They are causing extension and flexion. This movement is done by the runner. So remember, the hamstring muscles are known as, yes, runner's muscle. So there is the hamstringing sports medicine integration. These all are located backside. So these all are supplied by which nerve? Sciatic nerve. Agree everyone? Now about the nerve supply, one fact you have to remember, sir, sciatic nerve is running at the back of the thigh. Permanent compression, permanent damage of the sciatic nerve, sciatica, but neuropraxia is known as the sleeping foot. This sciatic nerve is dividing into the tibial nerve and the common peroneal nerve. The common peroneal nerve is at the neck of the fibula. Damage of this common peroneal nerve at the neck of the fibula, bumper fracture, there is our foot drop. No excuse, very important. So one flow chart I am going to make for all of you. Sir, sciatic nerve. It is dividing into the tibial nerve and the common peroneal nerve. Sir, common peroneal nerve, it is dividing into the deep peroneal nerve and the our, yes, superficial peroneal nerve. Getting the point? What you have to remember, the tibial nerve, sir, it is the nerve of the posterior compartment of the leg. The deep peroneal nerve, sir, it is the nerve of the anterior compartment of the leg. And the superficial peroneal nerve, this is the nerve of the lateral compartment of the leg. So it will help you in the Hilton's law, the 639 muscles. So it will be MCQ, 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 MCQ. Common peroneal nerve, It is located where, sir? It is located at neck of fibula. Very important question. Okay, fine. Yes, पैरों का नर्व, पेरोनियल नर्व. ओके, नो प्रॉब्लम बेटा. देखो लाइफ में हर किसी के कुछ ना कुछ प्रॉब्लम होता है. मेरे भी आंखों में बेटा रेटिनल होल है, रेटिनल डिटैचमेंट के चांसेस हैं सिंस 2010. लेकिन इन चीजों को लेकर के रोया नहीं जाता. हर किसी के पास अपने प्रॉब्लम है. आपके पास आपका प्रॉब्लम है, मेरे पास मेरा प्रॉब्लम है, उसके पास उसका, इसके पास इसका. हर किसी के पास कोई ना कोई प्रॉब्लम है. लेकिन बेटा उस प्रॉब्लम को सोचते हुए अगर हम जिंदगी जीते रहें तो क्या ये जिंदगी हम हंसते खेलते जी पाएंगे? बिल्कुल नहीं. खुश रहो, मुस्कुराओ, और आपके पास कुछ पावर भी है, उस पावर को यूज करो, उस चीजों को यूज करो, एंड डेफिनेटली यू कैन मेक द वर्ल्ड फॉर बेटर टू लिव. सो डोंट वरी बेटा, हर किसी के पास कुछ ना कुछ प्रॉब्लम है. बिल्कुल मत सोचो कि ये हुआ. भगवान ने जो दिया है उसको यूज करो, और आपको एक बहुत बड़ा चीज दिया है, एमबीबीएस की डिग्री. यस, यू कैन सॉल्व द मेडिकल कम्युनिटी, और आप एक सुपर हीरो हो बेटा. ओके, डोंट वरी. फाइन, चलो आगे आगे हम बढ़ते हैं. यस 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 यस, now we are going to look for the more things. Okay sir. Yes, compartment of the leg इतना ही पढ़ना है. एक फ्लो चार्ट, एंट्री कंपार्टमेंट, lateral compartment, posterior compartment. Medial compartment is not there na. Entry compartment, this is also known as extensor compartment, and which is the nerve I told you, sir, deep peroneal nerve. So the muscles of the entry compartment, mnemonic is the hospitals are never dirty places. Yes, T for tibialis anterior, sir. H for hallucis longus, it is extensor compartment, that's why extensor hallucis longus. A for, sir, artery, anteritibial artery. N for nerve, which nerve? Deep peroneal nerve. And D for, sir, digitorum longus, it is the extensor digitorum longus. Getting the point better? Okay, now remember, sir, there is P for peroneus tertius. Okay, so what are these muscles? Just I am showing you in the 3D way. Look here, cadaveric image में अगर आया तो आपको क्या करना है? Look, sir, this is the tibialis. Tibia से attach है on the front side, that's why anterior. It is on the medial side. So when it will contract, it will elevate the medial side of the foot, that is the inversion. Who is inverter? Tibialis anterior as well as tibialis posterior, which occurs at the subtalar joint. MCQ. Now look for this muscle. Can you see this muscle? Sir, it is extensor compartment going to the our great toe. So it is hallucis, extensor hallucis longus. Now cut this muscle. Yes, can you see this another muscle? It is extensor compartment going to the digit. So this is the extensor digitorum longus. Now can you see the lateral side? Sir, the at the peroneal region, fibula attachment. So fibularis, it is very long muscle. So longus, fibularis longus, known as the peroneus longus. Can you see another muscle which is short? Yes, sir. So it is coming and getting insertion into the fifth metatarsal. Orthopaedic disintegration, forcefully contraction, it will cause the fracture of this fifth metatarsal. This is the our Jones fracture. MCQ Jones fracture will be asked in your orthopedics and the radiology. Only two muscles. Which is the nerve? Sir, superficial peroneal nerve. So what is the nerve supply? Peroneus longus peroneus. Sir, superficial peroneal nerve. Yes, these are laterally. So when they will contract, they will elevate the lateral border of the foot. Elevation of the lateral border of the foot is known as eversion. So remember, these are the powerful everter. Tibialis anterior, tibialis posterior, they are powerful inverter. Agree beta? Okay, sir. Now these are the points I told you. The lateral compartment, posterior compartment. Sir, posterior compartment nerve is the tibial nerve. Medial compartment, no. But four things you have to remember: S, G, S, and T. You can remember the four structure: sartorius, gracilis, semitendinous, and tibial collateral ligament. Upper part of the tibia only. The funny mnemonic is salmon गधे से टकराया. Remember बेटा, salmon boy, आज गाड़ी तेरा भाई चलाएगा और उसके बाद पुलिस ले जाएगा. Okay, so remember, this is the your medial compartment only at the upper part, otherwise it is totally subcutaneous. There is a sartorius, there is a gracilis, there is a semitendinous and tibial collateral ligament, and in between them there is a one difficult complex bursa is there, that is a anserine bursa. Okay, now try to understand further. I was talking about the posterior compartment. The nerve is tibial nerve, so all muscles are supplied by the tibial nerve. Sir, this is most bulky, superficial and deep. So in the superficial group, there is a GSP, Gossip nerves. Sir, G for gastrocnemius, S for soleus, P for plantaris. Remember, this gastrocnemius is having the lateral hand and the medial head, and it is fusing with the soleus. So it is making the triceps suri, MCQ. This triceps suri, this all are fusing and making the strongest tendon of the body, that is a tendo Achilles, the Troy movie Achilles tendon. Okay, so it is formed by the 3 tendon. MCQ, here you perform the ankle jerk. Getting the point? So just I am showing you one very interesting fact. Can you see the Troy movie clip? Yes, Troy movie, Achilles, the death of the Achilles. Yes. So Achilles was the strongest warrior at the earth, and he got the death due to the damage in this our tendon. It is the strongest tendon of the body. Remember, her mother Stye River holded the Achilles at this ankle area and dipped into the water. Every part of the body got the touch of the water, became hard like the stone, but this part was not touched with the water and it was soft part, so he got death due to the arrow at this part. This is the beautiful concept on his name. This is known as the tendo Achilles. I told you the concept. Also remember the soleus. Soleus is also as the peripheral heart because it contract and pumps the blood. Venous return in maintain. Venous return, physiology integration. The cardiac output is directly proportional to the venous return. So it is helping in the cardiac output indirectly. That's why it is known as our peripheral heart. Remember, the plantaris is the best muscle for the tendon grafting operation at the lower limb. Okay, sir. Now the deep muscle. For the deep muscle, you can remember the doctors are never hungry. Yes, T for tibialis posterior, D for digitorum longus. Yes, A for artery, the posterior tibial artery which had been asked continuous 4 times, and N for nerve, which nerve? Tibial nerve, and H for hallucis longus. Otherwise, you can remember another mnemonic, Tulsi Das Amir nahi hai. What is the nerve supply of all these muscles? Sir, answer is tibial nerve. Sabka malik ek hai. Got the point? Okay. Okay. Yes, but yes, we have to enjoy this all the session. Now, the last topic, foot. The club foot, CTEV. Sure, it is going to ask. You know, the Martin Guptill, he was not having the toes. Yes, but remember, phalanges never participate in this all activity. So this is the question. In the foot, there is the medial longitudinal arch and there was a lateral longitudinal arch, anterior transverse arch, posterior transverse arch. Okay, sir. So whenever you are observing the footprint, just like at the time of the Diwali, you will see the footprint of the goddess Lakshmi. So you can observe the curvature. So this is the medial longitudinal arch. Yes, sir. Here is the lateral longitudinal arch. Sir, this is the anterior transverse arch and here is the our small posterior transverse arch. Okay, okay. Yes, beta, anyone, if you are having the hunger, thirst, continue with that. Yes, just you have to keep the mobile in front of eye. I'm not going to give the break. You can take the break. लेकिन बेटा वीडियो है, देखते रहना, मजे लेते रहना, पॉपकॉर्न खाओ, कोल्ड ड्रिंक पियो, मजे लो, बढ़िया सी मूवी चल रही है. यस, सेरिबेलम का शो चल रहा है और शो मैन आपके सामने है. So enjoy the session, okay? Now try to understand further. Sir, when you are observing the foot, so medial side, the first, second, third metatarsal, 3 metatarsal, 3 cuneiform, medial, intermediate, lateral cuneiform, and 3 our tarsal bone, navicular, talus, and medial half of the calcaneum. Magic of 3, everything is 3. 3 metatarsal, 3 cuneiform, 3 tarsal bone participating. These are making the medial longitudinal arch, while the lateral, magic of 2. 4th and 5th metatarsal, cuboid bone, and lateral half of the calcaneum. These are making the lateral longitudinal arch. Yes, 2 metatarsal and 2 tarsal, magic of 2. If there is a problem in that situation, the different foot deformity occurs. The most common foot deformity, that is our, yes, club foot. You can remember the congenital talipes equinovarus, where in orthopedics you will see the cave treatment. Okay, Elizaro technique, this all the things. So this identification of the foot bone you must know. Okay, getting the point, beta? Yes, I never get tired when I am teaching. Teaching is my passion. और बेटा अगर टीच करने के लिए बोलोगे तो सालों साल कंटिन्यू बिना खाए पिए ये सब बिना थके हम पढ़ा सकते हैं। ओके, खाना पीना तो पड़ेगा, कुछ ना कुछ तो खाना पड़ेगा, लेकिन बिना थके जरूर पढ़ा सकते हैं। हाँ, कब? जब टीचिंग कर, अगर टीचिंग नहीं करते रहेंगे तब तो बेटा हम थक जाएंगे। ओके, व्हाई? बिकॉज दिस इज योर पैशन। जिस काम को करते हुए आपको थकान महसूस ना हो, जिस काम को करते हुए आपको भूख प्यास ना लगे, बेटा वो पैशन है, और वो चीज आपका कैरियर है, वो चीज है जो आपको इस जिंदगी में पहचान देगी। आपको इसके लिए करना है। ये पैसे के पीछे मत भागो बेटा, इसके पीछे भागो। ये करोगे तो दुनिया में नाम, पैसा, प्यार, मोहब्बत, फैमिली, हर चीज आपके पीछे भागेगी। सो कैन यू सी द आइडेंटिफिकेशन ऑफ द बोन? सर, दिस इज द calcaneum. Sir, this is the talus. And here is the navicular bone, medial, intermediate, and lateral cuneiform bones, and first, second, third metatarsal. Phalanges never participate. So these are the medial longitudinal arch. What I want to tell you, sir, the lateral half of the calcaneum, the cuboid, and the fourth and fifth metatarsal, they are participating in the lateral longitudinal arch. Getting the point, बेटा? इतना ही पढ़ना है, बार बार पढ़ना है। यस 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 अमन, शो मस्ट गो ऑन। यस, अब बेटा इसकी क्या क्या ट्रीटमेंट है? यू विल स्टार्ट फ्रॉम द योर ऑर्थोपेडिक्स। सो आफ्टर दिस डिस्कशन, ओके, द portion of the head neck, and good thing for the our, yes, FMG students, last time no question from the neuroanatomy, but head neck, yes, question had been asked, na? Again, I want to tell you, NEET PG INICT, whenever I take the bullet train anatomy, you will see head, neck, face, and neuroanatomy is first, because the more questions are asked from here. Okay? But in the FMG exam, neuroanatomy, less question, head and neck, questions are asked. Okay? So we are going to create. So with the Spider-Man motivation, above all, no matter how many times you get hit, can you get back up? बेटा गिरना है, लेकिन गिर करके फिर उठना है। रिमेंबर बेटा, होकर पाने का मजा ही कुछ और है, रोकर मुस्कुराने का मजा ही कुछ और है। हार तो जिंदगी का हिस्सा है मेरे दोस्त, हार के बाद जीत जाने का मजा ही कुछ और है। So with this modified line, we are going to look for our things. Yes, आएगा बेटा, स्पाइडरमैन आएगा। Wait for the any part at the end, कभी भी आ सकता है। Don't worry for that. Okay, Spider-Man. Yes, on the bullet train anatomy. Yes, yes, yes. The Spider-Man is on the our bullet train. Can you see? हमारा जो स्पाइडरमैन अंकल है वो बुलेट ट्रेन के साथ चल रहा है। Yes, see here just. Spider-Man with the bullet train. So bullet train not me with the Spider-Man. Yes, that is the bullet train and the Spider-Man. So that is the dedication. You have not to leave this bullet train. Spider-Man over the bullet train. Okay, so now come to the your next question. FMG July 2023. Tell me beta, focus, focus, focus. Yes, 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 yes. Try to understand further. Now you have to solve the question. Okay. After the extraction of the third molar tooth, they are talking about the tooth. The patient was observed to have loss of sensation from anterior two third of the tongue. I told you one question from the tongue. Anterior two third of the tongue, it is supplied by general sensation, lingual nerve. I will teach you. FMG July 2023. One question from the tongue. Can you see? During road traffic accident, patient suffered from the extradural hemorrhage. Sir, extradural hemorrhage. So this is the middle meningeal artery which is lying on the pterion. One question from this pterion, middle meningeal artery. Can you see? During climbing staircase, I told you, Allu Arjun, which nerve beta? Spinal accessory nerve. Yes, we discussed. So cranial nerve, one question from the cranial nerve. A patient presented with the swelling below the ear. Yes, below the ear part. Complained of the plane of the ear lobule. They are giving this clue, ear lobule. He is having difficulty in eating the food. Which nerve is most commonly damaged? So remember beta, ear lobule is given. Okay, yes, he is having the problem with the ear lobule. Ear lobule means you have to mark this greater auricular nerve. There are the different kind of the question pattern. Okay, great auricular, if they are asking about the ear lobule, you have to go with the your great auricular nerve. Okay, now can you see FMG July 2023? Man suffered injury on head, and after this the blood collected around the eye. Sir, this is the raccoon eye, which is related with our dangerous area of the scalp. Answer is the loose areolar layer. Very good, very nice answer beta, very nice answer. Yes, 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 very good. Now look here, the image based category question. Here the arrow was put on over the epiglottis. So you have to learn about this our Yes, cadaveric section. Can you see the same kind of question with the integration to the radiology they had asked? So can you see, sir, this is the occipital bone C1, C2, C3, C4, C5, C6, C7. So C3, C4, it is related with the our which cartilage? Remember, it is related with the upper border of the thyroid cartilage. Getting the point, beta? Hope you all are getting the facts properly. So now we are going to look for the next. Yes, Twinkle, thank you. Twinkle is saying, sir, blessed to have teacher like you. Thank you for all efforts. Yes, beta. We are going to complete this session with the same energy and all the things. I am teaching all the 4 days content in rapid revision, in ORR, and in the our 5-6 hour session also. Same things are there. Okay. Content is 99% almost same. Okay, sir. Can you see the FMG July 2020? A patient underwent surgery, submandibular gland, okay, which is suspected to the hypoglossal. So you have to learn the cranial nerve. So cranial nerve is damaged. Remember, whenever 12th cranial nerve is damaged, there is the ipsilateral deviation. So if there is the our tongue damage, so there is a deviation of the tongue to the same side. A will be the answer. So this was our PYQs. Now we are going to look, sir, how to study the our head, neck, scalp, face, neck. Yes, these are our bony landmark. Scalp. In scalp, you have to remember SCALP. Sir, skin, connective tissue, aponeurosis, loose areolar layer, P for, sir, pericranium. Forget everything. What you have to remember, sir, this aponeurosis. Sir, this aponeurosis is, sir, you have to remember the loose areolar layer. This is the 4th layer. Remember, this is the dangerous area of scalp. Yes. Here is the blood collection that is sweeping over the eyelid and it is causing the, yes, sir, black eye. Also, you can say the raccoon eye. This was the recent FMG question. Okay. Now, look for this your face part. So, skin, superficial fascia, deep fascia, you're cutting. Now, remember, yes, deep fascia is absent in the scalp, in the face, in the thorax, and in the abdomen. 4 parts: scalp, face, thorax, abdomen. So now directly muscles are coming. Subcutaneous muscles are known as panniculus carnosus. So old question pattern, here is the frontal muscle, frontalis, which is surprise muscle. Yes, this is the corrugation activity. There is the orbicular shape, orbital shape muscle, orbiculis oculi. When it is contracting, it is causing closure of the eye. Yes, it is the winking muscle. The song dedicated over this anatomy part, all the Hollywood, Bollywood, Tollywood, they are coming from the our, yes, anatomy. Aankh mare, ho ladki, aankh mare. This is our winking muscle. Also, CT bajaye. So remember, which is the our, yes, whistling muscle. Answer is orbiculis oris, but best answer is buccinator. So this activity is done by the buccinator muscle. Also, the orbiculis oris is helping. Can you see? There is our smiling muscle. Zygomaticus major is a smiling muscle. Okay. And sad activity. Upper lip is going upside. Levator labii superioris. Also, there is the grief activity. Lower lip is going down. So depressor labii inferioris. This is the grief muscle. And this is a doubt muscle. Mentalis. Patta nahi. Don't know. So there is a roughness, mentalis. And which is the terror muscle? Remember the platysma. Yes, you all are aware about this, our Priya Prakash warrior. I made the video very old 2016-17. This one. See, frontalis muscle. Hollywood, Bollywood, Tollywood. Tollywood is coming. Can you see frontalis? Frontalis. Yes, zygomaticus major. Frontalis again. Yes, orbiculis oculi. Okay. And yes, you can see there is the rhizorius activity, greening activity. So rhizorius is there. Okay. So rhizorius had been asked. Remember, all these facial muscles are supplied by the facial nerve. Okay. So this is the very old my YouTube channel part where you can see this all the things. But yes, sir, zygomaticus major, frontalis, sir, frontalis, and this is the orbiculis oculi, and this is the rhizorius activity. And if this is the paralysis, and in that situation, sir, Bell's palsy. Very, very beautiful integration. Getting the point? Okay. Definitely, this class will make the great impact over this FMG exam. Till now, I think approximately 50 questions we had discussed now. Okay. So now try to understand this activity, sir, this is the our grinning activity, rhizorius. This is the your zygomaticus major. This is the anger activity. During the anger activity, remember the nose is getting dilated and tip of the nose is coming down. Yes. So what should you have to do? You have to just do the acting of the Dharmendra. Yes, do this one. Basante and mat nachna. So you will get there is a dilation of the nose and tip of the nose is coming down. This is the anger muscle. Yes, remember the show of the cerebellum and the show man of the cerebellum. Don't forget, you can crack easily the question, which is the anger muscle. Again, do the activity, nose is getting dilated and tip of the nose is coming down. So you can easily remember, sir, the anger muscle is, say that your question, dialogue. Something like that. So there is the our dilatation of the nose and tip of the nose is coming down. Okay, so just enjoy the anatomy. Anatomy is everywhere, everywhere. Okay, fine. So these are the things. Sad activity you can see. Yes, can you see the grief activity? Can you see the surprise activity? Yes, frontalis, and this is the terror activity. So these all are the thing. Now the artery supply of the face. So you all know the external carotid artery supplying. So remember, one is the medial branch, and remember the three anterior branch, two terminal branch, and two posterior branch. See here, sir, one medial branch, ascending pharyngeal artery, three anterior branch, superior, thyroid, lingual, and facial, two terminal branch, superficial, maxillary, two posterior branches, posterior auricular and occipital. इतना ही पढ़ना है, बार बार पढ़ना है. During the detailed class, I draw the diagram, but right now this is the bullet train, not me. Okay. Now here is the one mnemonic. Yes, she always likes friends over papa, sister, and mama. S for superior thyroid, A for ascending pharyngeal, L for lingual, F for facial, O for occipital, P for posterior auricular, S for superficial, temporal artery, and M for maxillary artery. Okay, so branches of the external carotid artery we have to learn. I told you the diagrammatic presentation as well as mnemonic. Now, this is the venous drainage. One thing you have to remember, the dangerous area of the face. Sir, this lower part of the nose. Okay. Sir, the lower part of the nose and upper lip, it is having the connection with the our cavernous sinus inside. I will teach you the cavernous sinus later. But this is causing damage to the cavernous sinus, which is related with the our cranial nose and the intercarotid artery. That's why this is our dangerous area of the face. Another thing, remember the external jugular vein. It is formed by the posterior auricular vein and the posterior division of the retromandibular vein. Yes, so this is the external jugular vein, which is very important for the JVP measurement, where you will see the A wave, V wave, then X descent and the Y descent, and C for closure of the tricuspid valve. Okay, so these are the your integration. Only one anatomical point, dangerous area of the face. You have to remember, sir, this is the your dangerous area of the face. New nomenclature, maxillofacial death pyramid. Getting the point, sir? This is the your one pyramidal structure which is including the dangerous area of the face. Both are same thing because it carries the infection to the your brain part. Okay, now we are talking about the nerve supply. Important, motor nerve, sir, facial nerve, sensory nerve, sir, trigeminal nerve, which is dividing into the fifth one, fifth two, and the fifth three. So remember, sir, the facial nerve, temporal, yes, you can remember the zygomatic, then buccal, then marginal mandibular, and then there is a cervical. So these are the your branches from the facial nerve. But the trigeminal nerve, it is having the our ophthalmic division, maxillary division, and the mandibular division. Okay, so this is the point which you have to remember. Three dermatome. Yes. So what are the branches from the our ophthalmic division? Sir, supratrochlear, supraorbital, and lacrimal. And then infratrochlear and external nasal. MCQ. External nasal is supplying the tip of the nose. Okay. Yes, our mnemonic is lai. Okay. So what you have to remember, sir, सुसु करके लाई बोला किसने? जीजा जी ने. Sir, the our V2 maxillary nerve, it is dividing into the zygomatico-temporal nerve. Yes, infraorbital nerve and zygomatico-facial. So you can remember ZIZ. Yes, एक funny mnemonic, जीजा जी ने सुसु करके लाई बोला, so he got the MBA degree. Yes, M for mental nerve, B for buccal nerve, and A for auriculotemporal nerve. So these are the our different branches of the trigeminal nerve. Remember, entire face is supplied with trigeminal nerve except angle of mandible. Except angle of mandible. MCQ. There is our great auricular nerve which is supplying the auricle. MCQ, the pinna main supply great auricular nerve, but it is giving one branch which is supplying the our angle of mandible. So remember the great auricular nerve. MCQ, root value C2, C3. MCQ, it is supplying the angle of mandible. This angle of mandible in surgery asked as the shaving area. If there is a damage of this nerve, then there is a Fraze syndrome. MCQ. So you will see this Fraze syndrome, auriculotemporal nerve syndrome, parotid gland area. When the patient is eating the food, then there is a sweating and redness over this auricle and temporal area. This is your Fraze syndrome. Yes, there is the abnormal connection. There is a short circuit between the great auricular nerve and auriculotemporal nerve. There is the, yes, short circuit. Now read this topic in your ENT and surgery. Agree, beta? Okay. Now try to look. This is our Bell's palsy. Yes, sir. There is the wrinkling, contraction of the eye, nasolabial fold is formed, and you can see here is a smiling, whistling activity, but no contraction. There is a dilated eyelid and no nasolabial fold, and mouth is deviating towards the sides. So there is a facial nerve damage on the affected. So this is the abnormal side, this is the normal side. Bell's palsy, important. Okay. Now try to understand further. Trigeminal nerve. Do you remember trigeminal neuralgia, Salmon Boyd disease, severe shooting burning pain along the trigeminal nerve? Pharma integration, drug of choice, tell me, carbamazepine. Second drug of choice, valproate. But nowadays clinically gabapentin is used. If not treated, then you have to inject 90% alcohol in the Meckel's cave, dura fold. But remember the beautiful integration with the NART, pharma medicine and neuroanatomy. Nowadays, you will use the gamma knife surgery. No need to give the single incision. The gamma rays are coming, they are concentrating and they are destroying the mass without the single blood drop. Yes, the gamma radiation, they are very, very dangerous. Hope you all are aware about this beautiful, beautiful, amazing scene. The gamma radiation, they are very, very dangerous. Gamma knife surgery. Can you see the gamma radiation? Yes. Just observe. Gamma radiation, radiology, trigeminal neuralgia, pharma, gamma radiation. It is very destructive. Entire upper limb is getting destroyed. Okay. So Thanos, Hulk, they can tolerate. Hulk was the creation of the gamma radiation. So he didn't get dead. But Tony Stark, I am Iron Man. And then happy birthday of the Tony Stark. Why? Gamma radiation. So remember, this gamma radiation is very dangerous. So gamma knife surgery is very, very good surgery. This is used for the brain tumor like the acoustic neuroma. Don't forget the radiology integration. Now see your ophthalmology, dermatome, painful vesicular eruption along the dermatome. Close your eye and say that is a herpes infection. So here you can see there is the involvement of the fifth one, fifth two. Yes, there is the involvement of supratrochlear, supraorbital, and there is the our lacrimal nerve, infratrochlear and external nasal nerve. So this is your trigeminal nerve involvement. Agree everyone? So this is involvement, painful vesicular eruption along the dermatome. Close the eye and say the herpes. Yes. Ophthalmology integration, same, your herpes zoster ophthalmicus. So this is the our trigeminal nerve modification. Trigeminal nerve questions. Okay. Now see the neck. We completed the scalp, face, now neck. In the neck, the deep fascia is present. It is covering entire neck, which is known as the investing layer of deep fascia. The fascia which is in front of the trachea, pretracheal fascia. The fascia which is in front of the vertebra, prevertebral fascia. And the fascia which is, yes, remember, covering the neck just like the collar. So that is our fascia coli part. Also, there is the buccopharyngeal fascia and pharyngobasilar fascia. These are not important, but this carotid sheath is important. What is the carotid sheath? The modification of the deep fascia around the carotid vessels is known as the carotid sheath. What are the content? Can you see? Sir, common carotid artery. Yes, sir. And internal carotid. But external carotid is not the content. Sir, internal jugular vein, and in between them there is the our 10th nerve. But according to the 42nd edition, remember the 9th, 11th, 12th are also content, 10th already it was content. So all are content about the carotid sheath according to the latest concept. Now see, there is the one loop of the nerve in the neck. So this loop is known as ansa. It is at the neck. That's why you will say cervicalis. When you will cut, then you will see the 1 dot, 2 dot. Yes, loop of the nerve is here. When you're cutting, you will see 1 dot and 2 dot. So can you see? Sir, this is the carotid sheath. Content is our internal or common carotid artery, internal jugular vein, and this is the vagus nerve. Here you can see the entry wall which is formed by the pretracheal fascia, and this is the posterior wall which is formed by the prevertebral fascia. Sir, pretracheal fascia, prevertebral fascia. And at the front, remember this is the question on the entry wall, ansa cervicalis. AN for anterior, AN for ansa. And at the posterior side, sir, there is a sympathetic trunk. Complete. Okay. So after this all, we are coming for this, our triangles of the neck portion. Agree, beta? So what I want to tell you, sir, triangles of the neck. Here is the one big muscle. Sir, this is the sternocleidomastoid. In front of this sternocleidomastoid, there is the anterior triangle, and behind the sternocleidomastoid, this is the posterior triangle. Okay, sir. Again, this anterior triangle is divided by the our digastric muscle and omohyoid muscle into the 4 triangle. Yes. Can you observe, beta? This is the our just below one triangle, just below the mandible, submandibular triangle for the neck surgery. Yes, here our submandibular gland is present. Okay, this is also known as a digastric triangle. Sir, here is a carotid triangle where the carotid vessels are located. इतना ही याद रखना है. Can you see? This is the just below the our chin, one small triangle. Sir, it is the submental triangle. Submental lymph node are there. And you can observe this is your muscular triangle. Yes, sir, it is the muscular triangle where the strap muscles of the neck are located. Now, can you see? This is the posterior side. So the posterior triangle is divided into the occipital triangle. Yes, sir, it is occipital triangle, and it is above the clavicle. So you will say supraclavicular triangle. Okay. One thing which you have to remember, sir, the nerve point is there from where the 11th nerve is coming, very thick nerve is coming and ending at the sternocleidomastoid. This is the FMGE 2023 question. Only one thing you have to remember, sir, this is our 11th cranial nerve. जो नर्व जहां रहती है, जहां बहती है, उसे सिर्फ सप्लाई करती है. So remember, sternocleidomastoid and trapezius, these are supplied by 11th cranial nerve. इतना बस आपको याद रखना है. Agree, beta? Now come to the our this cadaveric section. We had seen the scalp, face, neck. Now we are cutting and we are going to look inside. So I'm going to tell you the tricky point. This is the bullet train revision session. So just to see, sir, this is the nose front and here is the back. So look here, sir, this is scalp. Sir, this is the skull bone. Can you observe? Sir, this is the our corpus callosum. Just below to it, septa, and here is the fornix. So your formula is, sir, C, then S, and then F. What is your formula, beta? Corpus callosum, septum callosum, and fornix. Okay, sir. Now just below to it, there is the oval mass of the gray matter, thyroid. Below to it, there is the hypothyroid, and here is the pituitary gland. So your mnemonic is THP. तुम होगे पास. Definitely you will crack this exam. So your mnemonic is T for thalamus, H for hypothalamus, P for pituitary. Okay, same sequence will be followed in the radiology. Remember, yes, तुम हमारे पिया. Otherwise you can remember तुम हो पियक्कड़. Any mnemonic you can do. Thalamus, then below to it hypothalamus, below to it there is a pituitary gland. And can you see, sir, it is the midbrain, pons, and then our medulla. Sir, these are our midbrain, pons, and midbrain. Okay, midbrain, pons, and medulla. Now, can you see fern tree like branching pattern? Sir, this is our cerebellum. And if you will see carefully, there is an elevation just behind the midbrain. Sir, it is the superior colliculus, inferior colliculus, and one small mass above the superior colliculus. This is our third eye of the Lord Shiva, pineal gland. If there is a pineal gland tumor, it will cause damage to the superior colliculus and patient is not able to look upside due to the damage to the interstitial nucleus of the casal. Better to say, correct pronunciation is the kahal. Okay. Yes. So patient will present with the downward gaze. That is your Harrison. Okay. Now look further. Sir, this part is your spinal cord. Okay, sir. So definitely this is your vertebra. In front of the vertebra, esophagus, and then trachea. Your mnemonic is VOT. V for vertebra, O for esophagus, T for trachea. Okay. पहले के नेता कहते थे तुम मुझे खून दो मैं तुम्हें आजादी दूंगा. आज के नेता कहते हैं तुम मुझे वोट दो मैं तुम्हें बर्बादी दूंगा. Okay, sir. So this is the one funny way you can remember, sir. C1, sir, C2, C3, C4, C5, C6, C7, and definitely it is the T1. Okay. Now, can you see the upper part of the esophagus, sir? It is getting dilatation and it is open upside. Upper dilated part of the esophagus, sir, it is nothing. This is our, yes, pharynx, and upper part of the trachea, sir, it is our larynx. Simple, so simple. Upper part of the esophagus, pharynx. Upper part of the trachea, larynx. Simple. Okay. Now, can you observe the pharynx, sir? It is having the three part. Just behind the nose, nasopharynx. Just behind the oral cavity, oropharynx. And just behind the larynx, that is the laryngopharynx. So three parts you can say, sir, nasopharynx, oropharynx, and laryngopharynx. So ENT integration, relation of the your, yes, pharynx. जो दिख रहा है वो बोलना है. Nasopharynx, anteriorly nasal cavity, superiorly base of the skull, inferiorly oropharynx, posteriorly, yes, first part of the word, first cervical vertebra, C1. First part, first cervical vertebra. Second part, superiorly nasopharynx, जो दिख रहा है वो बोलना है. Inferiorly बेटा, yes, laryngopharynx. Anteriorly there is the oral cavity, and posteriorly it is second part. So next two cervical vertebra, C2 and C3. And now focus here. Yes, yes, laryngopharynx. Superiorly, oropharynx. Inferiorly, there is our esophagus. Anteriorly, there is the larynx. And this is the third part. So three cervical vertebra, C4, C5, C6. Simple. And you can observe here. This is the narrowest part of the GIT at the level of C6. So many MCQ. Listen carefully. Focus, focus, focus. What you have to remember? Pharynx ends at C6. One MCQ. Esophagus starts at C6. Next MCQ. Larynx ends at C6. Next MCQ. Trachea starts at, yes, C6. Narrowest part of the GIT, C6. This is nothing. It is the part where the cricoid cartilage and pharynx are meeting. This is the cricopharyngeal junction. Simple. And you can see here our tongue. So one fan-like muscles is here, that is a genioglossus. When this genioglossus will contract, it will cause a protraction of the tongue. Yes, sir. This is known as, yes, safety muscle of the tongue. MCQ. Remember, the safety muscle of larynx, this is your ENT question, that is the posterior cricoarytenoid. But yes, these are important questions. These help to hold the tongue in the proper position. Agree, beta? So many MCQs we had done. Now same thing at the radiology. Same. Radiology is nothing. It is a shadow of the anatomy. Can you observe, beta? Sir, C, then S, and then F. Corpus callosum, septum procedum, and then fornix. And then you can see the, yes, see here. Corpus callosum, septum procedum, and this back arrow is the fornix. When there is a regular class, we draw everything and we show. But this is the bullet train revision. Okay? Can you see? Tum, hamare pia, thalamus, hypothalamus, pituitary, and then M, P, M. Yes, midbrain, pons, and then there is the medulla. Can you see the superior colliculus, inferior colliculus, and you can see the pineal gland. Also, you can observe the cerebral aqueduct of Sylvius, and this is the fourth ventricle, and this is the fern tree-like branching pattern. Sir, cerebellum. Agree, beta? Getting the point, everyone? Okay. Now try to understand further. Sir, this is our spinal cord. You can see the vertebra, then esophagus, and then our same thing, the trachea. The upper part, you will see the nasopharynx, then oropharynx, and laryngopharynx. So this is the area of the larynx. Same. And you can see the tongue. where you will see the genioglossus. Agree? So same kind of the things you will see the banana memes which I teach in the regular class. When you will do the X-ray, yes, such kind of the view. CT scan is nothing. It is the high definition computed axial tomography. So banana will appear in a better way. So central part less density black, peripheral part more density. But MRI soft structures are seen better due to the water, due to the ionic, due to the magnetic activity. So the central part is your whitish, just opposite which I teach in regular classes. This all the basics of the radiology. Okay, so right now can you observe? Oh, sorry, in this image this portion is not there. Okay, okay, I am teaching in this image. Look here, the cranial nerves within the cranial cavity. Can you see, sir? There is a cribriform plate of ethmoid. So here is the olfactory nerve, olfactory bulb, olfactory tract. Sir, first cranial nerve. Now you can see the second cranial nerve. It is passing through the optic canal. Second cranial nerve, optic canal. Now this is the pituitary gland. On each side there is our cavernous sinus. So you can see the third cranial nerve, the fourth cranial nerve, and look here, the fifth cranial nerve is dividing into the fifth one, fifth two, fifth three. Sir, there is the fifth one, fifth two, and fifth three. Remember this 3, 4, 5. Okay, these all are passing through the superior orbital fissure, while the V2 is passing through the foramen rotundum, and this is passing through the foramen ovale. One very frequently asked question, foramen ovale, it passes the MALE, male. M for mandibular nerve, A for, yes, accessory meningeal artery, L for laser petrosal nerve, and E for emissary vein. Okay. Now there is a next cranial nerve, that is a sixth nerve. Fine, sir, which is passing again through the cavernous sinus. Now can you see the internal acoustic meatus, where you will observe the seventh nerve and eighth cranial nerve passing through the internal acoustic meatus. Now see the jugular foramen, from where 9, 10 and 11, 9, 10 and 11 cranial nerves are passing. And last is your hypoglossal canal, from where the 12th cranial nerve is passed. So these are the important cranial nerves. Okay. Also, can you observe the sinuses of the brain? See here, beta, there is a one big sinus, cavernous sinus. Yes. And one big sinus straight running. This is your straight running sinus. Yes, straight sinus. Then you can see the transverse running large vein, transverse sinus. And this is your S-shaped sinus, sigmoid sinus. Again, I am teaching you with the three-dimensional view. Look here, beta. Yes, Brijban, you are right, beta. You will see in the radiology part. But right now, can you observe the sinuses of the brain? Sir, we are cutting the cranial cavity. We are looking. So brain we are cutting. So this is the our fold of the dura mater, falx cerebri, just along the upper border. Can you see the superior sagittal sinus? Yes, CSF is absorbed here. Now you can observe the inferior sagittal sinus, and then you will be able to see the intracerebral vein of Galen. Yes, this is the great cerebral vein of Galen. If it is getting abnormality, Galen vein deformity occurs in the congenital situation. Now, inferior sagittal vein, listen carefully, plus great cerebral vein of Galen is equal to straight sinus. There was the radiological image, and in FMGE exam, this was asked, sir, it is our straight sinus. Now this straight sinus is coming at the our torcula hierophili, the father of the anatomy. Yes, torcula hierophili, the confluence of the sinus. In radiology, you will learn this our confluence of sinus is having the TOSS, TOS. Yes, there is the our union of the transverse running sinus, T. There is occipital area sinus, occipital sinus, O. S for superior sagittal sinus and S for straight sinus. S for straight sinus. TOS are meeting here. Now see, this is the transverse sinus and it is S-shaped running sinus, sigmoid sinus. It is coming through the our jugular foramen outside. So this is the your jugular foramen. Yes, it is now continuing as the jugular vein, internal jugular vein. Remember, this internal jugular vein is nothing. It is a continuation of the sigmoid sinus. ENT integration. There is the CSOM, chronic suppurative otitis media. So when there is infection and inflammation, it will cause blockage of this that will result in the complication lateral sinus thrombophlebitis ENT topic. Getting the point, beta? Okay, so these are the things which you have to remember. Now, one sinus you all are aware, the most important sinus, cave-like sinus. Yes, sir. This is our midline structure, pituitary gland. On its side, there is the one large sinus which is having the roof, floor, medial wall, lateral wall. Sir, it is having the small cavities. It is having the small cavities. It is the cavernous sinus. MCQ, the cavernous sinus laterally related with the third nerve, fourth nerve, fifth one, and fifth two. But according to the latest update, this fifth two is outside. Also, the fifth three is outside the cavernous sinus. But what are the direct content? MCQ, sir, this internal carotid artery as well as one nerve, sir, sixth nerve, abducent nerve. These are the direct content. Always remember, there is one fold of the dura mater around the our, yes, sixth nerve, that is the Dorello canal, sir. It is the Dorello canal. So the MCQ has been asked, what is the content of the Dorello canal? Answer is the sixth cranial nerve. MCQ beta. And definitely these all cranial nerves are related with the eye. So whenever there is the dangerous area of the face is involved, cavernous sinus is involved, there is a cavernous sinus thrombophlebitis, cavernous sinus thrombosis, ophthalmoplegia, the third, fourth, fifth one, fifth two, internal carotid artery is involved, also the sixth nerve. Also there is a pulsation at the eyeball, that is the your pulsatile exophthalmos. So these are the your different points which you have to remember. Okay, so this was the your head neck face portion. Now we are covering our neuroanatomy. Remember beta, with great power comes great responsibility. The line from the our, yes, great Spider-Man. Remember, पत्थर की चमक है न नगीने की चमक है, चेहरे पे सीना तान के जीने की चमक है, पुरखों से विरासत में हमें कुछ न मिला था, जो दिख रहा है खून पसीने की चमक है. So you all are belonging to the middle class family. We all are belonging to the middle class family. Yes, we have to create something which will be observed by entire world. तो इसके लिए हम मेहनत कर रहे हैं बेटा, आप मेहनत कर रहे हो और आपके पीछे हम सभी टीचर मेहनत कर रहे हैं. और वो दिन आएगा जिस दिन हम ईद, होली, दिवाली से बड़ा सेलिब्रेशन करेंगे, वो होगा रिजल्ट का दिन. मिलकर के उस दिन का हम इंतजार करते हैं, लेकिन उसके पहले मेहनत करनी पड़ेगी. रिमेंबर, टू गेट एक्स्ट्रा वी हैव टू डू एक्स्ट्रा. टू शाइन लाइक अ सन, फर्स्ट वी हैव टू बर्न लाइक अ सन. तो चलो मिलकर के पढ़ते हैं, एक बढ़िया सा जबरदस्त हम सेशन करते हैं. यस, दिस इज अवर बुलेट ट्रेन रिवीजन. कैन यू सी द न्यूरोएनाटॉमी? बहुत ही कम पार्ट यहां से पूछे जाते हैं एफएमजी एग्जाम, बट वी आर फोकसिंग विद द इंटीग्रेशन टू द अवर मेडिसिन. सो ट्राई टू अंडरस्टैंड. सर आएगा, स्पाइडरमैन आएगा, एंट्री वुंड, यस, डोंट डू, जस्ट चिल, आएगा बेटा. लेकिन पहला जो हमारा काम है बेटा, वो है हमारा एनाटॉमी. विल कवर इट. ओके, यस. आई वॉन्ट टू टेल यू, मैंने आपको सेशन के शुरू में कह दिया था कि क्लास जो है वो 4 बजे तक चलेगी ना, आपको पहले इन्फॉर्म कर दिया था. सो स्टे ट्यून बेटा, हमको तकलीफ तो झेलनी पड़ेगी. टू गेट एक्स्ट्रा वी हैव टू डू एक्स्ट्रा. बेटा दर्द में आप भी रहेंगे, दर्द में मैं भी रहूंगा. ओके, लेकिन यस, इस दर्द में कुछ मजा है. ओके, किसी ने गालिब से पूछा कैसे हो गालिब, गालिब ने कहा, यस, क्या कहा गालिब ने, जिंदगी में दर्द है, दर्द में गम है, गम में मजा है और मजे में हम हैं. और इसी दर्द के कारण एक रिजल्ट का दिन आएगा और उस दिन को हम सेलिब्रेट करेंगे, मिलकर सेलिब्रेट करेंगे. बेटा जिस दिन रिजल्ट निकला, आपका सिलेक्शन हुआ, वो दिन हमारे लिए दिवाली, ईद और होली से बड़ा सेलिब्रेशन का दिन होगा. तो आप बच्चों के सक्सेस के पीछे हम टीचर को बहुत खुशी होती है. चलो बेटा मेहनत करते हैं. सर, identify the arrow marked structure. This is the radiology question. The sequence is hidden due to the technical fault. बेटा ये पूछा गया था आपका इंटरनल कैप्सूल. ओके, थैंक यू रोहन, थैंक यू फॉर योर सपोर्ट. ओके, चलो भाई, तो ये इंटरनल कैप्सूल है. आई विल शो यू दिस इमेज. ये हाइड हो गया. ओके, नाउ If there is a lesion involving the paracentral lobule, I will teach you paracentral lobule, P for paracentral lobule, P for perineum. Perineum is controlled by the paracentral lobule. So we have to learn the our Broadman area. Yes, iske baad beta spinal cord end in the neuroborn. I will teach you the spinal cord ending. It is ending at the L3. So spinal cord, a question. Can you see dermatome? I will teach you the entire dermatome. This medial side of the great toe, this is supplied by the L4. Then three fingers are L3. Then this corner is S1. So answer in this question. Sorry, this is the L5. This is the L5. Answer in this exam, the L4. So one question in your next exam, that is your dermatome. Can you see? Identify the marked structure. So this is the central elevation. I will teach you this section. Central elevation is known as the pyramid. Lateral elevation is known as olive. So answer was the pyramid. So brain section we have to learn. We are doing analysis. Okay. Now try to understand our section. Okay. Last current July FMGE 2023, no question from the neuroanatomy. Okay. Yes, integration definitely they will ask, but yes, the neuroanatomy it is more important for the INICT. भर के question आते हैं and your head neck face part. Can you see developing baby? So during the development of the baby, starting the spinal cord is reaching up to the end of the spinal cord, but as the baby is growing, but no division in the neuron, so it is ending above, and in adult it is ending at the very top. So in the adult, earlier answer was L1 L2 junction, but Gray's Anatomy then says that lower border of the L1, but recent best answer is the middle one third of the L1. Yes, what I want to tell you, in adult spinal cord ending, best answer is L1. If it is not given, then lower border of the L1. If it is not given, then L1 L2 junction. So lumbar puncture definitely you will do below, means L3 L4 lumbar puncture. In children, yes, come more down. So L3 L4 junction or L3 L4 you can do. Okay, single answer L3 is the best. Now where you will perform the lumbar puncture, definitely more below, means L4 L5. So this is the one table for all of you. Okay, spinal cord ending, and this is the lumbar puncture level. MCQ, 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 pedia and the medicine integration. No excuse. Okay, sir. Now we are cutting the spinal cord, so you can see the our central canal. Around it there is the our gray matter and the white matter area. Yes, there is a dorsal horn which is sensory, ventral horn which is motor, and you can observe the lateral horn which is sympathetic. 3 MCQs from the physiology. And this gray matter area is dividing the our white matter portion into the three portion: dorsal white column, lateral white column, entry white column. Yes, here the axons are there, and bundle of axons are known as tract. Hope in physiology you covered the topic of the tract in short and sweet way. Sir, at the dorsal side, fasciculus gracilis, fasciculus cuneatus, these are responsible for the fine touch. Yes, sensory tract. On the lateral side, there is a dorsal spinocerebellar, ventral spinocerebellar, which are responsible for the subconscious kinesthetic sensation. And here is a lateral spinothalamic tract, which is responsible for the lateral spinothalamic tract, pain and temperature, very important. And here is our entry spinothalamic tract. So these all are carrying the impulse from below to the above. So these are ascending tract, sensory tract. And there are the descending tract also, which are going from the brain to the down. Okay. Yes. So catch here. Tract. These are our bundle of axons. Two types. Sir, SAME. Same is the mnemonic. S for sensory, A for ascending tract. In detail classes, I teach the tract, okay? But this is the physiology part. So only anatomical part which are important. Cut and observe. I had shown you. Yes. M for beta motor tract, E for efferent. Don't confuse A for, also you can say efferent. Okay, sir. Now try to understand when you will observe the our brainstem part. So what are the different structures will be visible? So first I am showing you one linear diagrammatic presentation. Sir, suppose this is our central canal where you will see the, yes, gray matter. and here is the white matter. Okay, sir. So the upward continuation of this spinal cord, sir, this is the our central median sulcus, and this is dilating like the bulb. Medulla means bulb. So you will see the central dilatation is the our, yes, pyramid, and the lateral elevation is known as, yes, olive. Got the point? Now cranial nerves. Again, I'm teaching you the cranial nerves. Behind the olive, 9th, 10th, 11th cranial nerve. And behind the pyramid, see here, sir, behind the pyramid, there's a 12th cranial nerve. Sir, 9, 10, 11. And behind this, you will see the 12th cranial nerve. MCQ, these are attached. This is the olive, and the central elevation is the, yes, pyramid. So these are attached behind olive. MCQ, cranial nerves, and the 12th nerve. Yes, one question sure from the cranial nerve. 12th nerve, it is located behind your, yes, you can say pyramid. Agree? Now, look here. This was our what? Medulla. So whenever damage to the medulla, sir, 9th, 10th, 11th, 12th are getting damage. Medullary damage means 9th, 10th, 11th, 12th damage. It is bulb-like dilated part. So you can remember this is nothing. This is the bulbar paralysis. Everyone getting the point? In case of the bulbar paralysis, which cranial nerves are getting damage? Yes, 9th, 10th, 11th, 12th nerves are getting damage. Can you see the medicine-Harrison integration? If the midline part of the medulla is getting damaged, this is the medial medullary syndrome. So in the medial medullary syndrome, which cranial nerve is getting damaged? Sir, 12th nerve, which is also known as the Dejerine syndrome medicine. But in case of the lateral medullary syndrome, sir, this lateral portion is damaged. Mainly the 10th nerve is damaged. So this is lateral medullary syndrome, also known as the Wallenberg syndrome. Yes, which artery is supplying this part? Sir, pica artery. This is the medicine, which is the branch of the vertebral artery. Lateral medullary syndrome, lateral portion is involved. Medial medullary syndrome, midline part is involved. Beautiful Harrison integration. Agree, beta? Now, come to the above. There is a one depression at the pons. Above this, there is a one pons. Yes, bridge-like structure. Yes, it is connecting the medulla with the our midbrain. Sir, it is our what? Pons. Fine. So here you will see one the very thick nerve, thickest nerve of the body, sir, trigeminal nerve, which is dividing into the fifth one, fifth two, fifth three, and also you will see the 6th, 7th, and 8th cranial nerve. What I want to tell you, 5th, 6th, 7th, 8th cranial nerve. So pons is related with the 5, 6, 7, 8 cranial nerve. Simple. Last 4, middle 4. Now about to it, you will observe, sir, there is our midbrain crus cerebri. Yes, you will observe there is our optic nerve. Sir, there is our optic nerve, which is crossing together. This is the crus cerebri, also you can say cerebral peduncle. So this portion is our, yes, interpeduncular fossa. You will see medial to the crus cerebri, there is a 3rd nerve, and from the back side, the 4th nerve. What I want to tell you, sir, here is our cranial nerve. 3rd, medial to the crus cerebri, and lateral to it, there is a 4th cranial nerve. So this small portion is the midbrain, which is related with the our, yes, 3rd and 4th cranial nerve. Now, inferior surface of the frontal lobe, you can see the 2nd, also the olfactory bulb, and then olfactory tract. Sir, these are our 1st and 2nd, which are related to the inferior surface of the frontal lobe. So, which cranial nerves are related here? 1st and our 2nd. Agree? So, you can remember 1st and 2nd, frontal lobe, 3rd and 4th, midbrain, 5, 6, 7, 8, pons, and then 9, 10, 11, 12, your medulla oblongata. So now, Pontine syndrome, Harrison, 5, 6, 7, 8 will get damaged. Yes, the Perinaut syndrome, the Weber syndrome, our Benedict syndrome, 3rd, 4th cranial nerves will be affected. Okay, so this is your Harrison integration. What you have to remember, sir, formula is 1, 2, 3, 4, then 5, 6, 7, 8. These 4 cranial nerves, and last is our, sir, 9, 10, 11, 12. So you can remember the 2, 2, 4, 4. First two frontal lobe, next two midbrain, next one pons, last one medulla. So brainstem is giving attachment to the all cranial nerve except first and second. These all cranial nerves are having the nuclei, but these are having no nuclei. So your formula is 2244, 2244. Okay. So this is the way how you can remember. Okay. Yes, but lateral medial medullary syndrome in detail classes I teach all the details, but it is a part of the medicine. So right now I'm not discussing. At the end, please recall after the session, I will tell you. Don't worry for that. Okay. Now we are turning the brainstem. Can you see the medulla oblongata, pons, and the midbrain? Okay, sir. So in this medulla oblongata, can you see behind the pons there is the one our rhomboid shaped depression. Sir, this is the floor of the fourth ventricle. Yes, there is a median sulcus and one line is present. This line is known as stria medullaris, MCQ. Above this stria medullaris pons, below to it medulla. Now one important thing, there is the triangles are located. Yes, the midline triangle, sir, this midline triangle is known as hypoglossal triangle and lateral triangle is known as our vagal triangle. Getting the point? Okay, sir. Now catch. Here is the our facial colliculus, sir. Here is the facial colliculus, which is related with the 6th nerve and the 7th nerve. And add the lateral part, sir. This is the our lateral part, which is the vestibulocochlear area. So here the 8th cranial nerve is located. What I want to tell you, this is the area where the 5 cranial nerve nuclei, 10, 12, 6, 7, 8 are located. In physiology, you had studied. This is the area where the heart rate, BP center are located. Yes, this is the area postrema, where blood-brain barrier absent. Below to it, you will see the chemotactic zone, pharma medicine. So many important area. So if there is a damage, there is a happy birthday, okay, death. That's why these structures are important. Now look above, sir, above to it midbrain, and you will see there is our elevation. 2 elevation, superior colliculi, 2 more elevation below, inferior colliculus. Getting the point? Yes. So these 4 structures combinedly known as the corpora quadrasemina. Okay. Can you see one axon is coming from the back side, sir? This is our 4th cranial nerve. Yes. The 4 important facts you have to remember. Dilwale dulhania le ठहरेंगे. This is the only cranial nerve which is dorsally attached. It is only cranial nerve which is showing the crossing decussation. It is the longest intracranial nerve. Yes, remember, longest cranial nerve, answer is the vagus. It is coming to the abdomen, but it is coming from the back. It is coming from the back side. No cranial nerve is here. Na? Only 4th cranial nerve axons are here. Remaining all are the elevation or nucleus. Na? They are coming from the back and going to the front. So these are longest cranial nerve. Yes, it is having the only superior oblique muscle fiber, SO4. All extraocular muscle are supplied 3rd cranial nerve, except, yes, you can remember the SO4 LR6. So it is having the least number of the axons. So it is smallest cranial nerve. MCQ, 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 MCQ. Agree beta, DDLJ. So just in place of the J, you have to remember the T. दिल वाले दुल्हनिया लेट ठहरेंगे, कहीं नहीं जाना है, घर जमाई बन जाना है. Okay, sir. Now above to this all, can you see there is our pineal gland. This is the 3rd eye of the Lord Shiva. When it is getting enlarged, there is the damage to the superior colliculus where the interstitial nucleus of the kahal is located. So if it is getting damaged, then there is the our downward gauge, which is also known as, yes, in medicine, this is the medicine part, na? Doll's eye sign. Yes, it is our perinode syndrome integration. Yes, definitely you will teach there, you will learn there. In the ophthalmology you will see, but it is important. This is the 3rd eye of the Lord Shiva. Yes, sir, it is the 3rd eye of the Lord Shiva because it is responsible for the synthesis of the melatonin hormone. Okay, yes, It is controlling circadian rhythm, biological clock activity. Yes, Sadhu, Tapasvi, Lord Shiva, this all can control their biological activity, heart rate, they can stop, suspended animation. Your forensic medicine, they can control the circadian rhythm, biological activity. That's why this is very important. This is the pineal gland, na? In our, yes, Dr. Strength, the eye of the Agamotto, that is also, you can see the pineal gland. So remember this one, this is very, very important. Now, this is your homework part. Okay. Yes, Dr. MTG sir, I was waiting for the Spider-Man, but here comes an awesome man. Thank you, beta. Thank you for such kind of very, very beautiful words. You all are Spider-Man. You are better than Spider-Man because Spider-Man is just one image in. Okay, there's a no true character. But doctors are the great, great, great superheroes who are saving the lives. You are the real Spider-Man. You are real Iron Man. You are real Superman. Okay. Yes, Spider-Man will come at the end, but till then, just enjoy the session. Okay. Yes. So this is your homework. I told you the cranial nerve, their nuclei, their attachment, and also the cranial nerve foramen I told you during the our passage, and function and the clinical. Function means physiology and damage means loss of physiology. That is your medicine part. So this is your homework. Yes, I already mentioned here, but okay. Now look here. Sir, good evening, sir. Our superhero from the skin, Dr. MHD sir is here. Sir, pranam, sir. How are you? Okay. Yes, yes. So yes, you can enjoy with our Dr. MHD sir also. But right now we are continuing, sir. Here, the spinal cord section. Spinal cord is narrow. Then it is dilating. Then it is dilating. Yes, it is dilating. It is dilating. Yes, it is dilating. It is dilating. What I want to focus for this upper part, sir. This upper part. Can you see? This is our midbrain, which is showing one substance which is little bit blackish, blackish, blackish. Yes, this is our what? This is the substance which is negro in appearance. That's why this is the substantia nigra. So can you tell me which is good? That one or this one? So it is blackish. Means it is more our dopamine. So it is normal and it is abnormal. So remember beta, गोरे रंग पे न इतना गुमान कर, गोरा रंग 2 दिन में ढल जाएगा. Yes, this is your Parkinson disease. Okay, and this is normal. So demand for this black color, because here one important cycle, the biochemistry integration, there is the our sir phenylalanine, which is converting into the tyrosine, and then tyrosine is converting to the dopa, and dopamine is making the dopamine. Dopamine and acetylcholine, proper balance. Acetylcholine is increasing the tone and the dopamine is decreasing the tone. So now physiology, increase in tone, hypertonia, spasticity, rigidity, decrease in tone, flexidity. So this substantia nigra is maintaining this all. One question sure shot from here, and art, biochem, physio, pharma, medicine, sure beta. Okay, fine. But in Parkinsonism, the dopamine is decreased, acetylcholine is increased. So there is the hypertonia. So there is the poverty of the movement, rigidity. Yes, mask-like face, pill rolling movement. That's why what you need, you have to increase the dopamine level, pharma, medicine, or decrease the acetylcholine. So how can you increase the dopamine level? Sir, dopamine agonist. Sir, dopamine precursor. Sir, dopamine facilitator. Sir, COMT inhibitor. Sir, dopamine decarboxylase inhibitor. Sir, MAOB inhibitor. So these are the drugs. Otherwise, what you can do, sir, we can, acetylcholine is increased, so decrease the acetylcholine level. So anticholinergic, sure short from this section, because I told you the anatomy, I told you the physiology, I told you the pharma medicine integration beta. Remember, this is your Parkinson. Son creates problem. Daughter never create problem. Any son, Parkinson or the Wilson or the Morrison, definitely it is going to ask in your recent exam. Yes, the biggest problem of the medical student, that is the Harrison, Davidson. So get ready for this question, but definitely you are going to look for this question pattern. Na? Okay. Now, what I want to tell you further, sir, after this we are reaching upside. So there is our brain, cerebral hemisphere. So there is the right and left cerebral hemisphere. You can see the supralateral surface, medial surface, inferior surface. So the supralateral surface is important. Focus here, beta. Sir, there is a central sulcus. broadband area, functional area. Just in front of it, there is the area number 4, which is the motor area. If it is getting damaged, hemiplegia, paralysis. In front of it, premotor area, yes, it is giving origin to the extrapyramidal tract. So damage here, that is the extrapyramidal symptom. I am telling you the structure, anatomy, function, physiology. And if there is a damage to the anatomy and the physiology, then there is the our medicine. Okay, now look here, sir, there is the area number 8, posterior part of the middle frontal gyrus. This is the frontal eye field area, which is resulting in the our conjugated saccadic movement. If there is a damage, then loss of conjugated saccadic movement, ophthalmology. Can you see the most developed area of the brain? Area number 9, 10, 11, 12. This is the prefrontal lobe. If there is a damage, prefrontal lobe syndrome. What is the prefrontal lobe syndrome? Sir, Anand bhai, Jindalash. There is one question. Yes, remember, if damage to this prefrontal lobe, the patient will go under the vegetative stage. So remember, this is the very, very important part. Also, this question had been asked many times. This is the area number 44 and 45. It is controlling the motor speech function. Yes, it is our Broca's area. It is the inferior frontal gyrus. Every point is your question. If there is a damage, then remember there is the our, yes, motor aphasia. You know the chota chhatri. Otherwise, you know the Lakshman from the Golmaal movie. Yes, he is saying, "Arey bhai, jaldi bol, kal subah panvel nikalna hai." Yes, that Lakshman, this chota chhatri, they are classical example of the motor aphasia, stammering. Okay, but this Ganilal, who was always forgetting the name Chota Chhatri, Tadpatri, Kaju Katri, always forgetting that is a nominal aphasia. So speech topic will be asked definitely. Now look here, beta. Try to understand in the temporal lobe. Can you see this is the area number 41, 42? Sure, one question from here. This is the primary auditory area. This is having the function of the listening. If there is a damage, hearing loss. Yes, this is related. This is related with the E. coli. Sir, this A is nothing. It is the auditory area. E for eighth cranial nerve. C for ENT integration. C for cochlear nucleus. O for olivary nucleus. L for, yes, lateral lemniscus. I for inferior colliculus. M for medial geniculate body. Physiology integration, medial geniculate body, and then auditory area. So this is the A, auditory area. Now around it, there is the area number 22. This is the secondary auditory area. It is helping in interpretation of the sound, analysis of the sound. If there is a damage, there is an auditory agnosia. The posterior part of this area number 22, this is the Wernicke's area. That is the our sensory speech area. If there is a damage, there is a sensory aphasia. Very important. One question from the speech physiology. And now in the occipital lobe, can you see there is the our, yes, calcarine sulcus, around which lunate sulcus. So this is the area number 17. Primary visual area. If there is a damage, blindness, ophthalmology. And around it, area number 18 and 19, secondary visual area. If there is a damage, visual agnosia. Means remember, the patient cannot correlate with the past memory. And then last, area number 3, 1, 2, sensory area. If there is damage, loss of sensation. And your Nimhan's question, area number 5 and 7, superior parietal lobule, this is responsible for the vibration and stereognosis sensation. So loss of the vibration sensation, that is the palanesthesia due to damage at this area. Okay, now what you have to remember, this homunculus presentation. So can you see the part of the body which is more active, they are larger. चमड़े की जुबान बहुत चलती है, हैंड में मूवमेंट बहुत ज्यादा होता है, फुट में बहुत ज्यादा होता है. So they are having the large presentation. Can you observe the supralateral surface which is supplied by the middle cerebral artery? Yes, face and the upper limb and the trunk. So whenever medicine, stroke, TIA, damage to the middle cerebral artery, paralysis of the face, upper trunk paralysis. Simple medicine. Can you observe the medial surface of the brain? Yes, sir. The medial surface of the brain. Try to understand. Yes, visual agnosia, occipital lobe. Yes, Nimra, occipital lobe, beta. Getting the point? Yes. This is supplied by which artery? Anterocerebral artery. Here, your perineum area is coming. So if there is a damage to this anterocerebral artery, the perineum has gone, lower limb paralysis. And the inferior surface of the brain, sir, inferior surface of the brain, this is supplied by posterior cerebral artery. So remember, for your medicine, for your radiology, transient ischemic attack and stroke topic. Agree, beta? So now this is the medial surface of the brain. How you will identify? You can identify with the corpus callosum, septum processus, and fornix. Sir, around the central sulcus, this is the paracentral lobule. I taught you this is the FMGE 2023 question. P for paracentral lobule. It is controlling the perineum area, and at the perineum, means genital area between the two thigh, bowel, bladder and genital area are there. So there is a damage to the bowel, so defecation abnormality. Yes, patient will do urination on the bed, patient will show the erectile dysfunction. So all the areas at one side and this paracentral lobule is another side, very important. Agree beta? Now look for this our blood supply of the brain. Circle of Willis, another very important topic. One question from here, you can observe, sir, there is a common carotid artery which is dividing into the internal carotid artery, and here is our vertebral artery. Vertebral artery is meeting with the basal artery, and now these are making the circle of Willis. Yes, circle of Willis at the base of the brain. So I'm going to draw the diagrammatic presentation. Listen carefully. Look here, sir, there are the two vertebral artery. These two vertebral arteries are uniting together and making the, yes, basilar artery. Now this basilar artery is dividing and making the what, sir? Posterior cerebral artery. Yes, it is our basilar artery, sir. It is the vertebral artery. So this is the vertebro-basilar system. MCQ, PCA is the branch of the basilar artery. Now, do you remember the internal carotid artery? Yes, sir. Internal carotid artery was there. This internal carotid artery is giving the anterior cerebral artery, which is anastomosing together and making the anterior communicating artery. And it is anastomosing with the posterior side, posterior communicating artery. Getting the point? So now you can observe there is a one circular anastomosis is formed. Yes, sir. There is a one circular anastomosis formed. This is the circle of Willis. Getting the point? Yes, thank you, Hemant. Thank you. Hemant is saying you are rocking. Yes, beta, this is the bullet train anatomy revision. Whatever we studied entire year, your same content I'm revising with the same enthusiasm, with the same passion, with the same teaching, so that you can crack the exam. And definitely, I trust, I believe you will crack the exam. मिल के मेहनत करते हैं, जरूर रिजल्ट लाएंगे. सर, लेबलिंग फॉर ऑल ऑफ यू, रिपीटिंग फॉर ऑल ऑफ यू. सर, दिस द इंटरनल कैरोटिड आर्टरी. सर, दिस इज एंटीरियर cerebral artery. Sir, here is the anterior communicating artery. Sir, this is posterior communicating artery, and there is our posterior cerebral artery. So, 1, giving the number for all of you, 1, 2, 3, 4, 5. These are the 5 arteries making the circle of Willis. Cow was important during the school time. Yes, sir. So, ऐसे over the cow, ये क्वेश्चन आता था और उसमें कहा जाता था क्या? यस, बच्चे ने ऐसे में लिख दिया, गाय हमारी माता है, हमको कुछ नहीं आता है. टीचर भी वैसा ही था, नंबर दिया, बैल तुम्हारा बाप है, नंबर देना पाप है. यस, cow was important during the school time. Now again it is important. Yes, these are the 5 component. Which is not the component? Remember the middle cerebral artery, it is outside. Now I'm telling you the branches of the internal carotid artery. Sir, this is giving the one branch towards the eye, ophthalmic artery. This is the anterior communicating artery. Yes, 1, 2, 3. Sir, this is the posterior communicating artery. It is also the branch. And another is our 4th branch. I am writing here, anterior choroidal artery. So these are the 5 branches. Again, what are the 5 branches? Sir, this is the internal carotid artery, anterior cerebral artery. Sir, this is the anterior cerebral artery. Then next is ophthalmic artery, middle cerebral artery, anterior choroidal artery, and posterior communicating artery. Yes, it will help you in medicine and the radiology. Okay, sir. Now we are coming to, yes, now get ready for the kacha badam. Get ready. Don't go here and there. Yes, we are coming for the our, yes, last part of the anatomy, kacha badam. So stay tuned. So we are going to enjoy this part. Sir, after this gray matter, now we are going to look for the our next part. Yes, sir. Try to understand. Yes. शुक्रिया अदिति, शुक्रिया डॉक्टर इस्माइल, यस मेडिस्कोप, थैंक यू बेटा, थैंक यू. ओके, जनरेशन चेंज हो रही है, टीचर चेंज हो रहा है, स्टूडेंट चेंज हो रहा है, पढ़ने का तरीका चेंज हो रहा है, एनाटॉमी चेंज हो रहा है. ओके, यस, 2 रुपए की पेप्सी, एनाटॉमी सेक्सी. सो रिमेंबर, नाउ कम टू द आवर ग्रे मैटर, व्हाइट मैटर एंड द आवर बेसल न्यूक्लियाई पार्ट. व्हाट यू हैव टू सी? Sir, gray matter, outer portion, white matter, inner side, and there is the word base of the brain, basal nuclei. White matter, yes. Who are the real white matter? Sir, ACP Rathore. Your mnemonic is the ACP. A for association fiber, C for commissural fiber, P for projection fiber. What you have to remember? Association, jo jode. Yes, the fibers which are communicating the nearby structure, association fiber. While the white matter which are मेकिंग कमीशन लाइक स्ट्रक्चर, कमीशन लाइक स्ट्रक्चर। कमीशन में क्या होता है, एक से पैसे लो, दूसरे को पैसे दे दो। यस, कमीशनल फाइबर, दे आर कनेक्टिंग द टू डिफरेंट सेरेब्रल हेमिस्फीयर। रिमेंबर एमसीक्यू, द लार्जेस्ट कमीशनल फाइबर कॉर्पस कैलोजम, लार्जेस्ट बैंड ऑफ द व्हाइट मैटर, यस कॉर्पस कैलोजम। C for corpus callosum, C for commissural fiber, and all the tract they are projecting from inside to the outside or from outside to the inside, so they are the projection fiber. MCQ आता है बेटा, any tract all are projection fiber. Agree? Now try to understand further. Yes, thank you beta, thank you Subhash. Okay, now what I want to tell you, corpus callosum, you have to remember the parts of the corpus callosum, sir. It is having the rostrum, turn part is the genome, then you can see the trunk, and this is your splenium, the narrow part is the isthmus. So this is your, yes, corpus callosum. Remember, this entire medial portion is supplied by anterocerebral artery, the paracentral lobule, the corpus callosum, even the fornix. All medial surface is supplied by the anterocerebral artery. So these points you have to remember. Also, now we are looking who is the real white matter, rowdy Rathor of the brain. So remember the fornix, because it is the classical example of the ACP, all kind of the white matter. How, sir? See here, in our brain, one is small seahorse-like structure is there, hippocampus. This hippocampus is connected with the mammillary body with this fornix. So remember, fornix is carrying the impulse from hippocampus to the mammillary body. Yes, MCQ for the hippocampus. This hippocampus is responsible for the conversion of short-term memory to the long-term memory. Yes, our Gajni uncle, he got injury by the, our Sanjay Singhani uncle got injury by the Gajni. So he forgotten the Kalpana ante. Our Hollywood, Bollywood, Tollywood, all are coming from the anatomy. Hippocampus is the site where the short-term memory is converted into the long-term memory. So if there is a damage, then person becoming short-term memory loss. Very important. Now look up for the further thing. Sir, this fornix is participating in the hippocampus pathway. It is having the posterior column, then body, and then entry column, and carrying the impulse to the mammillary body. Yes, it is the part of the Papich circuit which you study in the your physiology. Can you see there is one almond-like structure, amygdala. What I want to tell you, at the base of the brain, the collection of the gray matter, basal nuclei. Yes, how you can remember this basal nuclei? ACC, cement, SS, stainless steel. If you want to make strong the base, you have to use the ACC cement and stainless steel. Remember, जब कोई आदमी मर रहा है तो एसीसी सीमेंट के 2 चम्मच डाल दो, क्योंकि इस सीमेंट में जान है. सो व्हाट आर द डिफरेंट स्ट्रक्चर एट द बेसल न्यूक्लियाई? ए फॉर एमाग्डेला, सी फॉर कॉर्पस स्ट्राटम, सी फॉर क्लोस्ट्रम, एस फॉर सस्टेंशन nigra, एस फॉर सबथैलेमिक न्यूक्लियस. Yes sir, if there is a damage to the amygdala, it controls the food and sex activity. If there is a damage, then there is the excessive food and excessive sex tendency, which is known as Kluver-Bucy syndrome. बेटा ये नीट पीजी में आ चुका है. Okay, this amygdala is important, it had been asked. So excessive food and excessive sex tendency here. So over this amygdala, badam like structure, there is the our not only Hollywood, Bollywood, Tollywood, but even the TikTok is depending on the anatomy. So अर्ज किया है over the amygdala. Remember this one, पायर तोड़ा हाथेर बाला थाके जोगी सिटी गोल्डन चैन दिए जॉबन ताते शोमन शोमन दादा काचा बादाम, ओ बादाम बादाम दादा काचा बादाम kacha badam. Don't forget this amygdala, don't forget this almond like structure. Hope you all will remember this one just for your fun, just for your consolidation of the memory. Now we are coming for our corpus stratum. Sir, it is having the 2 part, caudate nucleus and the lentiform nucleus. So when you are looking for the our caudate nucleus, you will see there is one large long part. Sir, it is having the head, then body and long tail, and here is our amygdala. Getting the point? Okay. Yes. Dr. Ismail is saying, oh Dadu. Okay. Yes. Enjoying the things. Okay. Now try to understand further. Sir, there is our thalamus located inside. Now, lentiform nucleus, can you see? There is our, yes, globus pallidus medially and putamen. Spider-Man is Spider-Man. तूने चुराया मेरे दिल का चैन. So remember, yes, this is our puta man. Superheroes, they are outer side. So there was the one question, the puta man is not medially, it is laterally. Remember, in case of the hypertension, there is the bleeding at the our putamen area. So this putamen is important. It is a part of the lentiform nucleus. You know, there is a hepatolenticular degeneration, which is nothing, sir. It is the our Wilson's disease, sir. It is our Wilson's disease. Yes, 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 yes. Thank you, beta. Thank you, everyone. So my thanks to mom also. Priyanka is saying that my mom is hearing you and even she is enjoying. Yes, beta. I'm really blessed with the so nice students, so nice teachers of the Cerebellum Academy. Okay, yes, I'm blessed with the family members supporting to me also. My humble thanks and pranam to all the family members also. So now, sir, this is the puta man. Yes, you have to remember for your forensic, for your medicine part. Now, try to understand substantia nigra. If there is a damage, there is a Parkinson disease, and this is the lentiform nucleus. It is getting damaged in the hepatolentiform degeneration. Yes, this is nothing. This is the Wilson's disease, ATP B7 gene mutation, chromosome number 13. So Wilson, son create problem. Parkinson, son create problem. Daughter never create problem. One question from the son, sure it will be asked. Now, subthalamic nucleus, if there is a damage, then there is our situation of the hemibalismus. दिस इज द एमसीक्यू. इतना ही पढ़ाना है बेटा, बार बार पढ़ाना. बहुत बढ़िया अदिति. यस, कमेंट करते जाओ बेटा जितने भी इंपॉर्टेंट चीजें. वेरी नाइस, वेरी नाइस. नाउ लुक, the last part of the neuroanatomy, you are looking the coronal section. Yes, sir. You're cutting the brain at this part. You are looking the coronal section. So at this coronal section, gray matter, white matter, the gray matter are connected together with the help of the corpus callosum. Just below the corpus callosum, say the septum pallidum, and below the septum pallidum, the F. Do you remember our mnemonic? CSF. Corpus callosum, septum pallidum, and fornix. Septum pallidum is separating the two lateral ventricles. Yes, and the floor of the lateral ventricle is formed by the caudate nucleus. Yes, can you see the thin cavity at the midline? Sir, this is our third ventricle. Third ventricle is the cavity in between the our two thalamus. So right and left side here is our thalamic area. Yes, can you see this portion of the our cerebral cortex which is going inside? It is our sleeping part, insula, hidden lobe of the brain, fifth lobe of the brain. Okay. Also, you can observe, sir, this is our mid brain, and then pons is here. Can you see one black structure within the midbrain? Sir, it is the substance which is negro. Sir, it is substantia nigra. Getting the point? Okay. Yes, better. Here, the body of the corpus callosum will lie, na? Okay. Okay, sir. Now, just to correlate with the radiology, same thing. Can you see, sir, there is the gray matter, sir, there is the white matter, and this is the corpus callosum. The thin portion is the septum pallidum, and this black color structure is showing the fornix. Can you observe, sir, the septum pallidum is separating the lateral ventricle, correct, sir? And this is our third ventricle. On each side of the third ventricle, you can say, sir, this zone will be our thalamus. Yes, you can see the midbrain, the pons, and then medulla. More structures we are going to observe in this image. More beautiful diagram. Can you see? This is a transverse section. So you can observe the gray matter, white matter. So definitely the white matter is connected together with the help of the corpus callosum. The partition is the our septum pallidum, and this white structure small is the fornix. Our formula is fit everywhere. CSF. Yes, sir. Now the septum pallidum is separating the lateral ventricle, and the floor of the lateral ventricle is formed by the head of the caudate nucleus. Yes, the narrow slit-like structure is nothing, sir. It is our third ventricle. On each side of the third ventricle, sir, definitely there is the our thalamus. Now, outside of this all area, can you see one boomerang-shaped structure which had been asked in FMG January 2023. This is the inside capsule, the passage for the your tract internal capsule. It is having the entry limb, genu, posterior limb, sir. Entry limb, genu, posterior limb, and here you can see the lens-shaped mass, lentiform nucleus. Okay, so the part which is behind the our lentiform nucleus, sir, it is retrolentiform part. Below it, there is the sublentiform part. Can you observe the medially, sir? There is our globus pallidus, and laterally, do you remember? Putamen, Putamen, तूने चुराया मेरे दिल का चैन. Putamen is lateral most. Superheroes, they are on the lateral side. Now you have to remember there is our external capsule. Then there is the saucer shaped structure claustrum, and then gray matter insula. So your mnemonic is yes E, then C, and the hidden lobe I. Just like the MCI, Medical Council of India, this is the Engineering Council of India. होता नहीं है, हम लोग बना रहे हैं external capsule, claustrum and insula. So now correlate these things with the your radiology. Yes. Can you see the same kind of the appearance is here? You will observe the right and left, they will attach with the corpus callosum. There will be the thin septum pellucidum, and this black structure is the fornix. Yes, you can see the lateral ventricle on each side, and yes, you can see the floor is formed by the our caudate nucleus. Better you will see in the radiology. Just I'm integrating. Can you see the midline part, sir? There will be the third ventricle, and on its side the thalamus will lie. And here one boomerang shaped portion will appear, that is the internal capsule, and its concavity is filled with the lens shaped area, lentiform nucleus. Medial part is the globus pallidus, lateral part is the putamen, and definitely this is your which part? Yes, this is our insula. Okay, getting the point, beta? Okay, sir. Now we are going to come for the our abdomen. The majority of the part from the FMG exams we had covered. Now the abdomen, pelvis, mainly these are the part of the surgery and the obs-gynae. But whatever the topics which are related with the anatomy, we are going to discuss abdomen. Remember बेटा, उड़ा देती है नींद कुछ जिम्मेदारियां घर की, रात में जागने वाला हर शख्स आशिक नहीं होता. बिल्कुल सही बेटा. हम भी रात को जागते हैं 2-2 बजे तक, 4 बजे तक. आप भी रात को जागते हैं क्योंकि कुछ जिम्मेदारियां हैं, माता पिता के सपने हैं, कुछ हमें करके दिखाना है, वो जज्बा है. तो बुलेट ट्रेन एनाटॉमी के साथ अब हम आगे बढ़ते हैं अपने इस एब्डोमेन पोर्शन में. कैन यू सी द क्वेश्चन? सर, अ पेशेंट हैज हिस्ट्री ऑफ द स्प्लेनिक ट्रॉमा, सो दिस इज द सर्जरी क्वेश्चन. कैन यू सी? अगर आपको नहीं भी पता ये क्या चीज है, तब भी आप बना सकते हो. सर, दिस इज द स्प्लीन, हियर इज द वर्टिब्रा, दिस इज द लीवर. So can you see abdominal aorta? It will give the splenic artery which is going to the spleen. तो आपको पता नहीं कि ये splenorenal ligament है. You are not aware the splenic artery is here and there, but even you can mark this D answer. Okay, so this is your D which is given in the A. Option is A, yes, but D is your answer. वो आपसे क्वेश्चन गलत करवाने के लिए किसी भी हद तक जा सकते हैं. Okay, now look. This question will be asked sure. This is the your trans tubercular plane which is located at the last lumbar vertebra. So I'm going to tell you, yes, there is a one question, subcostal plane. Sir, it is located at which vertebral level? I will teach you. This is located at the L3 level. They ask about the vertebral level. Yes, this is the umbilicus. Umbilicus is located at the L3, L4 where you perform the lumbar puncture. Now, can you observe this one? Sir, the first transverse line is passing through the first lumbar vertebra L1. Transpyloric plane. First plane, first lumbar vertebra. The last plane, it is passing through the last lumbar vertebra. Okay, but one more is there, so it is passing through the middle. So you can remember, sir, 1, 3, 5. Simple. Yes, this first line is passing through the lower border of the L1. The last one is passing through the upper border, and at the junction of L3, L4 umbilicus. So the subcostal plane is not passing through the L3, L4, it is passing through the upper border of the L3. One question from this vertebral level. Agree, beta? Now try to catch this question. Yes, I will teach you the diaphragm and their opening. Sir, there is the our mnemonic. What? Voice of anatomy. Vena cava opening, esophageal opening, anatomical opening. Okay, aortic opening. Through the aortic opening, I will teach you the ATA. Yes, aorta, thoracic duct and azygous vein, they are passing. Okay, so remember here the aortic opening was marked, so thoracic duct is your answer. Now can you see the question? These are the your surgery topic. Okay, so anatomical part I will teach you. A patient presents with the hernia. Yes, content is the spermatic cord passing through the external oblique muscle. External oblique muscle means superficial inguinal ring. Superficial inguinal ring means it is direct inguinal hernia. Now, neurovascular bundle, I taught you at the beginning. Sir, it is passing in between the intraoblique and transverse abdominis. Okay, so anterior abdominal wall you have to study. FMG 2020 deep inguinal ring is found in. So, external oblique, superficial, deep inguinal ring, fascia transversalis. Agree, beta? So, we are going to look this topic. Surgery part you will see in the surgery. But anterior abdominal wall, it will not be taught in, it is the part of the anatomy. Anterior abdominal wall, yes. Abdomen is having the anterior abdominal wall, posterior abdominal wall. Yes, sir. Anterior and posterior abdominal wall. In the anterior abdominal wall, there is a linea alba and there is the linea semilunaris. There is a rectus abdominis muscle which is making the six packs ab. But remember, it is difficult to maintain the six pack ab, but it is more difficult to maintain the family pack. Maintain the family pack. Okay, sir, umbilicus MCQ L3 L4. NEET PG question T10 dermatome. Your embryology question urethral fistula, fecal fistula had been asked. Okay, sir. So when you will dissect, you will see the external oblique is running downward, forward, medially. When you are cutting, then you can see internal oblique, and then you will see the your transversus abdominis muscle, the muscle which is running straight in the abdomen, rectus abdominis. Okay, sir. Now look what are the different layers. Yes, try to understand further. You are looking the body from the lateral side. So what are the layer, sir? Skin, then superficial fascia, then deep fascia is absent. Then can you see external oblique, then internal oblique, then transverse abdominis. MCQ, the neurovascular bundle in between internal oblique and transverse abdominis. Then there is our fascia transversalis. Peritoneum is inside. Outside it, there is the extra peritoneal fat. There are the two types of the viscera which are inside the peritoneum, intraperitoneal organ, and the viscera which are behind the peritoneum, retroperitoneal organ. Okay, sir. Now, lower end of the external oblique, it is making the flat tendon, external oblique aponeurosis, which is showing the one groove. Sir, this is the our, yes, inguinal ligament. Lower free part of the external oblique muscle is the inguinal ligament, and one canal is there, that is the inguinal canal. So, in your surgery, the boundaries of the inguinal canal will be taught. At the anatomy, I am just making simple. 8 layer, again, skin, superficial fascia, then external oblique aponeurosis, then internal oblique, then transverse abdominis, then fascia transversalis, then extraperitoneal fat, and then peritoneum. So you can see the our inguinal canal where the spermatic cord and ilioinguinal nerves are content. MCQ, content to content. Now entry wall is formed by जो दिख रहा है वो बोलो skin, superficial fascia and external oblique aponeurosis. Now the posterior wall is formed by, can you see, fascia transversalis, extraperitoneal fat and the peritoneum. Can you see the roof is formed by, sir, combined joint tendon, conjoint tendon, which is formed by the internal oblique plus transversus abdominis on the medial side. Roof is formed by internal oblique as well as your, yes, you can say the transversus abdominis muscle, also the conjoint tendon, while the floor is formed by only the inguinal ligament upper grooved part. So this is the bullet train anatomy. Yes, the rapid revision, all the 4-day content we are covering in the our 5-6 hours. Okay, so these are the points which you have to remember. Why you have to remember this entry abdominal wall? Because if you are not making proper incision, you are not suturing properly, there is a chance of the incisional hernia. That's why. Now, look here, beta. Yes, crystal clear. Thank you, Nimra. Thank you for the crystal clear word. Now, see the GIT. GIT is having the foregut, yellow color, midgut, gray color, hindgut, pink color. Foregut is supplied by the celiac trunk. MCQ, celiac trunk, artery of the foregut. Focus, focus, focus. Vertebral level T12 L1. 3 main branches: left gastric artery, splenic artery, and common hepatic artery. Okay, sir. Now look, the midgut artery. Sir, midgut artery, MCQ, superior mesenteric artery, MCQ, vertebral level L1, 6 branches. Yes, duodenal branch, jejunal branch, ileal branch. It is supplying the ileocecal part, ileocolic artery, and there is the our, yes, ascending part, ascending aorta. So this is the right colic artery, and this is the our middle colic artery, middle colon. Yes, my camera battery is getting down. Just give me a few seconds. But सबकी बैटरी डाउन हो जाएगी लेकिन हमारी बैटरी डाउन नहीं होगी. Okay, so just give me a few seconds. Just give me a few seconds for the camera battery. I hope it is working. Just give me a few seconds. I'm asking for the technical person. Otherwise, this camera battery, just sorry for this problem. I'm really sorry, but just give me a few seconds.
आप जिस व्यक्ति को कॉल कर
हाँ कृष्णा जी, जल्दी आओ तो, ये बैटरी को देखो तो, ये कैमरे का बैटरी बंद हो रहा है, जल्दी आओ तो। I'm really sorry for this little disturbance, but okay. Hope everything is fine. Technical team will come soon and they will solve the problem. Okay. Yes, let's continue. So there is our hindgut artery. Sir, this is the hindgut. The artery is the inferior mesenteric artery and the vertebral level is L3. So it is supplying the hindgut. There is the left part of the colon. So this is the left colic artery. Sir, this is sigmoid colon. So sigmoidal artery, and this is the upper part of the rectum, superior rectal artery. So you can remember the formula 3, 6, 3. 3 branches from the celiac trunk, 6 branches from the our superior mesenteric artery, and 3 branches from the inferior mesenteric artery. Agree, beta? Getting the point, everyone? Okay. Okay. So now try to understand the few important visceral relation. Sir, this is the our stomach. Then it is continuous the duodenum, D1, D2, D3, D4, 4 parts of the duodenum. You can easily remember that this D1 is located at the L1 level, D2 is located at the L2, and D3 at the L3 level. D3 at the L3 level. Okay, getting the point? Now look here, there is our few question. First part of the duodenum 2 inches, second part 3 inches, third part 4 inches, and fourth part 1 inch. So total length of the duodenum is the 10 inches. 10 inches. कैमरे का देखना, कैमरे का है ना, कैमरे का मैं ये लगाया हूँ, तो ये सही लगा कि नहीं, इसको देखो बेटा, ये वाला मैं लगाया हूँ है ना, चार्ज हो रहा है कि नहीं उस चीज को देखो है ना, ये ऑडियो नहीं, कैमरे को देखो। यहाँ पर ना लाइट जलता है, इधर लाइट जलता है, वो लाइट जल रहा है कि नहीं जल रहा है नहीं पता, मेरे समझ में नहीं आ रहा है ना। हटा लो इसको हटा लो, देखो डिस्टर्ब नहीं करना। लाइट जल रहा है ना, हो रहा है चार्ज? हाँ छोड़ दो फिर, थैंक यू थैंक यू। यहीं पे रहना ना, कुछ दिक्कत आएगा तो पूछूंगा। Okay, so thank you everyone. What I want to tell you, yes, these are our different vertebral level. The tail of the pancreas at the spleen and head of the pancreas is located within the C loop of the duodenum. So you can easily say the foramen of Winslow is located at the T12 vertebral level. Okay, beta. Now look few more point. Remember, the splenic artery is running along the upper border of the pancreas. So Harrison question, splenic artery aneurysm is seen in which case? Answer is the acute pancreatitis. Anatomy will solve your question. Also remember beta that splenic vein plus superior mesenteric vein is equal to portal vein. It is formed at which level? Behind the neck of the pancreas, at the level of L2. At the level of L2. Getting the point? Okay. Agree everyone? So these are the portal vein formation. Yes, Portal vein is dividing into the right division and the left division. Okay, yes, I adjusted Tanuj. Okay, so this is the our portal vein. Now try to understand further. Whenever in microparasitology you are studying amoebic liver disease or the hepatocellular carcinoma, the infection are coming and they will show streamline phenomena and they will cause more common chance of the infection to the right lobe. These are the your integration. Now look this question, Pringle's maneuver. In surgery you will see in front of the stomach greater sac, behind the stomach lesser sac. So you are inserting the finger from greater sac to the lesser sac. Sir, this is nothing. This is the our foramen of Winslow. What are the boundaries of this foramen of Winslow? This is the Pringle's maneuver. Sir, above is the liver. Below you can see stomach is continuing as the first part of the duodenum. Yes. And anteriorly, the free margin of the laser omentum, which is having the vein, artery, and the duct. You're compressing this vein, artery, and duct. And posteriorly, there is the T12 vertebra. So in anatomy, you will learn, sir, our epiploic foramen of Winslow. The superior relation is liver chordate process. Sir, inferior relation is first part of the duodenum. Sir, anterior relation is the vein, artery, and the duct within the free margin of laser omentum. And the posterior margin is formed by Indian Standard Time, IST. I for inferior vena cava, S for suprarenal gland, T for T12 vertebra. Okay, so these are the our foramen of Winslow mnemonic. Okay, now look here, another artery, the abdominal aorta, the famous Bahubali and Devsena scene. It is coming from the our, yes, this aorta part. So he is the Bahubali. How can you see? ये बाहुबली की आंखें, ये नाक है, ये मुंह है, ये कान है, ये बाहुबली का चेहरा है, ये अपर लिम्ब है, ये बॉडी है, ये अम्बिलिकस है, ये निप्पल है और ये उसका लोअर लिम्ब है. अगर आप इसको धनुष देना चाहो, yes, you can give the archery. So it is just like the Bahubali uncle. So these are the branches of the abdominal aorta. So we are going to see what are the different branches. This is the your quick revision flow chart. Abdominal aorta is giving the ventral branches. Sir, celiac trunk, sir, superior mesenteric artery, sir, inferior mesenteric artery, sir, celiac trunk, superior mesenteric, inferior mesenteric, T12 L1, and here is the L3. These are coming front. Lateral branches, can you see 1, 2, 3, and 4? These are the lateral branches. The mnemonic is IMRT, IMRT. Yes. I for inferior phrenic, M for middle suprarenal, R for renal, and T for testicular or gonadal or ovarian artery. Sir, terminal branches, two common iliac artery, add the L4, L5, they are dividing. And dorsal branch, you can forget it. That is the median sacral artery. Leave that. But these are important point. Okay. Now look for the branches of the internal iliac artery. I will tell you only focus for this posterior division. Internal iliac artery, sir, the abdominal aorta is coming. It is dividing into the your common iliac, then internal iliac, external iliac, internal iliac, external iliac. External iliac was making the femoral artery. We are talking about this internal iliac. Sir, internal iliac artery, anterior division, posterior division. The branches from the posterior division, you can remember, I love salmon boy. Okay, one student was saying, I love Sunny. Anyhow, you can remember, jang और मोहब्बत में सब जाया जाए. So remember beta, I for iliolumbar. Yes, this is the posterior division. So it is giving the branch on the posterior side. L for lateral sacral and S for superior gluteal artery. Remaining any other artery, कोई भी बच गया तो बेटा सबको बोल देना anterior division. Yes, anterior division is supplying the pelvic viscera. What are the pelvic viscera? The urinary bladder and urethra. These are supplied by superior bladder artery, inferior bladder artery. Now there is a uterus and vagina. So you will say uterine artery, obs gynae, important. So yes, it is coming from the anterior division. Vaginal artery, it is coming from the our anterior division. And now posteriorly, the superior rectal artery, it was branched from the inferior mesenteric artery. But this middle rectal artery, then our inferior rectal artery, which is the branch from the internal pudendal, and this is the our, yes, you can remember the, yes, superior rectal is coming from the inferior mesenteric, but middle rectal is direct branch from the anterior division, and the inferior rectal artery, it is indirect branch from the anterior division. So these are the points which you have to remember. एक artery, एक muscle, एक nerve, एक bone. This is the usual pattern in an exam. Agree beta? Now sir, we are looking for this our pelvis and perineum. Yes, remember, you are much stronger than you think you are. Much stronger than. यस ट्रस्ट मी। रिमेंबर बेटा, मानव जब जोर लगाता है पत्थर पानी बन जाता है। यह देख गगन मुझ में लय है, यह देख पवन मुझ में लय है, मुझ में विलीन झनकार सकल, लय है मुझ में संसार सकल, अमृत्व डोलता है मुझ में, संघार झूलता है मुझ में, उदयाचल मेरा दीप्त भाल भूमंडल वक्षस्थ विशाल, मुझ परिधि बंद को घेरे हैं, मैनाक मेरु पग मेरे हैं, देखते जो ग्रह नक्षत्र निकल सब है मेरे मुख के अंदर, शतकोटि सूर्य शतकोटि चंद्र शतकोटि सरित सर सिंधु मद, भूलोक अतल पाताल देख गत और अनागत काल देख, यह देख जगत का आदिशन, यह देख महाभारत कारण, लाशों से पटी हुई भू है, पहचान कहां इसमें तू है, मानव जब जोर लगाता है पत्थर पानी बन जाता है। You can do anything in your life. So now we are entering in the part of the pelvis and the perineum portion. Okay. Yes. So now very few questions from the perineum and the pelvis, because majority are shifting to your obsgany part, but the perineum and the boundary I'm going to tell you. So try to understand. Question: road traffic accident, yes, suffered from the injury to the bulbar urethra. So I'm going to teach you this bulbar urethra part. Yes, 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 you all are perfect. Yes, Ajay, you are the person who got this line correctly. This is the Rashmi Rathi from the famous part. Our, yes, रश्मि रथी रामधारी सिंह दिनकर जी की ये लाइनें हैं। ओके, तो चलो बेटा हम यहाँ पर इन चीजों को समझते हैं। सर, देयर इज अवर पर्सन सफर्ड फ्रॉम द बल्बर इंजुरी, लोकेशन ऑफ द कलेक्शन ऑफ यूरिन ड्यू टू द इंजुरी। बेटा बल्बर इंजुरी जब होती है तो यूरिन आपका कलेक्ट होता है कहां पर? सर, दिस इज द अवर सुपरफिशियल पेरिनियल पाउच व्हिच इज नॉट गिवन, सो यू हैव टू ऑप्ट एंट्री एब्डोमिनल वॉल। व्हाई? आई विल टेल यू। व्हाट इज द पेरिनियम? एरिया बिटवीन टू थाई, in the male genital opening and the anal canal, but in female three openings. There is a urethra opening, vaginal opening and the anal canal. Now we are dissecting. So when you will dissect, the boundaries will be seen. What I want to tell you, beta, just see here, three-dimensional orientation. Yes, see here, there is the our perineum area. Sir, this is the pelvis. Lithotomy position. Sir, this is the lithotomy position. So this is the perineum. Anteriorly pubic symphysis, laterally ischial tuberosity, posteriorly sacrum and the coccyx. Okay, sir. So the same diagram I am going to tell you. Sir, this is our perineum. Anteriorly, sir, this is the pubic symphysis. Laterally, our ischial tuberosity. Posteriorly, sacrum and the coccyx. So anterolateral is formed by the ischiopubic rami and the posterolateral part is formed by the sacrotuberous ligament. Okay, sir. Now one imaginary line is passing from the ischial tuberosity. So it is dividing into the anterior triangle and the posterior triangle part. Yes, sir. Because anteriorly urethra and vagina, so this is known as urogenital triangle. And because on the posterior side the anal canal is there, so anal triangle. Yes, and centrally there is the location of the perineal body. Remember, this is the central tendon of the perineum. Never damage this central tendon because 10 muscles are getting insertion here. Yes, if it is getting damaged in the episiotomy, yes, there is a prolapse of the uterus, prolapse of the vagina, prolapse of the rectum. That's why. Okay, sir. So now can you see at the foreign, the person, they are looking here and there, the foot over the manhole and it is hitting the perineum and happy birthday. बेटा ये फॉरेन में होता है, ये इंडिया में नहीं होता, क्योंकि इंडिया में गटर नहीं होते, इंडिया में नालियां होती है, लोग नालियों में मिलेंगे. ओके, फाइन. सो दिस इज our perineum injury. We are going to look for this our portion. So when we are observing the perineum, can you see? Sir, this is the bladder, here is the urethra which is running in the penis. Sir, this is the penis, scrotum and the perineum. Now look, this is the perineal body. Perfect, sir. There is the perineal membrane. Okay, sir. So the urethra is having the part within the prostate gland, prostatic urethra, within the perineal membrane, membranous urethra, bulb-like dilated part, bulbar urethra, and within the penis, sir, penile urethra. Okay, sir. Now just one little concept. Whenever perineal injury, most common site is the bulbar urethra. So urine is coming. It is accumulating into this space. This space below the perineal membrane is known as superficial perineal pouch. Below this perineal membrane, superficial perineal pouch. Above this perineal membrane, deep perineal pouch. So urine is getting collected in the superficial perineal pouch, scrotum, penis, also in the anterior abdominal wall. This is the MCQ. While if there is a rupture of the your membranous urethra, urine is accumulating above the perineal membrane. So this is resulting in no swelling at this area. So this is the concept. Also, you can remember the fascia of the penis, Buck's fascia, the fascia of the your scrotum, Dartos fascia, and fascia of the perineum, Colles fascia. Your beautiful mnemonic is the BD Chaurus. Yeah, B for Buck's fascia, D for Dartos muscle, C for Colles fascia, from the front to the back side. Okay, sir. Now look for the same thing, sir. This is the image. One patient is coming with the bulbar urethra injury. So the urine is accumulating in the perineum area, around the scrotum, around the penis, and in the anterior abdominal wall. Okay. Now, if there is a rupture of the membranous urethra, urine is accumulating in the deep perineal pouch. No swelling, no swelling, no swelling. And you will get the same integration in the radiology. So if anatomy will be strong, surgery, radio will be stronger. Okay, sir. Now, look, one question from the prostate, one question from the urethra. Sir, this is the prostatic urethra where the ductus deferens ejaculated ducts are opening. When you are looking from the front, sir, this is the your urethral crest where the prostatic urethra and ejaculated ducts are opening. Can you observe for the surgery? Here is the internal urethral sphincter. This is the external urethral sphincter site. Okay, sir. So these are the different lobes of the prostate: anterior lobe, posterior lobe, right lobe, left lobe, and this is the our median lobe. It is compressing and causing the prostatic urethra into the semi-knot shape. What I want to tell you, sir, whenever there is a prostate enlargement around the periurethral zone, it is causing the BPH. So the patient, old patient is coming to you with the frequency, hesitancy, urgency. So this is your case of the BPH. What you will do, sir, P for prostate, P for prazosin, P for phentolamine. Yes, these all are the alpha blocker. But best is the prazosin. Why? Because it is selective alpha 1 blocker. Okay, sir. But more better is the our tamsulosin. पक्का क्वेश्चन आएगा बेटा यहाँ से. This is the selective alpha 1A blocker. For the hormone treatment, you have to give the 5 alpha reductase inhibitor. Yes, sir. That is the our finasteride. Sure, any question from the anatomy or the surgery, from the pharma, from the medicine, you will see. Okay, sir. Cancer occurs at the peripheral area. Surgery question. Now for the treatment, what you will do, you will go from the urethra and now you will cut the prostate around it. This is known as transurethral resection of prostate surgery. So you will do the TURP procedure. You will go through the penile urethra and you will cut by observing into the monitor. But during this all activity, what can happen? Try to understand. When you are going inside, you can damage to this internal urethral sphincter. If it is damaged, in that situation, the ejaculation go upside, which is known as retrograde ejaculation. Why? Because you are damaging to the one important structure, that is the internal urethral sphincter. So this is the importance of the anatomy. Okay, so these are the your different integration which you have to learn. Now, one thing, remember, in the male, you will observe bladder and rectum. So peritoneum is making one pouch. This is the between rectum and the bladder. So this is the rectovesical pouch. Yes, it is the most dependent part in the male in erect posture. So pus collection is occurring here. So how you will remove the pus? Yes, pelvic area. You will puncture, you will aspire, you will inject the antibiotic, and if needed, re-aspire. But in female, can you see the bladder, then uterus, then rectum? So there are the two pouch. Yes, sir. One is uterovesical pouch and another is rectouterine pouch, which is also known as pouch of Douglas. So when you are doing the puncture, yes, it is better to go from the vagina. Okay, so this is pouch of Douglas importance. You will puncture, then aspire, then inject the antibiotic, and then re-aspire. But when any person is lying down, the pus is coming behind the liver, and behind the liver in front of the kidney. This is our hepatorenal pouch, which is also known as Morrison pouch. Yes, it is most dependent part in lying down position. Again, sun creates problem. Getting the point? So these are the points which you have to remember. So these are the things for the pelvis and perineum on the anatomy aspect. Now we are coming to the thorax, the coronary circulation we have to learn. Remember, no one can win every battle, but no man should fall without a struggle. कोई लक्ष्य मनुष्य से के साहस से बड़ा नहीं, हारा वही है जो लड़ा नहीं है. So let's struggle for this. All the things we are going to crack the exam. Very few questions are asked from this your thorax part. Yes, coronary circulation is important. Okay. Yes. Don't worry, you will complete the session. थोड़ा सा सेशन 4:15 हो सकता है, 4:30 हो सकता है. Don't worry. But we are at the end portion. Okay, छोटे छोटे से पार्ट बचे हुए हैं. See here. Yes, What is the most preferred site for the needle insertion in the thoracic cavity? Pleural fluid effusion. FMG July 2023. So intercostal space I will teach you. Yes, answer. Tell me the answer, beta. Tell me the answer. Sir, intercostal space. Lower border of the upper rib? No, sir. यहाँ पर तो आपका क्या मिलेगा? Intercostal मिलेगा. Okay? Intercostal vessels. Upper border of the lower lip? Yes, this will be the answer. How? I will tell you. Remember, this is the external angle of the Lewis. It is found at the T4, T5 junction. Yes. Identify the marked structure, FMG 2021. This is the your C-shaped trachea. This is the trachealis muscle. So only few questions are there. Can you see? Sir, the ribs, intercostal space, upper rib, lower rib, external intercostal muscle, internal intercostal muscle, innermost intercostalis. What you have to focus? Vein, artery, nerve. Getting the point? Yes. Remember, this neurovascular bundle is at the costal groove. Same sequence. Diagrammatic presentation. Can you observe? Upper rib. Can you see? The lower rib. Now try to understand further. Try to understand further. Sir, there is our extra intercostal, internal intercostal, and innermost intercostalis. Sir, there is the VAN. So never insert the needle here, it will get damaged. Always insert the needle just along the upper border of the rib. This is the thoracocentesis, paracentesis, thoracis. Yes, it is ideally done at the 8th intercostal space at the mid-axillary line, just along the upper border of the rib. All are following this Venn relation except the first intercostal space. Okay, sir. Now inner side, there is the our lungs. Yes, sir. There is our oblique and horizontal. Oblique and horizontal. Sir, there are the our two fissure. So you can observe, sir, upper lobe, middle lobe, basal lobe. But here only the oblique, so upper lobe and the basal lobe. Here is the cardiac notch and this part is known as lingula. Okay, sir. So these are aerated by the trachea. Yes, sir. These are aerated by the trachea. So trachea is dividing at the carina. Yes, carina, not the carina. That is the carina. So remember, it is the carina. It is dividing into the primary bronchus, then secondary, then tertiary. Then yes, you can see the further segmentation. Remember, beta, what is the sequence? Sir, the sequence is, look here, the notes, trachea, primary, secondary, tertiary. Primary is also known as the principal bronchus, secondary is known as the lobar bronchus, and tertiary is known as the segmental bronchus. Remember the bronchopulmonary segment. The bronchopulmonary segment, they are supplied by the tertiary bronchiole. Okay, so these are the points which you have to remember. Okay, sir. Now try to understand further. Yes, yes, लुजियाना, जब आप पढ़ा सकते हो तो इतनी मेहनत से, तो सर हम भी पढ़ सकते हैं। बिल्कुल बेटा, यही जज्बात होना चाहिए, यही होना चाहिए। मिलके करते हैं, क्रैक करेंगे एग्जाम को। ओके, याद रखना बेटा, लप्पू सा एग्जाम है, झिंगूर जैसे क्वेश्चन है, ऐसे ही कॉन्सेप्ट से हम बना देंगे। ओके, बस ये डायलॉग याद रखना, एग्जाम क्रैक कर दोगे, खुद पर भरोसा रखो, यू विल गेट सक्सेस डेफिनेटली। ओके सर, नाउ द लंग इज डिवाइडेड इनटू द 10 सेगमेंट, राइट as well as left. What you have to remember, the important point I'm telling you, sir, there are the 10 by 10 right and left lung bronchopulmonary segment. Okay, sir. But sometimes in left 9, sometimes 8 may be there. Few MCQs. The most common site for the infection in erect posture, better right posterior basal segment. In supine position, better right apical basal segment. Getting the point? Okay. Now try to understand pulmonary section, postural drainage, they are also useful. Okay. Don't worry, we will complete the class. A few minutes are also there, only there. So these are our heart. What you have to remember, the heart is having the 4 chamber. The right border is formed by the right atria. The apex is formed by the our left ventricle. And remember, the base is formed by the left atria and the right atria. Okay, sir. Main coronary circulation we are going to see. Sir, this is the ascending aorta, arch of aorta, descending aorta. In our aortic wall, you will see the anterior aortic sinus, which is giving rise to, itna bas yaad rakhna, anterior aortic sinus is giving rise to the, yes, right coronary artery, while the left posterior aortic sinus is giving rise to the left coronary artery. Bas beta itna hi yaad rakhna hai. Now we are going to look this 3D part. Yes, anterior aortic sinus, right coronary artery. Yes, this is the your left posterior aortic sinus, left coronary artery. Getting the point? Okay, sir. So this is the diagrammatic presentation. Right coronary artery, what are the branches? Sir, this is the right coronary artery. Follow. It is giving the small atrial branches, ventricular branches, and then it is going backside. So it is giving the marginal branch, then transverse branch, and the posterior interventricular artery. What are the main branches of the right coronary artery? Your mnemonic is MTP. यस ऑप्स की क्लास है. सो रिमेंबर MTP मेडिकल टर्मिनेशन ऑफ द प्रेगनेंसी फोरेंसिक की क्लास है, बहुत इंपॉर्टेंट. M for marginal artery, T for transverse artery, P for posterior interventricular artery. These are the main artery. One thing, posterior interventricular artery, it decides the cardiac dominance. Right cardiac dominance 90%, left cardiac dominance only the 10%. Which artery decides the your cardiac dominance? Answer is the posterior interventricular artery. Okay, sir. Now see, this is the left coronary artery. So the left coronary artery is dividing to the left circumflex and anterior interventricular artery. Also, it is giving the your diagonal artery. So your mnemonic is LAD, DAL. What you have to remember, sir, this LADA, anterior interventricular artery, it is the most common artery which is getting blocked. Sir, it is supplying the apex of the heart. When it is getting blocked, so males are getting death and females are becoming the widow. So which artery is known as the widow's artery? Your answer is the LADA. So these are the main artery supply. On this basis, now we start the your angina, MI, this all the clinical, the radiology, angiography. Yes, remember in coronary artery bypass grafting, the internal mammillary artery. I taught you the branch of the subclavian artery, VITCD. So this I was the internal mammillary artery which is used for the coronary artery bypass grafting. Important beta. Okay. Now look for this our diaphragmatic opening. So you are looking the diaphragm from the below. So I told you the voice of anatomy. Sir, there is the VENACAVA, vena cava. O for OESO, PHAGUS, and A for aortic hiatus. One question from the diaphragm. Okay, so just to see how many letters are there, sir. 1, 2, 3, 4, 5, 6, 7, 8. 8 letter T8 level. So nice. Sir, esophagus 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 letter T10. So beautiful. Yes, aortic hiatus 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12 letter. Yes, T12. It is just like the magic. The answer is hidden within the question. Yes, sir. Here is the image for all of you. T8, T10, T11. Now, what are the structures which are passing through the vena cava opening? Remember, inferior vena cava and right phrenic nerve. Okay, sir. Your mnemonic is V is equal to IR. This is the your V is equal to IR. Ohm's law. Anatomy integration with the physics. Then through the our esophageal opening. Sir, through the esophageal opening, left gastric, esophagus, vagus nerve, and these are passing through the esophageal opening. So your mnemonic is love. Aortic hiatus, so aorta, thoracic duct, and azygous vein. So this is your mnemonic. What you have to remember? Yes, love करोगे तो वोल्टेज और करंट लगेगा, क्योंकि लव करने के बाद तुमको आटा लेने के लिए या सब्जी लेने के लिए भेजा जाएगा. सो सैलमॉन बॉय वाज सेइंग लग गए 440 वोल्ट छोड़ से तेरे. अरे भाई, कोहली की बीवी को अगर छुओगे तो 440 के 880 वोल्ट का बोल्ट लगेगा. सो दिस इज द वन वेरी इंपॉर्टेंट टॉपिक. व्हाट आर द डिफरेंट स्ट्रक्चर्स पासिंग थ्रू हियर? यस, why this diaphragm topic is important, beta? Remember, because of the hernia. So there is the Morgagnian hernia and there is the Bogdalek hernia. B for yes, Bogdalek hernia, BPL. Bogdalek hernia, it occurs posteriorly and on the left side. So Morgagnian hernia, front and on the right side. Also in the surgery, you will see diaphragmatic hernia, sliding hernia, rolling hernia, meshed hernia. So you have to remember what are the different structures passing through here. Okay. Yes, yes, yes. Now beta, dermatome. So I'm telling you this dermatome concept. The each spinal nerve, sir, C8, T12, L5, S5. Okay. So these are the our different nerves. Okay. 20, 10, coccygeal is 1. So total 31 pairs of the nerves are there. And these nerves are supplying to the particular part of the skin. Yes, dermatome. One question from here. Segment of the skin is known as the dermatome. Okay, sir. What you have to remember? Judwa movie. Have you seen? एक भाई को थप्पड़ मारो तो दूसरे भाई को दर्द देता है. क्यों? क्योंकि दोनों की मम्मी एक है. रूट वैल्यू इज सेम. सेम कॉन्सेप्ट. दे आर सप्लाइंग द विसरा, बट विसरल नाउ दे आर पेनलेस, बट सोमेटिक नाउ दे आर पेनफुल. यस, भाइयों को देखो, बहनों को मत देखो. ओके, व्हाट आई वांट टू टेल यू, यस, दीज नर्व्स आर कॉजिंग द damage, inflammation of the different nerves. Okay, sir, here everything what I'm going to tell you, it is written now. Try to understand. Sir, this is the spinal cord. Sir, here is the our dorsal root, ventral root. Sir, it is making the trunk. Then it is making the ventral nerve. Sir, there are the two types of the nerve. One is supplying the viscera, while another is supplying the segment of the skin. One question sure from here. Okay, so this is visceral nerve, this is somatic nerve. These visceral nerve, they are painless, but somatic nerves, these are painful. So whenever there is the any inflammation in the viscera, yes, it is painless, तो बेटा दर्द यहाँ नहीं होता, but it is related with the same root value at the skin. So according to the physics, according to the physiology, law of projection, the pain will be felt at this segment of the skin. Sir, this segment I started with the same session, derma, skin segment, which is supplied a single spinal nerve, that is the dermatome. So visceral pain, they are coming to the our dermatome. Now, what is the rule? What I'm going to tell, that is in the YouTube channel also, as well as it is given in the your notebook also. So start. C1, do with me. No dermatome. C2, put the hand at the angle of the mandible. Yes, angle of the mandible, great auricular nerve, the shaving area is supplied by the C2. Then C3, yes, do with me. C3, supraclavicular nerve. C3, then C4, then C5, supraclavicular nerve. 3, 4, 5 keeps diaphragm alive. This is the root value of the phrenic nerve. So the phrenic nerve referred pain is coming at this tip of the right shoulder and the left shoulder. That's why in surgery, the liver gallbladder pain is coming to the tip of the right shoulder and tip of the our left shoulder. Splenic rupture, which is the KR sign. Yes, C1, no dermatome. C2, angle of the mandible. C3, C4, C5. Yes, then C5 up to the elbow, C6 up to the thumb. So this is the biceps jerk, C5, C6, Hilton law. C6, then C7, then C8. So this is the way. Hare Ram, Hare Krishna, Hare Ram. You can remember in this way. C6, C7, C8. Yes, 6, 7, 8. Median nerve, ulnar nerve. These are supplying the muscles. These are supplying the skin. They are supplying the joint. Hilton law. Now the T1, ulnar border of the forearm. T2, ulnar border of the arm. Yes, T2 is coming to the intercostal space. Intercostobrachial nerve. MCQ, intercostobrachial nerve is the our T2. Okay. Yes. Then T3 above the nipple. T4 at the nipple. T4 is the at the nipple. T5 below the nipple. So if there is the heart involvement, heart is supplied by T1 to T5. But whatever I'm telling you, that all the things are written here, na? You will get in the notes. So, sir, T1, T2, heart is getting inflamed, but the pain is not felt at the heart. Yes, it is felt on the dermatome, ulnar border of the forearm, ulnar border of the arm. Yes, precordium area. Then T5, T6, not important. T7, inferior angle of the scapula. T7, inferior angle of the scapula. That's why the pain of the gallbladder is coming to the right inferior angle of the scapula. Okay, sir. Then T8, T9, not important. T10, umbilicus, T10, umbilicus. This T10 is supplying the gonads. It is supplying the small intestine and the appendix. That's why the appendicitis, the orchitis and ophritis, this all refer to the our, yes, umbilicus. Now try to understand further. Sir, there is the L1, inguinal area. Sir, this is the ilioinguinal nerve, then L2, yes, then L3, and then L4. L4 is coming to the great toe. This was the question in the FMGE exam. Same. Now you can see, sir, this is the L5, and here is the our S1. Now turn this person. This person. The S1 is running from down to the above, and then S2 is running from down to the above. So ankle jerk, S1, S2, skin is same segment. Tendo-achilles is here, same root value, and the ankle jerk is having the same root value. And at the last bit, remember, these all are very, very beautiful. Then S3, S4, S5. Anal reflex root value S3, S4, S5. And now at the last, I want to tell you the root value of the jerk. Yes, see here, you can remember with this way. 1, 2, 3, 4, 5, 6, 7, 8. Okay, yes, again. Just reverse ना. ऐसा करना बेटा आपको jerk. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, S1, S2, ankle jerk. 3, 4, L3, L4, knee jerk. 5, 6, C5, C6, biceps jerk. 7, 8, C7, C8, triceps jerk. How to remember this? Hilton law jerk. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. So this is the one beautiful integration which you can remember. Agree, everyone? Okay. So this is about our dermatome. One more thing, better remember, this is the L4. The superficial peroneal nerve is supplying, except the first wavy space supplied by the deep peroneal nerve, and the sural nerve is supplying lateral border of the foot. And remember, sir, the medial part is supplied by the saphenous nerve, important for the NEET PG exam. Okay, sir. Now, what I want to tell you, sir, एम्ब्रियोलॉजी, द इंपॉर्टेंट फैक्ट्स वी आर गोइंग टू सी। उसे गुमा है कि मेरी उड़ान कुछ कम है, मुझे यकीन है कि ये आसमां कुछ कम है, मंजिलें उन्हीं को मिलती है जिनके सपनों में जान होती है, पंखों से कुछ नहीं होता दोस्त, हौसलों से उड़ान होती है। सो व्हाट आई वांट टू टेल यू बेटा, इंपॉर्टेंट पॉइंट्स अबाउट आवर एम्ब्रियोलॉजी। सो आई एम गोइंग टू कवर द इंपॉर्टेंट फैक्ट्स ना। कॉन्जेनिटल डिफॉर्मिटी, this is nothing sir, it is our anencephaly as well as cranioschisis. So this is our entire portion, yes sir, anencephaly and cranioschisis. CNS development you have to see. Okay, can you see the embryology class, congenital defect? So this is nothing, this is the your anencephaly, FMG 2021 anterior defect. So simple. Okay, now can you see the question, the arch artery? Yes, pharyngeal arches you have to learn. A small chin is formed by the first arch, so answer is the first arch. Simple. What you have to remember beta? Yes, meconium is coming. So in surgery you will see the vitelo-intestinal duct, it is making the Meckel's diverticula, it is making the our, yes, connection with the umbilicus. So answer is the vitelo-intestinal duct. Why? Because meconium is coming from here. Very good, very nice answer, very nice, very nice beta. Okay, now can you see there is one more question, urine is coming out through the umbilicus. So this is nothing, this is the uricus. So umbilicus is important. So the important fact, see here sir, ductus arteriosus ligamentum arteriosum. Sir, ductus venosus ligamentum venosum, the remnant. The foramen ovale, it will make the fossa ovalis. Sir, allantois is making the uricus median umbilical ligament. MCQ. This is the NEET PG question. Umbilical artery, medial umbilical ligament, and umbilical vein, ligamentum teres hepatis. Okay. Now, what I want to tell you, sir, the pharyngeal apparatus in the baby. Sir, this is the head bulge, this is the cardiac bulge, upper limb bud, lower limb bud, and this is the your, yes, pharyngeal arches. Yes, this is the pharynx part. So near the pharynx, very special structures are developing. These are the pharyngeal apparatus. Remember, pharyngeal apparatus is equal to pharyngeal arch plus pharyngeal cleft plus pharyngeal pouch. Okay, so these are making the structures near the neck. बेटा ये इधर उधर की चीज नहीं बनाएगी, ये नेक की चीजें ही बनाएंगी. Okay sir. Now when you will observe, can you see the outer layer is the ectoderm, inner layer is the endoderm, and in between them there is the mesoderm. So this mesoderm is making the arch, this endodermal outbulging is making the pouch, and ectodermal, yes, ectodermal indipping, they are making the cleft in the baby. Okay sir, these all are combinedly known as pharyngeal apparatus. Now look here, this is the dorsal view. आपको क्या करना है, आपको बेबी को पकड़ना है और एग्जैक्टली पीछे से देखना है. So this is the dorsal view. Sir, these are the our pharyngeal arches. Here are the our, yes, pharyngeal cleft, and you can observe the pharyngeal pouch inside. Yes sir, same diagrammatic presentation. So during the development, total there is the 1, 2, 3, 4, and 6 arch, because fifth arch disappear. Sir, here is the first cleft, second cleft, third cleft, and fourth cleft. 4 cleft are there, and this is first pouch, second pouch, third pouch, and fourth pouch is there. 4 pouches are there. Simple beta. Now what you have to, oh again sorry, this image due to the technical issue it is gone. Okay, so I'm just completing this table now, sorry for that. First arch, every arch is having one nerve. First arch nerve beta, remember, mandibular nerve. Second arch, facial nerve. Third arch nerve beta, remember, that is the our glossopharyngeal nerve. Fourth arch is, remember, the vagus nerve, which you can remember with the branch superior laryngeal nerve and the recurrent laryngeal nerve. Okay, okay sir. Now look, the muscles, I'm just verbally saying. The first arch, it is giving rise to the total 8 muscles, 4 muscles of mastication, then MAT2. You can remember the our mylohyoid, entry belly of digastric, then tensor tympani and tensor palatini. Okay, facial muscle, second arch, it is giving rise to the muscles of the our face. So remember, these are our SPF, sir, stylohyoid and stapedius, sir, platysma, and F for you can remember the facial muscle, P for you can remember posterior belly of digastric. Third arch, only one muscle, that is our stylopharyngeus. Fourth arch, that is having the our muscles of the palate, muscles of the pharynx, and the cricothyroid. Only these things you have to remember, short and sweet way. Sixth arch, it is giving rise to the all the muscles of the larynx. But one exception, except cricothyroid, it is a muscle of the fourth arch. Okay, and in the similar way, in the palate, sir, there is the one muscle tensor palatini, it is the muscle of the first arch, and in the similar way, in the pharynx, the stylopharyngeus is the exception, which is the muscle of the third arch. Okay. Now, the first arch cartilage, it is giving rise to the 5M. I'm telling you orally, what are the 5M? M for malleus and incus, then M for mandibulosphenoid ligament, then M for anteromalleolar ligament, then M for mandible, and M for maxilla. Yes, the second arch, it is giving rise to the 5S. What are the 5S? You can remember the stapes, styloid process, then styloid ligament, and then you can remember the yes, superior cornu of the head and smaller cornu of the head and superior half of the body of the head. Now, the third arch will give rise to the our remaining part of the head. Yes, the greater cornu and the lower part of the head. And remember, the fourth arch and sixth arch, they are making the our cartilage of larynx. Okay, beta? Fine. Now look for the artery. First arch artery, only one thing, one line, maxillary artery. Sir, second arch artery, you have to remember the hyoid and stapedial artery. And the third arch, you have to remember the common carotid artery, internal carotid artery, and external carotid artery. Simple. Fourth arch artery, remember beta, on the left side, arch of aorta, while on the right side, right subclavian artery. Yes. The sixth arch artery, it disappear. Yes, it is making the pulmonary artery. But what you have to remember, sir, this sixth arch on the left side, it is making the our ductus arteriosus, which is making the ligamentum arteriosum. If it is obliterating, then there is a patent ductus arteriosus, and on the right side, it disappear. Okay. So these are the points. One important thing which I am going to tell you, all muscles of the palate, sir, these are derivative of the fourth arch. So these are supplied by the nerve of the fourth arch, vagus nerve, better to say pharyngeal plexus. But one muscle, tensor palatini, it was a derivative of the first arch. So it is supplied by the mandibular nerve, MCQ. Okay. Pharynx, all muscles of the pharynx, they are coming from the fourth arch. So these are supplied by again vagus nerve, pharyngeal plexus, vagoaccessory complex, except stylopharyngeus, it was derivative of the third arch. So it is supplied by the nerve of the third arch, glossopharyngeal nerve. Now, larynx, all muscles of the larynx, they are derivative of which arch? Sir, sixth arch. So these are supplied by the recurrent laryngeal nerve. Okay. But except cricothyroid, it was a derivative of the fourth arch. So that's why it is supplied by the nerve of the fourth arch. Sir, which is the nerve of the fourth arch? Answer is the our vagus nerve, pharyngeal plexus, vagoaccessory complex. Tongue, these are developing from the occipital somites. So 12th nerve, except beta, remember the palatoglossus, which is the muscle of the fourth arch. So again, it is supplied by the vagus nerve, vagoaccessory complex, pharyngeal plexus. So these are the four exception which you will integrate in the ENT portion. Agree everyone? Getting the point? Now, this is the pharyngeal cleft you will learn in the surgery. All the pharyngeal cleft, they disappear except first. It is making the external meatus. Itna padana hai. But if they are persisting, they will make the pharyngeal cleft pharyngeal sinuses, which you will integrate in your radiology part also. Okay. Now see the pharyngeal pouch. Sir, first pouch, it gives rise to the tubotympanic recess, middle ear cavity. Second pouch, palatine tonsil. Third pouch, dorsal part, parathyroid 3, ventral part, thymus. The fourth pouch, it is making the dorsal part, ventral part, parathyroid 4, and the ventral part, lateral thyroid element. These are the endodermal origin. Now, if there is the problem, remember the third pouch is giving rise to parathyroid 3, which is coming down, inferior parathyroid, while the fourth pouch, it is going upside. So it is making the superior parathyroid. If there is the problem in this part, then the different clinical, like the Dye-George syndrome, yes, like the your Treacher-Collins syndrome, first arch syndrome, this all the first arch derivative will be affected. Robbins-Pierre syndrome, you will see, yes, these are the points. Development of the tongue is important. I'm just telling you one fact. See here, the tongue is developing from the our first arch, second arch, and the first, second, third, fourth, but the second arch is overlapped. So this is the first arch. Tongue is important. This is the your third arch, and this is the posterior most part. What you have to remember? Yes. This is our anterior 2/3, posterior 1/3, and this is the posterior most part. What you have to remember, beta? Anterior 2/3, the nerve is general sensation, spatial sensation. Yes, general sensation, special sensation. General sensation, special sensation. The general sensation entered to third by the your lingual nerve because it is the derivative of the which arch? First arch. Getting the point? Yes, this is the your third arch and this is the your what? Fourth arch. Okay. Yes, thank you, Meow. Thank you, beta. Thank you. I also miss to all the dear students. Now see, the first arch nerve is the lingual nerve. That's why. Now, special sensation on the first arch, this is carried by the chorda tympani, which is the branch of the facial nerve. Now try to understand the posterior one third, third arch, nerve of the fourth, third arch, glossopharyngeal nerve. Do you remember? जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. So this is supplied by the glossopharyngeal nerve. Okay, sir. Now the posterior part here is the vagus nerve. So the general sensation and special sensation both are supplied by the vagus nerve because the nerve of the fourth arch is our vagus nerve. So this is very important. Tongue is important. Agree, beta? Okay. Okay. Thank you, Yash. Thank you. Thank you. I miss you all. अच्छे से तैयारी को बेटा you all will get selection. Thank you. Love you all. Now the embryology portion. Look here. You all are aware ovulation is there. Then there is our morula formation, blastocyst formation. See here. Zygote, 2-cell stage, 4-cell stage, 8-cell stage. Then there is a 16-cell stage, morula on the third day. Then there is the advanced morula stage, which is 32-cell stage. One update, yes, advanced morula. So there was the one question, beta. Morula is, so according to the update, 32-cell stage. So remember, morula is 16 to 32-cell stage. Okay. Implantation occurs on the 6th day, but 6th was not given. So answer was the 7th day. Okay, sir. Now there is the sucking of the uterine fluid. So cyst is formed. This is the blastocyst. 32-cell stage. It is formed on the 4th day. Now see, the cells are making the mass inside and outside. Inner cell mass and outer cell mass. Inner cell mass, these are now converting into the special cell epiblast. Remember, सबका मालिक एक है, सबका पापा एक है. कौन? Epiblast. First germ cell layer of the all cells. Yes, epiblast cells. So now this epiblast, they are becoming the columnar and it is giving rise to the hypoblast. So remember, this epiblast is making the hypoblast, which is converting into the endoderm. So first germ cell layer, MCQ, endoderm, which is formed by the hypoblast. Now look here, the hypoblast is giving rise to the one membrane, Husser's membrane, which is having the cavity primitive yolk sac. Remember this primitive yolk sac, it is making the GIT, which is endodermal. Yes, this yellow color is presenting the endoderm. Now there is the one another cavity is formed, that is amniotic cavity. Opposite it, there is the amniogenic cell. Now try to understand, there are the two cells, epiblast and hypoblast. Okay, sir. Now we are looking this lateral view from the above, so it is appearing rounded. Sir, this is the bilateral disc. So what is happening? Try to understand. Sir, the endoderm बोलता है मुझको गुस्सा आया और मैं डिवीजन करूंगा. So endoderm is making the one plate like structure, procaudal plate. Okay? Yes. Now when you will look above, there is a one elevation. It is deciding the head and baby. Yes, it is the our head end of the baby. Craniocaudal axis is decided by procaudal plate. MCQ. Now look here. एपीब्लास्ट को गुस्सा आता है, एंडोडर्म तू डिवीजन किया. अब मैं तुझे बताता हूं. Now the epiblast, it is growing fastly and it is making one cord-like structure. It is making one cord-like structure. Sir, this is your primitive streak. So primitive streak is coming from the our, yes, this cord, this primitive streak is coming from our ectoderm. Now this is deciding the right and left half of the body. So this is the your question. We are going to cut the baby at this level. So you will observe, sir, primitive streak, epiblast, endoderm. So this primitive streak is giving rise to the one new germ cell layer, mesoderm. For MCQ, first germ cell layer, endoderm, second germ cell layer, mesoderm, and last is your epiblast, which is making the ectoderm. So this is the your final presentation. Sir, there is a ectoderm, mesoderm, and endoderm. Within the mesoderm, there is a one cord-like structure, notochord is there, which is getting disappear and making the nucleus pulposus. एक line याद रखना है, notochord disappear and it forms the nucleus pulposus, which is the gel-like structure within the intervertebral disc. If it is getting herniated, it will compress the nerve and it will cause the radiculopathy. So this is the your MCQ. Okay. Now, yes, you are right. Sacral agenesis because of the primitive streak. Yes, you are right, beta. Now see here, there is the proliferation by this notochord and it is making the plate-like structure, neural plate. This neural plate is then showing the depression, neural groove, and then it is making one rounded structure, neural tube. Yes, during the class, I told you this concept. See here, sir, neural plate, neural groove, and then there is a neural tube. There is an anterior neuropore, there is a posterior neuropore. Anterior neuropore is closed on the 25th day, MCQ. Posterior neuropore is closed on the 28th day, MCQ. Yes. The cranial portion, it will make our brain, while the caudal portion, it will make the spinal cord. Complete. Again, neural plate, neural groove, neural tube, entry neuropore, posterior neuropore. For this closure, the vitamin B9 is important. I told you this, all the things, it is written in the your notes. If entry neuropore defect, then anencephaly, posterior neuropore defect, then there is the our, yes, remember, sir, it is leading to the our meningocele, meningomyelocele, and craniostasis. So this is the your surgery integration. Now look here, the neural crest cells derivative. These are migrated by the help of the hyaluronic acid, and it is migrating and making the different important structure like the meninges, sclera, choroid. Yes, within the teeth, odontoblast, melanoblast. It is making the orbic plexus. If there is a failure of the migration of the our neural crystals, it will result into the achalasia cardiac medicine surgery integration. Okay, yes, it is making the your connective tissue of the pharyngeal apparatus also adenomedulla also. तो बेटा ये रटने वाली चीज है, ये लिस्ट बना के रटने वाली चीज है. आई हैड गिवन द वन निमोनिक पिट्स डिस्को एमएमएम, तो ये आप इसको याद कर सकते हो. आई टोल्ड यू दिस न्यूरल क्रस्ट सेल्स डेरिवेटिव. Yes, it is important, beta. Now, at the last portion, that is the histology. Now, just give me the 10 minutes and we are completing this, our entire bullet train anatomy. It is complete now. Okay, so thank you very much for your all of the support. Just 10 minutes. What you have to remember, beta? Yes. हिम्मत मत खोना, अभी बहुत आगे जाना है. जिन्होंने कहा था कि तेरे बस का नहीं है, बस उन्हीं को करके दिखाना है. Okay, so let's start this beautiful word of the color, the histology. Yes, FMG January 2023, FMG 2023, there was the one question which had been asked. The multiple layer was here, non-keratinized stratified squamous epithelium, we will see there. Okay, yes, December FMG epithelium, they are asked. Fallopian tube, it is lined by the your ciliated simple columnar epithelium. So few questions are asked. Yes, this is the obs-gynae physiology integration. The arrow was given over the one follicle which is having the single cavity, that's why you will say the our, yes, antral follicle. If multiple cavity, then you will mark the pre-antral follicle. Now you will see at the time of the exam what is your answer. Okay, so now what you have to remember. Yes, thank you very much. What I want to tell you, मैंने बेटा कहीं पर भी कंटेंट में कमी नहीं की. 99% सेम कंटेंट है, थोड़ी बहुत चीजों को हटाया है जो बिल्कुल यूजफुल नहीं थे. अदरवाइज जो चीजें हम 4 दिन में पढ़ते थे, उसी चीज को मैंने आपको ओआरआर में 1 दिन में पढ़ाया है, और उसी चीज को अभी हमने आई थिंक 6 घंटे हो गए हैं, 6 घंटे में पढ़ाया बेटा. यस, आई ट्राइड माय बेस्ट एंड थैंक यू टू ऑल ऑफ यू फॉर दिस ब्यूटीफुल सपोर्ट. थैंक यू टू द सेरिबेलम टीम. बेटा मैंने अपनी कोशिश की कि वही जो 4 दिन का कंप्लीट कंटेंट है जो ऐप में 40-50 घंटे में, वही चीजें कहीं पर भी हमने कटिंग नहीं की बेटा. ओके, सो दीज आर द डिफरेंट इपिथेलियम, यू ऑल नो. कैसे इन चीजों को पहचानना वो मैं आपको बताने जा रहा हूं. आई एम हैविंग द स्पेशलिटी ओवर दिस टॉपिक हिस्टोलॉजी, टाइम सिंस डेथ फ्रॉम द आवर हिस्टोलॉजिकल चेंजेस इन द ह्यूमन लिवर. इस टॉपिक के ऊपर केजीएमसी लखनऊ में मुझको एक बढ़िया सी अपॉर्चुनिटी मिली थी, गॉड के कारण, आप सभी लोगों के सपोर्ट के कारण मुझे वहां पर फोरेंसिक एनाटॉमी का चेयरपर्सन बनाया गया था. तो वो एक एक्सपीरियंस मैं आप लोगों के साथ शेयर करने जा रहा हूं. दिस इज द योर हिस्टोपैथोलॉजी. यू आर टेकिंग द टिश्यू एंड प्रिजर्विंग द फॉर्मेलिन. एमसीक्यू, किसमें प्रिजर्व करते हैं? फॉर्मेलिन. देन यू आर टेकिंग द एल ब्लॉक, कॉपर मिड ब्लॉक. देन यू आर यूजिंग द मैक्स मेल्टेड वैक्स. देन यू आर पुटिंग द टिश्यू हियर. अब बेटा इसको कट करना है, कैसे कट करना है? एमसीक्यू. दिस इंस्ट्रूमेंट इज द माइक्रोटोम. यस, हियर वी आर फिटिंग द टिश्यू विद द मैक्स एंड वी आर कटिंग एंड वी आर यूजिंग द थिन स्लाइड्स. यस, और बेटा इसको फिर हम स्लाइड में लगाते हैं. व्हाई आई एम टेलिंग यू, क्योंकि ये आसानी से चीजें नहीं दिखती. यू आर कटिंग प्रॉपरली एंड नाउ यू हैव टू कलर द बेस्ट कॉन्ट्रास्ट इन द वर्ल्ड, दैट इज योर रेड एंड ब्लैक. बट रिमेंबर बेटा, दिस ब्लैक एंड व्हाइट, इट इज ऑल्सो गिविंग द आर्टिफैक्ट. कचड़ा होता है तो वो ठीक से दिखता नहीं था. तो बेटा अगला कौन कॉन्ट्रास्ट है? सर ब्लू एंड रेड, स्पाइडरमैन कलर. Yes, this is the very good contrast. On the background of the blue you can see the pink, on the background of the pink you can see the blue color. So this is your histology basic concept beta. Remember, this blue color is nothing, this is our hematoxylin. This red color is nothing, this is the eosin. Remember, this is the basic in nature while this is acidic in nature. Agree beta? Okay sir, so we are going to dip this all the things, we are making the proper color. तो बेटा टिश्यू में जो एसिड होगा वो बेस को प्यार करेगा, और जो बेस होगा वो एसिड स्टेनिंग लेगा. सो व्हाट आई वांट टू टेल यू, लुक हियर सर, बेसिक कॉन्सेप्ट. सेल, देयर इज द डीएनए in the nucleus. DNA is acid, so it will take the basic dye. Who is the basic dye? Blue color, hematoxylin. So whatever the structure which is blue, definitely that is the nucleus. Nucleus is your friend, na? Now the cytoplasm, the cell membrane, the pH is, remember, approximately, that is our, just 1 minute. Okay, just 1 minute. Sorry again for this little technical issue. Just a few seconds, ये ठीक हो जाएगा, है ना? Yes, everything is okay now. Sorry for this little technical issue, बेटा. Just almost we completed ना, just ये छोटी सी कुछ चीजें बची हुई हैं. Yes, thank you for your support, sir. Cytoplasm pH near about the 7.3 7.4, so it is basic in nature. बेटा जब ये base है तो ये acidic stain लेगा, so it will appear reddish in color. Yes, pink or red in color. Getting the point, बेटा? Okay, so in this pink background, you can easily identify this red color. So this is the importance of the your contrast. Remember, आप बेटा पिंक बैकग्राउंड में न्यूक्लियस ब्लू कलर को देख सकते हो. सो रिमेंबर न्यूक्लियस इज योर फ्रेंड. सो इफ nucleus is parallel to the basement membrane, then remember, sir, it is the our flat squamous epithelium. If nucleus is rounded, then it is the cuboidal epithelium. If nucleus is 90 degree to the basement membrane, then it is your, yes, columnar epithelium. Okay, sir. So with this help, can you see? Look all across. और बेटा उसके बाद diagnosis बनाना. Can you see the pink color line? Sir, basement membrane. Can you see? These are having the flat nucleus to the basement membrane. तो बेटा आंख बंद कर दो और बोल दो ये flat squamous epithelium है. Yes, there is no staining. तो बेटा ये क्या है? Sir, this is the air. Yes, this is the कौन सा साइट हमारे बॉडी में? लुक एट द ऑप्शन, दिस इज द लंग. व्हेन यू विल अंडरस्टैंड द हिस्टोलॉजी, देन यू विल बी एबल टू अंडरस्टैंड द योर पैथोलॉजी. निमोनिया, द लंग एल्वेoli filled with the your, yes, inflammatory cells. Now look here, the rounded nucleus means this is nothing, this is the cuboidal epithelium with the lumen. Sir, this is our PCT DCT, or it may be the thyroid gland. So you will be able to understand in the kidney there is the PCT DCT which is having the our pus eosinophilic staining. So the PCT DCT, they are appearing like the thyroid, which is the thyroidization of the tubule. When you will understand the thyroid epithelium histology, then you will be able to understand the thyroidization of the kidney pathology. What I want to tell you, beta, yes, this is the our layer where you can see the fine striation. This is the pseudo stratified layer because all the cells are connected to the basement membrane. Remember, beta, this is related with the SBI again, situs inversus, bronchiectasis, and the infertility. This is the Carter-Jenner syndrome. This epithelium is involved and resulting in the bronchiectasis. This is the pseudo stratified columnar epithelium. Now can you see the cells are long but the nucleus are round? But remember, the maximum feature height is more. That's why you will say, sir, it is columnar epithelium which is found in the GIT. Now look for the next slide. The multiple layers you can see. Okay, and uppermost layer, they are parallel to the basement membrane. So this is the stratified squamous epithelium. If you will get the thick red layer on the upside, so you will say this is the keratinized, and if this keratin is absent, then non-keratinized. Simple. Now try to understand the uppermost layer, sir. It is having the innermost depression. Yes. Just to use one stick, it is appearing like the umbrella. Umbrella means urothelial cells. Now just look here, sir. This is the your skin. How you will identify? With the help of this pigmentary structure. This is the hair, and can you see the fat is washed within the acetone and alcohol. So this is the your sebum cavity. Yes, the sebaceous gland which are holocrine in nature. If the duct is blocked, then it will result in the sebaceous cyst and acne will happen. This is the your skin integration, beta. Okay, now can you see the dark band, light band, dark band, light band? So definitely this is the skeletal muscle. And if you are seeing the same dark band, light band, dark band, light band with the intercalated disc, so this is the heart, myocardium. Because when you will able to understand this myocardium, you can easily understand the Ashkoff body. Yes, this Ashkoff body are found in the rheumatic heart disease. Their normal is histology, but abnormal is your pathology. Okay, so when there is an inflammatory cells, yes, this will be the your myocardial infarction. Okay, now the bone is very easy because you will see the Haversian canal, you will see the Walkman canal. Yes, खटमल के जैसे गोल गोल आपको तैरते हुए चीजें नजर आएगी, कोई स्टेन नहीं है. That is your bone. Now the most important topic, better remember, that is your cartilage. Okay, how you will identify cartilage? First identify the chondrocyte, then identify the matrix. Yes, how you will identify the cartilage? Nucleus, then clear space lacuna, then nest of the cells. This is the chondrocyte. Now look at the outside of the chondrocyte. Sir, there is the no any kind of the our fiber, no kachada, clear dikh raha hai. So definitely this is the hyaluronic acid. Sir, this is the hyaline cartilage. Yes sir, it is our hyaline cartilage. Okay, where this hyaline cartilage is formed? So remember the mnemonic, हाय गर्लफ्रेंड की कार, गर्लफ्रेंड तो मिली ही मिली, साथ में कार भी मिल गई, सोने पे सुहागा, हाय जीएफ कार. जी फॉर ग्रोथ प्लेट, F for fetal cartilage, C for costal cartilage, A for articular cartilage, R for respiratory tube cartilage. Okay, now look, this is the another cartilage. Sir, nucleus is seen, sir, clear space lacuna is seen, and chondrocytes. Yes, there are our chondrocytes. Fine. Can you see the single double fiber means it is the elastin fiber, means it is elastic cartilage. Where this elastic cartilage is formed, you can remember the 3E. E for ear, pinna, soft hai. Eustachian tube, soft hai. Epiglottis also, it is very soft. Yes, tip of the nose, it is very soft. Tip of the arytenoid cartilage, trichromatoid cartilage, and corniculate cartilage, you can remember. Getting the point, everyone? Okay, now last cartilage, fibrocartilage. Look outside the chondrocyte. Can you see thick red wavy bundle? Sir, these are our collagen fiber, these are our fibrocartilage. Yes, where this fibrocartilage is found, your mnemonic is Fiat logo. F for fibrocartilage. Yes, I for intervertebral disc, A for articular disc, T for tendon insertion, L for labrum, glenoid labrum. And last, types of the collagen. बेटा एक क्वेश्चन यहां से आता है, सर, because of the collagen disorder type, till now 28 types of the collagen are there. Type 1, type 2, type 4 are important. Type 1, sir, it is found in the bone. Yes, it is found in the BAL, ball. B for bone, A for aponeursis, L for ligament. इतना ही याद रखना, इससे ज्यादा कुछ याद नहीं रखना है. Sir, aponeursis is nothing. This is the flat tendon. So tendon is also having the your what? Sir, tendon is also having the your same thing. Sir, this is having the our, yes, type 1. But you know cartilage, sir, cartilage. So remember, type 2 is found in the cartilage. Very important. इतना ही याद रखना है. And the type 4. So type 4 is found in the glomerular basement membrane and pulmonary basement membrane. Yes, if there is the mutation, then glomerular basement membrane will be abnormal. So there will be the hematuria. Pulmonary basement membrane will be abnormal. So there will be the hemoptysis. So never forget, one patient is coming to you with the hemoptysis, hematuria, and there is a mutation in the type 4 collagen. Close the eye and say, yes, it is the case of the good posture syndrome. No excuse. So you will see the collagen arrangement proper. So this is the your dense collagen, but irregular. So yes, it is the loose collagen. So this collagen is important. Now start the your connective tissue disorder on the basis of the collagen and cartilage. Rheumatoid arthritis, SLE, keratoconjunctivitis, sicca, this all. Then you will be able to understand the vasculitis, because the connective tissue is there everywhere in the body. And that's why the last message, anatomy is beyond the bones, muscles, nerves, and the vessels. When abnormality in the anatomy occurs, then surgery, medicine, and all other subjects are important. That's why don't study only the anatomy, but learn the CBI anatomy and the anatomy 360. मेडिकल लाइफ में बेटा अगर बुलेट ट्रेन CBI anatomy नहीं पढ़ा तो क्या anatomy पढ़ा? So these are the final message, बेटा. Life is better when you are laughing. Don't do just chill. And at the last, better, real Spider-Man, the real life hero, our all the respected teachers, our God, our parents, our Dr. APJ Abdul Kalam. Remember, success is not permanent and failure is not the final. Never stop working after the success and never stop trying after the failure. बेटा अगर एग्जाम में सेलेक्ट हो गए तो क्या आप दुनिया जीत गए? नहीं बेटा, फिर से लड़ाई चालू होगी, फिर से स्ट्रगल चालू होगा. आप सेलेक्ट हो जाओगे लेकिन फिर से एक लड़ाई चालू होगी. आप सक्सेस हो गए ऐसा नहीं. और बेटा अगर बाय द वे किसी कारण से क्या एग्जाम में फेल हो गए तो क्या यह जिंदगी का अंत है? नहीं. आदमी या तो जीतता है या फिर सीखता है. आदमी हारता कभी नहीं है. आदमी हारता उस दिन जिस दिन वो कोशिश करना छोड़ देता है. बेटा एक चीज याद रखना, क्यों डरे जिंदगी से? क्यों डरे जिंदगी से कि क्या होगा? अरे कुछ नहीं होगा तो कम से कम तजुर्बा तो होगा. ऑल द बेस्ट. गॉड ब्लेस यू ऑल. Thank you for your all kind of support. These are the contact. Beta, if any kind of the doubt, 91317 83495, you can message.